Ministers of Finance, distinguished representatives of the World Bank Group, development partners, private sector leaders, members of civil society, youth leaders, distinguished ladies and gentlemen, you are warmly welcome to this beautiful city of Accra, Ghana, for Making Health Work for West and Central Africa, the official launch of this strategy to transform vision into impact. Ladies and gentlemen, a round of applause. Fit to prosper, investing in health for jobs and development in Western and Central Africa. Ladies and gentlemen, our gathering here today is a reminder that health is not simply a social priority, it is an economic imperative. And of course, investing in health and nutrition, by now we know, is fundamental to productivity, it's fundamental to jobs, it's fundamental to growth, and ultimately, the prosperity of this beautiful continent we call Africa. The strategy we are about to launch, the strategy we are about to be a part of today, represents a shared commitment to advancing universal health coverage, strengthening health sovereignty, and positioning health as a driver of development for a healthier, stronger, and more prosperous Africa. And so with that said, ladies and gentlemen, I will be your host throughout the entire day. My name is Anita Erskine. But to bring you the official welcome, I will yield this power to set the tone for today's important conversation to the Honorable Minister of Health for the Republic of Ghana. Please warmly welcome Honorable Kwabena Minta Akando.
Thank you very much. The Vice President of the World Bank, Ms. Mamta, Honorable Ministers of Health and Finance, Divisional Director of the World Bank, Mr. Robert, Your Excellencies, Ambassadors and High Commissioners, representatives of the World Bank Group, development partners, colleagues from sister African countries, and today I've seen a lot of my colleagues, ministers from the African countries. Chief directors, directors and heads of agencies, health sector stakeholders, distinguished invited guests, ladies and gentlemen, good morning. It is my great honor and pleasure to welcome you all to Accra for the official launch of the World Bank Regional Health, Nutrition, and Population Strategy. On behalf of His Excellency, the President of the Republic of Ghana, John Dramani Mahama, the government and the people of Ghana, I extend our warmest greetings to you all and our profound appreciation to the World Bank for choosing Ghana for the venue for this important regional event. Your presence here today reflects the seriousness with which we collectively regard the health, nutrition, and population agenda of our continent. It also reminds us that the challenges before us are not isolated national challenges. They are regional, interconnected, and increasingly complex. Therefore, the solutions we design must be equally coordinated, forward-looking, and firmly anchored in the realities of our people. Distinguished ladies and gentlemen, health remains the foundation of human capital, productivity, and sustainable development. No country can build a strong economy on the back of a weak health system. No society can fully realize its potential if its children are malnutritioned, if mothers are unable to access safe care, if young people lack the conditions to thrive, or if families are pushed into poverty because of the cost of illness. Across our region, we continue to confront persistent health challenges. Communicable diseases remain with us. Malnutrition continues to undermine the prospect of many children. Maternal, newborn, and child health still requires sustained attention. At the same time, we are seeing a rising burden of non-communicable disease, climate-sensitive health risk, mental health concerns, and the increasing need to build health systems that can withstand shocks, whether from pandemics, conflicts, economic pressures, or climate events. These challenges are unfolding against the background of a rapid demographic change, urbanization, population mobility, and growing expectations from our citizens for health services that are available, affordable, reliable, and dignified. The message from our people is clear. They do not only want facilities, they want functional facilities. They do not only want promises, they want systems that respond when they need them most. It is for this reason that the World Bank Regional Health, Nutrition, and Population Strategy is both timely and welcome. It provides evidence-based investment in health systems, strengthening nutrition, population dynamics, and human capital development. We commend the World Bank for placing emphasis on results, equity, sustainability, and regional collaboration. Those are not abstract principles. They are the very conditions required to accelerate progress towards healthier, more productive, and more resilient societies. For Ghana, this strategy strongly aligns with our national health priorities and with the broader vision of His Excellency, the President of the Republic of Ghana, to build a more inclusive, resilient, and self-reliant health system. Ghana remains committed to universal health coverage, guided by our Universal Health Coverage Roadmap 2020 to 2030, which envisions a country where all people have timely access to high-quality health services without financial hardships at the point of use. In giving practical meaning to this commitment, government is advancing a number of flagship priorities. Free primary health care initiative is intended to remove financial barriers at the first point of care, strengthen prevention, promote early detection of disease, and reduce the progression of conditions that should have been managed earlier within the primary health care system. Alongside this, the Ghana Medical Trust Fund, also known as Mahama Cares, has been established to provide dedicated support for non-communicable disease and specialized conditions, including kidney failures, cancers, cardiovascular diseases, and other high-cost conditions that place a heavy burden on families. Together with the National Health Insurance Scheme, these interventions are designed to create a stronger continuum of care, from prevention and early detection to treatment, referral specialist care, and financial protection. This is a practical expression of our belief that health policy must not remain at the level of aspiration. It must translate into services that ordinary people can feel in their communities, in their clinics, in their hospitals, and in their households' budgets. Distinguished guests, Ghana is also developing a comprehensive universal health coverage compact. This compact will serve as a strategic framework for aligning domestic resources, reforms, and external support behind measurable results in primary health care, financial protection, service quality, and accountability. It is our view that the development support achieves its greatest impact when it's aligned with national priorities, coordinated around country systems, and measured by the difference it makes in the lives of people. The World Bank Regional Health, Nutrition, and Population Strategy complement this direction in several important ways. It emphasizes health system strengthening and equity access, which are central pillars of Ghana's universal health coverage agenda. It promotes sustainable financing and efficient service delivery models, which are essential to the long-term resilience of health systems. It recognizes nutrition and population dynamics as critical element of human capital development. It also encourages regional learning and collaboration, allowing countries such as Ghana to share our experiences while learning from the innovations and best practices of our neighbors. We therefore do not see this regional HMP strategy as a para initiative. We see it as a strategic ally. It can help us operationalize our investor health coverage compact with greater discipline, greater efficiency, and stronger accountability. It can also support the President's broader vision of health sovereignty, by which we mean the ability of African countries to define their priorities, strengthen their systems, mobilize domestic capacity, and work with partners in a manner that reinforces national and regional ownership. Health sovereignty does not mean isolation. It means purposeful partnership. It means that our collaboration must strengthen local systems, build institutional capacity, deepen regional resilience, and reduce long-term dependency. It means that we must invest not only in programs, but also in people, data, infrastructure, financing systems, supply chains, local production, and the governance arrangements that hold everything together. We launched this strategy today. Our responsibility is to ensure that it does not remain a well-written document. Strategies matter only when they are implemented. Frameworks matter only when they guide decisions. Commitments matter only when they are translated into action, budget, performance, and results. Let us therefore commit ourselves to a practical implementation agenda. Let every investment under this strategy improve the lives of mothers, children, adolescents, young people, the elderly, and vulnerable populations. Let it reduce the number of families that suffer financial hardship because of illness. Let it help us build primary healthcare systems that detect disease early, hospitals that function effectively, nutrition systems that protect the future of our children, and health financing arrangements that are fair, sustainable, and protective. The government of Ghana stands ready to work closely with the World Bank, sister African countries, development partners, civil society, the private sector, and all stakeholders to ensure the successful implementation of this strategy. We believe that by working together, we can build stronger health systems, healthier populations, and more resilient economies across our region. Distinguished ladies and gentlemen, it is now my honor, if I have that honor at all, to declare the World Bank Regional Health, Nutrition, and Population Strategy officially launched. May the good Lord bless Ghana, may God bless our sister nations, and may He bless our collective efforts to build a healthier and more prosperous future for all. Most grateful for the opportunity.
Ladies and gentlemen, another round of applause for the Honorable Minister of Health. And now to give us the second welcome remarks, we have the World Bank Group Division Director. And as he comes up on stage, may I remind you we have simultaneous interpretation in French and in English as well. Ladies and gentlemen, and for those of you joining us online, warmly welcome Dr. Robert R. Taliercio.
Honorable Minister Minta Kando, Ministers of Health and Finance from across the region, Minister Somse from Central African Republic, Minister Nantote from Guinea-Bissau, Minister Mahama from Chad, Minister Samate from Gambia, Minister Gafuan from Liberia, Ministry of Finance, Minister Kapoto from Liberia, Ministry of Health, Minister Pate from Nigeria, Minister Sai from Senegal, Minister Dembi from Sierra Leone, World Bank Group Vice President for People, Mamta Murthy. Thank you again, Excellencies, Directors, Heads of Agencies, distinguished guests, colleagues and friends. Good morning, and Akwaba to Accra. Thank you very much, Minister, for your kind words, which reflect exactly why we are here and why Ghana is the right place to be having this conversation. On behalf of the World Bank Group, I'd like to welcome you. Welcome to all the colleagues who traveled from across the region, from partner institutions here in Accra and across the region, from the private sector and civil society, and the research community. This room represents the kind of partnerships that actually move things, and we are glad you're here. I want to begin with a particular word of thanks to His Excellency President Mahama, who has honored this event with his patronage. His Accra Reset initiative, as we just heard from the Minister, is seizing an opportunity and showing the way for African governments to assert their sovereignty in the global health arena. The President is sending a strong signal that charting a new path forward is a matter of national priority and political commitment. We at the World Bank Group welcome the opportunity to support this agenda, and that is why we are here today. I want to say a brief word about our host country, Ghana, which has graciously welcomed us. Ghana joined the World Bank Group in 1957, the same year it became independent. And so next year we will celebrate 70 years of independence as well as 70 years of partnership. This relationship has grown to become one of the broadest and most substantive in the region. Our ongoing projects cover a wide span of sectors, including agriculture, energy, education, primary education and secondary education, health, macroeconomic stability, and others. We are currently preparing a new country partnership framework with the government of Ghana to guide our partnership for the next 6 years. But beyond our strategic partnership, what Ghana demonstrates is the core argument of the strategy you are about to hear, that sustained commitment to health, to primary care, to nutrition, to a sustainable health financing system pays off. Childhood stunting has been cut nearly in half over 2 decades, making Ghana one of the top performers in the region. I think it's worth savoring that for a moment. I mean, so many countries are struggling with child stunting, and Ghana has been remarkable, really, in its progress on this core challenge. Ghana is also one of the only 3 West African countries in the region to improve health outcomes sufficiently to reach a stage at which a demographic dividend can be attained. Ghana's health financing system has long been a model to aspiring reformers in the region. As a forerunner in the region, Ghana shows us how it can be done and what we can learn from Ghana's experience. These are not just anecdotes, but proof that the ambitions in this strategy are achievable. So we look, as the Minister said, we look forward to learning more from Ghana's experience and also from each other as we advance this dialogue today. So in a moment, you will see what this strategy is about and where we propose to support the region. I encourage you to engage in it fully and to stay for what comes later in the morning, which I fully expect to be a significant moment for the health agenda in West and Central Africa. Thank you very much.
Ladies and gentlemen, you know when you are in Accra, you clap louder than when you're in any other part of the world. So the entire day today, given that we are making history, I really don't care how you feel, you will clap. And so I humbly ask that we give a round of applause to our dear Rob. It's a great time, and taking you on this journey is an absolute honor. Ladies and gentlemen, take a look at our scene-setting video.
In the heart of Africa, a new story is being written. From Accra to Douala, from Niamey to Brazzaville, nations are standing at a crossroads, facing old challenges and new pressures, but driven by the same vision: better health for every citizen. But the pressures are mounting. Funding is shrinking. Budgets are stretched to the limit. Populations are growing fast, bringing both promise and strain. Mothers and children face many health risks. Infectious diseases remain, even as new conditions rise. Climate change, conflict, and pandemics threaten livelihoods, while families seek hope in care that is effective, fair, affordable, and trusted. Yet across the continent, something powerful is taking shape. Inspired by the Accra Reset and Lusaka Agenda, African leaders are reimagining health on their own terms for their people first. The World Bank Health, Nutrition and Population Strategy, Fit to Prosper, investing in health for jobs and development in Western and Central Africa, hails that turning point. A renewed partnership to help countries make smart, focused choices, using every dollar wisely, strengthening trust while reaching 200 million people with affordable quality care by 2030. 3 bold priorities drive this vision. 1. Frontlines first, empowering local health workers and strengthening primary care. 2. Fixing finance, spending smarter and embracing innovation. And 3. Future fit, preparing systems for emergencies, pandemics, and climate shocks. Health isn't only about surviving, it is about thriving. Every investment in health is an investment in jobs, productivity, and human capital. Healthier children today means more and better jobs tomorrow. Healthier populations today mean a more productive economy. A healthier and stronger workforce today means a more prosperous Africa today and tomorrow. This is the moment to unlock the future, to build resilient systems, expand opportunity, and ensure every child, every mother, every community member can count on care that lasts. Together, we can bring health, dignity, jobs, and growth to millions. Together, we can make Western and Central Africa future-ready.
Transformation begins with a very clear vision, a practical roadmap, and the courage to invest in people as the foundation of prosperity. So I'm excited and I'm happy that we are here to present a strategy. This strategy seeks to shape a healthier, more resilient West and Central Africa. Please give a warm Accra welcome to Dr. Rifat Hassan, World Bank Group Practice Manager for Health, Nutrition, and Population, as she presents the strategy.
Honorable Ministers, esteemed partners, distinguished colleagues and friends, good morning. Bonjour tout le monde. I have the honor of sharing with you our regional health strategy, Fit to Prosper. This strategy was developed in close collaboration and consultation with you and your colleagues. So I suspect that much of it will be very familiar to many of you. I will use some slides. It is the only PowerPoint of the day, so please bear with me. We are not starting from scratch. We're building on a strong foundation and past successes in West and Central Africa. In the past 20 to 30 years, the last 2 to 3 decades, this region has seen 23% reduction in child stunting, 31% decline in total fertility, 39% decline in maternal mortality, and 55% decline in under 5 mortality. So there has been quite a bit of progress, and this is the progress that we are building on. And based on this progress, we see 5 major opportunities for West and Central Africa. First, we see a youthful future. Demographic transition has been happening, but slowly, and the region still has high dependency ratios. But the region also has the world's fastest growing youth cohort, an opportunity waiting to be realized with the right investments. There's an urgent need to invest in people to reap the demographic dividend and realize the economic opportunity presented by a young and increasingly urbanized population. In particular, adolescent girls play a very important role. Lower rates of early marriage and childbearing can greatly improve not only their life prospects, but also of their children, who will have lower mortality and better nutrition, learning, and employment outcomes. Second, we see a healthy future ahead. Now, despite the 55% reduction since 1990, under 5 mortality remains high, including among middle-income countries in the region. 33% of all under 5 deaths, 44% of all maternal deaths are in West and Central Africa. And the number of stunted children are increasing. There's a wide variation across the region in health outcomes, in income levels, in FCB status, but a near uniform story of trailing global peers. However, the remaining gaps can be closed rapidly for a healthy future for the region. Third, we see a productive future, both in terms of jobs today as well as jobs tomorrow. Addressing the current shortages of healthcare workers in the region could add 1.4 million skilled workers and an additional 800,000 community health workers, the majority of whom would be women. We also see productivity gains today. Health prevention and quality service delivery can boost worker productivity. In Ghana, here, a firm survey revealed that 40% of all lost working days are due to malaria alone. And a malaria test and treat program in Nigeria among agriculture workers boosted earnings by 12%. Health and nutrition services lay the foundation also for tomorrow's workforce. Mortality and fertility reductions boost household investments per child, setting them up for better success. Improved maternal and child health supports cognitive development, educational attainment, and learning, and later on, wages. For example, adult males who received nutritional supplements as children had 46% higher earnings. And health dominates the list of best buys as identified by the Copenhagen Consensus, over $15 of return per $1 spent. And economic resilience. We know this is really important in the region. Ebola and COVID disrupted routine service delivery, but also resulted in higher unemployment, reduced learning, and more teen pregnancies. GDP losses due to Ebola in Guinea, Liberia, and Sierra Leone are estimated at almost $2 billion in 2015. So health security investments can safeguard future jobs and income. Fourth, we see a resilient future. This region is particularly vulnerable to pandemics, climate change, food insecurity, and fragility and conflict. But these risks can be mitigated to show the way to a resilient future. And finally, a social contract for the future. Health is the most important problem that people say government should address. It's the main source of financial anxiety, and it's overtaken unemployment as the top policy priority for Africans. Respondents overwhelmingly say that their government should ensure healthcare for all, even if doing so requires higher taxes. So, how are these opportunities realized? We undertook some analytical work to diagnose the key constraints to better health system performance. We consulted with many of you, and based on these, we have arrived at some strategic priorities for the region. Now, first, we found a common thread to become fit to prosper, a universal, high-quality, essential package focused on reproductive, maternal, newborn, child, and adolescent health and nutrition services. It's a mouthful, RMNCAH plus N, as we say. This should be the top strategic priority for most of our West and Central African countries. Now, this is not to exclude other services or the need for country-led tailoring, but RMNCAH plus N services should be at the core. So a quality RMNCAH plus N package of services can help realize these 5 opportunities, but it can also lay the service delivery foundations for an expanded package that includes non-communicable diseases as countries move through the epidemiological transition with an evolving burden of disease, as some countries have already started to do in this region. So, our strategy, Fit to Prosper, has one vision, a region with resilient, universal health coverage. and 2 goals to support this vision: people receiving quality, affordable health, nutrition, and population services, and countries benefiting from strengthened capacity to prevent, detect, and respond to health emergencies. 3 strategic priorities support these goals. We like to think of these as the what to do: replicable, scalable solutions. Frontlines first, fixing finance, and future fit. Allow me to briefly just summarize each of them. The first strategic priority is investing in frontlines first. Most services in this package can be delivered through primary health care centers. However, strong linkages with community health platforms and referral facilities are absolutely critical. This means deploying human resources closer to the people, adequately staffing primary healthcare centers with competent human resources for health, expanding robust community health worker programs, which have been relatively untapped in this region, but this offers a major opportunity to accelerate progress and to accelerate progress quickly. This needs to be accompanied by human resource governance reforms as well. This also means strengthening the facilities with basic inputs for readiness to deliver services, equipping facilities with water, power, internet, ensuring availability of medicines and other commodities. And last but not least, this means focusing on the demand side. There is evidence of significant demand-side barriers to service utilization that have not been the focus of sufficient policy attention. These include sociocultural norms, geographic barriers, financial barriers, and a lack of trust in the health system. So generating demand, including through community health workers, using things like conditional cash transfers to promote the uptake of priority services, and making sure that we have people-centered care. The health financing agenda requires that countries both spend better to improve efficiency, but also spend more on health. There are multiple opportunities to spend better, starting with increasing allocation at the primary healthcare level instead of disproportionate spending only at hospital level. Budget execution in the health sector is often low, but a range of public financial management reforms can help reduce unspent resources. Better harmonization of development assistance for health, especially by broadening donor support from narrow vertical programs to broader health system programs that really embrace this essential benefits package. This would enhance coherence and impact of external resources. But we also need to spend more. Government health spending, the bedrock of universal health coverage financing, is lower in Africa West and Central than among its peers, most commonly due to low prioritization of health within government budgets. Macro-fiscal pressures are threatening to result in a lost decade for progress in domestic resource mobilization for health. Given the recurrent crises that we're facing in the world today, this is going to be further exacerbated. And finally, future fit. Pandemic and climate risks pose a major challenge to Africa West and Central, including to the delivery of this high-quality essential package of services. The region has made progress on pandemic preparedness, but measures of readiness indicate that substantive agenda is still remaining at hand. Preparedness cannot be achieved without strong primary care. The road to pandemic and climate resilience begins with the same robust primary healthcare systems that are required for this package of services. Countries should pursue emergency-ready primary healthcare as a service delivery platform that pays special attention to infection control, disease reporting, and service continuity even during emergencies. Countries also need to mitigate against and prepare for climate risks. Extreme weather events and rising temperatures require planning, forecasting, energy efficiency, and disaster response plans to be in place. The resilience agenda requires multi-sectoral action to connect health system objectives with policy action in other sectors, including, for example, agriculture and environment for One Health, energy for climate mitigation, water for infection control, disaster risk management, and private sector and trade for medical countermeasures manufacturing, among many others. So we've talked about the 3 strategic priorities, or the what's, the scalable solutions. Now I'll talk a little bit about the how. How, as an institution, are we going to support the region to do this? The how is our engagement strategy for scale, speed, and impact. Investing to scale up and speed up, meaning that our lending prioritizes core service delivery, including with lending in other critical sectors aside from health as well. Support to achieve impact. Ensure that investments translate into results with technical assistance and meaningful implementation support. And inform to reform. Analytical work to support evidence-based decision-making and policy dialogue. This will also be applied in a targeted way to improve the quality of investments. And finally, some cross-cutting engagement essentials. Accountability for results is critical, keeping a laser focus on utilization and quality of affordable core health services. Multi-sectoral action across multiple sectors to promote health outcomes, and leveraging partners, which is why we're very happy to have you all here today with us. I wanted to just provide a very quick flavor of how multi-sectoral the agenda for improving health outcomes is. There's so much potential, from energy, in electrifying and solarizing health facilities, to making sure that facilities have a water supply and sanitation facilities, to making sure that health facilities are connected to the internet for leveraging digital innovations and digital health options. We're looking also at domestic resource mobilization and the public financial management reforms through working with the governance colleagues and prosperity colleagues. Of course, agriculture for health security, One Health and food and nutrition security, social protection on economic empowerment, leveraging social registries, and of course, education for adolescent girls and women's empowerment, school health and nutrition, and early childhood education. And as we'll talk about a little bit more this afternoon, partnering with the private sector and with IFC on pharmaceutical manufacturing. The Africa Initiative for Medical Access and Manufacturing, or AIM 2030, is one important example of multi-sectorality and the One World Bank Group approach. This has several interlinked objectives of expanding equitable service access to quality and affordable services for UHC, strengthening health system resilience and health sovereignty, and supporting economic development through job creation and private sector-led industrial growth. It's a multi-sectoral initiative that addresses structural constraints across the value chain for health products: policy, regulation, procurement, trade, skills, supply chains, and private investment. I will end by talking about how we have our institution behind us to implement this strategy in the region. With the recognition that healthy populations are a foundation of productivity and security, and that the health sector is a major source of employment, our president set an ambitious target to reach 1.5 billion people by 2030 with quality, affordable health, nutrition, and population services. This was accompanied by the 3x5 Jobs Framework, with 3 economy-wide enablers and 5 high-potential job sectors. As you can see, marked in red, health and nutrition feature prominently in the 3x5 framework, both in the 3 in terms of enabling economy-wide enablers, as well as sectors that will produce incredible number of jobs. And to support the 1.5 billion goal and the 3x5 jobs framework, the Health Works campaign is active and accelerating. They're the country compacts, high-level agreements outlining national commitments to expand affordable quality healthcare. The Leaders Coalition, a coalition of champions for health access, including health and finance ministers, business leaders, and philanthropists. And the UHC Knowledge Hub in Tokyo that was launched in December of 2025. The Knowledge Hub is a capacity-building platform providing evidence, practical tools, and opportunities for peer learning. It brings together health and finance ministers, leaders in global health. Both of these are hosted by the government of Japan, the World Health Organization, and the World Bank. So, finally, opportunities for West and Central Africa. How do we do this and take advantage of what is available? Well, now we have our Fit to Prosper strategy that we have now together launched, and we've just discussed the scalable solutions. We have the health compacts, and in this region, we already have Nigeria, Sierra Leone, and Cote d'Ivoire that have completed their health compacts. Ghana and Senegal are in the process of finalizing theirs, and there's an opportunity to expand the health compacts to additional countries. This can provide a country-led platform for strategic, financial, and technical support. And then there are investment opportunities. We've mobilized more than $1 billion in grant financing for IDA countries. We have $100 million in technical assistance to support the knowledge and technical assistance and implementation support, including via the UHC Knowledge Hub. We have multi-phase programmatic approaches to strengthen the primary healthcare platforms and operationalize AIM 2030. And we've got partnerships and agreements and co-financing with Gavi and Global Fund to provide grants to IDA countries and buy-downs in IBRD ones. There's global support and expertise available and cross-sectoral collaboration that the World Bank is doing internally to then support you to do it on the ground. So, with this overview, I'll invite you to read the full strategy. I'm sure you'll find it scintillating. And we look forward to joining hands with all of you to ensure the strategy is successfully implemented to have impact. Thank you so much for your attention today, and we look forward to the discussions and the in-depth deliberations the rest of the afternoon. Thank you.
And now, ladies and gentlemen, we move into the second part of the first part of our program. With great joy and honor, I would like to acknowledge the presence of the Chief of Staff of the Office of the President, Honorable Julius Debrah, who is seated here in the stead of His Excellency. And with that said, may I kindly ask you to be upstanding for us to acknowledge the nation where we sit and stand, the national anthem of the Republic of Ghana. You may now be seated. Thank you. Honorable Chief of Staff, Excellencies, distinguished ladies and gentlemen. Our next speaker is a distinguished global development leader whose work continues to shape conversations and action around human capital, equity, resilience, and the future of people-centered development around the world. She's an excellent author at that. Now, I'm a bit biased towards her because she's particularly invested in one of my heartbeats, which is a global financing facility at the World Bank Group. Ladies and gentlemen, as Vice President for People at the World Bank Group, she provides strategic leadership across critical sectors, including health, education, social protection, and of course, gender, championing the simple understanding that investing in people is one of the most powerful pathways to sustainable development and shared prosperity. It gives me great pleasure to bring to the podium to share her words with you, the Vice President for People at the World Bank Group. Please warmly welcome Dr. Mamta Murthy.
Your Excellency Chief of Staff, Your Excellency Minister of Health, Honorable Ministers of Finance and Ministers of Health from across Western and Central Africa, distinguished partners, ladies and gentlemen, it's a real honor for me today to be here and to provide this address. and also to be here in the vibrant city of Accra. Yesterday, I had the honor of visiting the Kwame Nkrumah National Park, and I was reminded of the early emphasis on human development in this country, and also the contributions of Dr. Francis Nkrumah, who was a medical administrator, a researcher, a big contributor to global public health. So it's indeed a very august city in which to talk about the Accra Reset, as well as how the World Bank Group can contribute to that. I want to begin by expressing my gratitude to our hosts and the entire team for pulling this event together. And I also want to express my deep appreciation to the President of the Republic, to President Mahama, for his leadership on the Accra Reset, which is trying to ensure that development cooperation is anchored in national sovereignty and in self-reliance and in shared prosperity. And in my view, there is no more urgent sector, no more urgent place for this than the field of health. And why do I say that? Well, let me anchor it in this sub-region. Western and Central Africa has one of the world's fastest growing and youngest populations. And it's going to be central to the world's demographic story in the 21st century. Between now and 2050, some 200 million children are going to be born in this region. And this is almost 1 in every 5 young people on the planet. So this has a huge weight in the world's demographic story. And that's why this region presents a tremendous opportunity and also has a responsibility to unlock the human capital, not just of Africa, but of the world. And also to drive prosperity and growth and jobs and all the other things that we care about. Now that's why, as the World Bank Group, we have set a target of reaching 1.5 billion people with more and better healthcare, and reaching 200 million people in this sub-region. And when we look across sub-Saharan Africa, reaching 400 million people with more and better health services. That's a significant target. And in order to do that, we really want to focus in our efforts, our policy advice, our financing, our technical assistance, our advocacy. We want to focus on primary health care because it's the most cost-effective way of reaching a large number of people. And within primary health care, we're really identifying 6 things which are the backbone of strong primary health care all over the world. And Rifat has already talked about some of these things. Let me just refer to them briefly. We're talking about service-ready facilities, which have electricity, they have water, and very importantly, they have digital connectivity. That's number 1. Number 2, we're talking about diversified delivery platforms so that people can be reached wherever they are. And that means not just primary healthcare facilities, but reached through community health workers, reached through telemedicine, reached through schools. Third, we're talking about an expanded and a digitally enabled health workforce, because that is at the core of primary health care. Fourth, we're talking about service packages that are designed around each country's own domestic burden, not external financing priorities. This has been a bit of the reset that is being called for in the global health architecture. Fifth, we're talking about sustainable domestic financing because this is about taking responsibility for the health of one's own population. And sixth, and this is not to minimize the importance of this, we're talking about reliable access to affordable medicines, vaccines, diagnostics, and supplies, including through local and regional manufacturing. Now, these 6 solutions are not a wish list. Many of these things are already happening in the region, happening in this country, Many of these things are happening in Nigeria under the leadership of Minister Pate. It's really about doing this consistently everywhere in a sustainable way, largely financed through domestic resources and with partners and other agencies supporting the leadership of government. Now, the regional strategy that we have launched today, and thank you for officially declaring it launched, really reflects this. It translates this into the local context. And as Rifat has already mentioned, it focuses on three things. Frontline first, and this means investing in a cost-effective primary healthcare system. Second, it focuses on financing reforms in order to finance this system sustainably and move away from a fragmented, sometimes vertical donor-driven approach to funding, and focusing much more on integrated national systems which are domestically financed. Financing first also means improving budget execution so that every cedi, every franc, every naira that goes into the health system is actually delivered to the front line. And it also means future readiness. It goes without saying, and I'm speaking to many of you who face these issues on a daily basis, this is a region that faces a large number of outbreaks. There have been 100 outbreaks of disease that crosses borders in this region just in the past 10 years. And so one has to think about resilience, of which primary healthcare readiness is a very important feature, and so is access to affordable and sustainable medical supplies, ideally manufactured locally and regionally. So I want to say that as the World Bank Group, we intend to support this agenda with all our tools and instruments. And that includes our soft lending arm, IDA. It includes IBRD. It includes IFC, our private sector lending arm. And there's no way that we can do this on our own. We need strong partnerships with all of you here, including other multilateral development banks, bilaterals, philanthropies, the Pandemic Fund, and others. I'm very happy that we launched the next investment round for the Global Financing Facility. And on day one, we were able to raise $800 million. This is a very important facility that provides grant resources, very important, especially in countries that are facing difficult fiscal circumstances. It also provides technical assistance and institutional strengthening that can anchor primary healthcare reforms and also scale up proven solutions. I also want to say that at the spring meetings, just last month in Washington, D.C., we launched our local and regional manufacturing initiative focused on sub-Saharan Africa. Because we know from COVID that Africa cannot remain at the end of the queue for life-saving products. This is a very important initiative that focuses on trade and regulatory harmonization. It focuses on pooled procurement for demand certainty. It also focuses on bringing in private investment. And I'm very happy that we have been able to finalize the first agreement under AIM 2030. I want to invite everybody in this room to partner with us on both the implementation of the regional strategy, regional health strategy, but also our African Health Manufacturing Initiative to join forces, because I think by pooling our resources, pooling our technical expertise, pooling our social capital and our networks, I think we can work towards ensuring that every country in the region has all the tools it needs to improve the health of its citizens, improve productivity, and raise prosperity. Let me conclude by just saying two things. First of all, I'd like to make sure that the economic case for investing in health remains uppermost in our minds, also because we have so many ministers of finance in the audience. This is a region which has around 1/15 of the world's population, 1/15. okay? So let's say 7 to 8%. And yet it has 33% of global child deaths, 44% of maternal deaths, and nearly 60% of all deaths from malaria. So there is a disproportionate burden of disease. 1 in 3 children under 5 is stunted. At the same time, there is an opportunity here because we know that investments in health deliver a very high rate of return. Speaking as economist, I can say that investments in health deliver benefit to cost ratios of 15 to 1. So the case for investing in health is extremely strong. We also know that the health sector is a job creator. Just let's take the shortage of healthcare workers. I won't go into this issue of, what's the right ratio. Let's just think of ballpark numbers. If the region can address its shortage of healthcare workers, it could create 2 million jobs. 2 million jobs, not just in the health sector, but in ancillary sectors that contribute to the delivery of health services. We also know that opinion surveys, including the Afrobarometer, are showing that citizens across the region more increasingly rank health as their top priority for government investment. So the case, I think, is very clear. The second point that I want to make by way of conclusion is really around the role that national health compacts can play in connecting, if you like, the reform of the global architecture and the reform of the financing of health at the global level. They can connect that to national priorities. And we are really very pleased to see 3 countries in this region develop national health compacts, and I would encourage other countries to consider the same. A national health compact is a sovereign investment platform. It's a government-owned and government-led initiative. It anchors domestic financing commitments for health, and it sends a clear signal to all partners. And as a partner, this is something I would like to hear. It sends a signal to us as to where the governments of the countries would like us to prioritize our investments, whether public or private. I would also invite countries to participate in the UHC Knowledge Hub. This is a joint initiative with the government of Japan and the WHO, and it's a platform designed to share best practices in health financing and universal health coverage. So with that, let me conclude. I really want to recognize, in my last few words, the leadership of our host government. Ghana's National Health Insurance Scheme is one that is widely admired. Its innovative use of technology in the supply chain is making a huge difference to improving procurement and reimbursement. And I think Ghana has shown that innovation is at the heartbeat of making, it is the heartbeat of making progress on health outcomes. Most notably, I want to commend President Mahama for his personal leadership on the issue of primary health care as a cornerstone of national development, and his vision for ensuring that health services are available and accessible to all. I'm really honored by the presence of so many people here today. Thank you for being here. I really hope we can take this as an opportunity to unlock the demographic and economic potential of the region, and we can do this together, because I really do believe that we can reach not just 200 million people in this sub-region and 400 million people across sub-Saharan Africa. I believe we can reach many more people with the commitment that many of you are already showing, with the use of new technology that is available, and with raising our voices together to change the way in which healthcare is delivered, healthcare is financed, healthcare is talked about, and healthcare is understood. Thank you for your attention.
Thank you very much, Dr. Murthy. A round of applause for her great words. And ladies and gentlemen, throughout the day today, we have a series of ministerial and partner and private sector conversations where we hope that you would be engaged and, of course, exchange some dialogue as well. And now, from the launch of the Free Primary Healthcare Initiative, aimed at expanding equitable access to essential healthcare services, to establishing of the Ghana Medical Trust Fund, otherwise known as Mahama Cares, providing critical support for citizens living with chronic diseases. His Excellency continues to champion the belief that quality healthcare must not be a privilege, but a right. Under his leadership, Ghana has witnessed bold and people-centered health interventions designed not only to improve lives, but to strengthen national resilience, productivity, and economic inclusion. And so it goes without saying that it's absolutely befitting that he be the patron of the World Bank Group Health, Nutrition, and Population Strategy launch for West and Central Africa. Ladies and gentlemen, please warmly welcome, here to share the words of His Excellency John Dramani Mahama, his able representative, the Chief of Staff at the Office of the President. Please welcome Honorable Julius Debra.
The Vice President of the World Bank, Ms. Mamta Mati, Honorable Ministers of Health and Finance, Divisional Director of the World Bank, Mr. Robert Tellerio, Your Excellencies, Ambassadors and High Commissioners, representative of the World Bank Group, development partners, colleagues from sister African countries, Chief Directors, Directors and Heads of agencies, health sector stakeholders, distinguished invited guests, ladies and gentlemen. It is an honor to host you here in Ghana for the launch of this important regional strategy under the compelling theme, Fit to Prosper. I commend the World Bank Group for its sustained leadership and partnership in advancing health outcomes across West and Central Africa. Across our region, your portfolio, spanning over 20 countries and backed by billions of dollars in financing, has strengthened health systems, supported pandemic preparedness, and improved maternal and child health outcomes. With a robust portfolio of 24 active operations across 20 countries and a commitment of over $4.4 billion, the bank is helping to turn the tide on maternal mortality, child health, and pandemic preparedness. This effort is further strengthened by the $340 million in co-financing from partners like Global Financial Facility, Gavi, the Global Fund, Japan, and Canada. From the West and Central African Health Security Program to the critical support for the Africa CDC, we are seeing a coordinated global response that matches the scale of our regional challenges. Ladies and gentlemen, the future of our economies will not be determined only by what we extract from the ground, but by what we invest in our people. Health is an economic strategy. As we know, a healthy population is more productive, more innovative, and more resilient. It is the foundation upon which jobs are created, industries grow, and nations prosper. That is why the theme Fit to Prosper is not just timely, it is transformative. It challenges us to reframe health as a driver of growth, not merely a cost to be managed. At this stage, on behalf of the people of Ghana, I would like to express our appreciation to the World Bank for its sustained support, including the $424.6 million COVID-19 emergency project and the $195.5 million primary health care investment project. These are not just line items in a budget. They are lifeline for our people. For us in Ghana, this strategy aligns closely with our national vision, achieving universal health coverage, strengthening our health systems, and ensuring that every citizen, regardless of income or location, can access quality health care. We have made progress. Through our National Health Insurance Scheme, we have expanded financial protection and improved access. Yet we are clear-eyed about the challenges, gaps in coverage, concerns about quality, and the need for long-term financial sustainability. That is why we are acting decisively. We are strengthening domestic financing through reforms, including the uncapping of the National Health Insurance Levy. We have launched the Free Primary Health Care Initiative to remove barriers at the point of service. And we have established the Ghana Medical Trust Fund, also known as Mahama Cares. Through this compact, we will align domestic resources, concessionary financing, and partner support behind a single country-defined vision. This is what health sovereignty looks like in practice. Excellencies, no country can achieve health security alone. Diseases do not respect borders, and neither should our solutions be same. The World Bank's regional strategy rightly emphasizes cooperation, knowledge sharing, and joint action. Ghana stands ready to play its part. We will continue to strengthen regional surveillance and emergency response systems, support local manufacturing of health products, and promote the exchange of knowledge and innovation across our region. Because when one country is vulnerable, we are all vulnerable. And when one country succeeds, we all move forward. Ladies and gentlemen, the true test of this strategy will not be in its design, but in its delivery at the end. We must move with urgency. We must act with discipline. And above all, we must remain accountable to the people we serve. Let us commit today to invest more and invest smarter in healthcare, to prioritize primary healthcare as the foundation of our systems, and to ensure that no one is left behind. Distinguished ladies and gentlemen, the road to prosperity is paved with healthy lives. By investing in health, we are investing in jobs, in stability, and in the future of Western and Central Africa. Ghana stands ready. We are committed to the successful implementation of this regional strategy. Let us work together to ensure that no mother dies while giving birth, no child suffers from preventable diseases, and no citizen is pushed into poverty by the cost of Medicare. May God bless our efforts, and God bless Africa. Thank you.
Ladies and gentlemen, we will now like to take our family photo. If I may humbly ask our ministers of health and our ministers of finance to come up stage kindly. May I also call our World Bank Group leadership to join the Honorable Julius Deborah on stage. So ministers of health, the ministers of finance, please join us up on stage. Our ambassadors here present, high commissioners here present, please kindly join us up on stage. If I may have our media pressmen standing ready. Our official photographer, wave your hand so we know we are looking directly in your camera. Let's kindly have leaders of health development partners, leaders kindly joining us up on stage for our family photo. Once again, ministers of health and finance for Africa, West and Central, or any others here represented, ambassadors, high commissioners here represented, leaders of our health development partners, we acknowledge you. Please kindly join us up on stage. Official photographer, if you could kindly arrange our dignitaries, please. And by way of announcement, ladies and gentlemen, after this, we have a quick coffee break, but at 11:20, we humbly ask that you come back into this room for what I would like to call a live broadcast of absolute excitement, a live broadcast with CNBC. After that, we glide into our ministerial panels, our ministerial series, as well as our partnership and private sector discussions. And hopefully we will be on time for everything. Photographers, please get ready. 3, 2, 1. Please have everyone smiling kindly. And while our dignitaries stand here, photographers, our media men, please stand where you are. Kindly, everyone, could we please be upstanding? Please be upstanding while you grab your last photos as we acknowledge Ghana through the national anthem of the Republic of Ghana, Ghana Police Band. Thank you very much, Ghana Police Band. We celebrate you. And now, ladies and gentlemen, this brings us to the end of the opening ceremony of our launch here today, Making Health Work for Western Central Africa. In 20 minutes, we reconvene for the next part of our celebration or our gathering here, which will be the CNBC broadcast live with some of our leaders from the World Bank Group and some of our ministers. Ladies and gentlemen, that will begin at 11:20 a.m. We go live on CNBC and continue the conversation with our ministerial panels and our private sector and partnership roundtables. Thank you. If you're strong, if you're healthy, if you're happy to be in Accra, let us give the room a round of applause. Thank you so much. Once again, my name is Anita Erskine. It is an honor to be your MC here today. But ladies and gentlemen, we're moving into a rather exciting next portion of today's programming, starting off with a live fireside chat. It gives me great pleasure to hand over the power of the microphone to CNBC's Ms. Zinati Kuma, who is the Africa Business News Anchor. Please warmly welcome Ms. Zinati Kuma.
Good morning, distinguished guests, excellencies, and colleagues. My name is Zinati Kuma, a business news anchor at CNBC Africa, and I have the incredible honor of facilitating this fireside chat. I must say that I am happier in Ghana. Please don't tell the people in South Africa. So I'm from South Africa, and this is my first time in Ghana, and I'm happier because this is the greatest food I have ever tasted. And South Africans pride themselves on good food, but Ghana, and from just the restaurants that I've gone to, I spoke to someone who's from Ghana yesterday, and she says that's actually not even the best. So I've committed that over the next 24 hours, I'm going to go to all, or almost all your restaurants, because we only have 24 hours, right? But absolutely incredible hospitality. And I must say that I've been gallivanting and exploring the city a little bit in the time that I have been here. And I must say everybody is so friendly and so helpful. So really a round of applause for Ghana for hosting all of us from across the world today and for the great hospitality. All right, now to set the scene for the conversation that we are having today, a common hashtag that we like to use on social media when we are all posting our gym selfies, our gym workouts, and our Strava runs is health is wealth. And that's really what the crux of this particular discussion is about today, the value of the population's health translating into the wealth of individuals, families, countries, businesses, and economies. We have a growing young population in Africa, and particularly one that's been highlighted is in the region of Western and Central Africa. But if we do not invest in the prosperity of that young population, instead of it being a dividend, it can actually become a millstone around our necks. So, the final answer to the equation of sustainable economic growth is a productive workforce. This means that investment in different areas, including for access to quality and affordable healthcare, need to work together for the final outcome of a robust and inclusive labor market. So, to help us unearth the key priorities of the Fit to Prosper strategy is my esteemed panel. And if you can please come up on stage when I say your name, Dr. Mamta Murthy, World Bank Group Vice President of People. You can clap, there we go, there we go. His Excellency Professor Muhammad Ali Pate, Honorable Coordinating Minister of Health and Social Welfare in Nigeria. And last and definitely not least, His Excellency Dr. Austin Dembi, Honorable Minister of Health and Sanitation in Sierra Leone. A round of applause. All right, thank you so much for joining me on stage, ladies and gentlemen. Really, really appreciate your time and your insights that you will be giving us in this panel discussion today. So the frame of our conversation today is really that health is an economic strategy, right? And it should be prioritized as such by governments and the private sector. I want to start off with you, Prof. Mohammed. There we go. How have the linkages and the gaps between the health ecosystem and economic growth shown up in Nigeria?
No, thank you. I think before I respond to your question, I have to say that you raised a very important issue, food.
Yes.
Here in Accra. So you enjoyed the Ghanaian food. I'll tell you, when you taste the Nigerian jollof rice, you'll know the difference.
I have actually had it.
So
I'm sure. There goes the debate between Ghana jollof and Nigeria jollof.
Yes, so that's one of more serious point, but I think in regards to your question, in the context of Nigeria, our narrative is not starting from just the disease and death, important as they are. It's from the point of view of the economic, social, and the political aspect when we framed our agenda. With the president, with the Minister of Finance, we were armed with statistics that showed we used an instrument to assess people's voices, to understand the population needs. And that gave us insight as to the needs of our population. Health is a basis for accumulating human capital, which is key to the future of prosperity that our president's vision for our country is aspiring to, the Renewed Hope Agenda. In addition to that idea of health being key to accumulation of human capital, health is also a growth sector. We understood that it will the health contribution to Nigeria's GDP is 1.5%. In most OECD countries, it's almost 10%. In some other countries, much higher. So from the point of view of health contribution to our growth, there was also a very cogent argument. The jobs that can be created, the value chain that can be unlocked beyond the services that are needed to reduce diseases and death. That's on the economic front. On the social front, I think health brings people together, is responding to the population needs. It's also, this is real needs. And that compact between people and government can be enhanced if we invest in it. And thirdly, the political dividend. There is a political dividend in investing in health. We're a very large country, very diverse country, a federal system, but we have a compact that has set the federal government, states, and local government all moving in the same direction, that is delivering dividend across the nooks and crannies of our population through the primary healthcare system, through the hundreds of thousands of frontline health workers who are being empowered, who are seeing very tangibly the effect of government policy on their lives. Because if you build roads, power, they are very important elements that society needs to grow. Defense, those are all very important. But oftentimes, vaccines, safe delivery, reducing pain for population is where they feel the impact of government. And that, we believe, also has a political dividend. So from that angle, we approached it from a narrative that is positive, that is a narrative of growth and prosperity in our future, that is also from the point of view of the youthful nature of our country and preparing to preserve that, to nurture it. And that's the Renewed Hope Agenda of the President of Nigeria. And that's the way we articulated our reform agenda on governance, on health system, primary health care at the base of it, on the value chain, on health security, on digital transformation, but also on defragmenting the financing landscape. That's the way we framed it.
Yeah, indeed. Health really is the basis of a prosperity for the economy. And you actually mentioned some things that are in alignment also with the World Bank strategy, talking about the empowerment of frontline workers, of course, speaking to the pillar of a frontline first there. But also another interesting thing is, because as we know that the technology is permeating through every area, we also do need to focus on digitizing and actually adding in that technology element in the healthcare system. Dr. Dembi, I want to come to you because a robust and quality healthcare ecosystem really doesn't just create a population that survives, but a population that actually thrives, and it saves lives, but also sustains livelihoods. So with the imperative and urgency for health to be at the top of the agenda for Sierra Leone's economic prosperity, what is the journey looking like?
Well, thank you very much. I want to say you started a small war here, the Jollof Wars. Don't go to Ghana, don't go to Nigeria. Come to Sierra Leone,
okay,
we have the best jollof rice.
On my agenda.
But honestly, I think for Sierra Leone, we view health as central to national development. The president has invested very heavily in human capital as the platform for where we want to go. We're focusing on education, You want to have a very educated populace that's knowledgeable of themselves and their environment and have acquired the skills to be able to influence the environment. If you have an educated populace, it's really important that that populace is healthy because you have the greatest dividends from your educated populace when you have a healthy populace. And we believe that if you have food security as an additional component to it, you have the ingredients for building a nation. So for us, from the president down to the last person in the street, health is central to what we do. It's reflected in the amount of resources we put towards this. We have a deliberate focus in the healthcare delivery that's saying no one should be left behind. We have 8.5 million of us. The healthcare system should be able to see everybody, and everybody should be able to see themselves in the healthcare system. So our approach is, instead of going through vertical programs that are disease-based, we're looking at patient or client-centered approach that's following the life stages, from pregnancy to the newborn child, to ensuring that this newborn child is not just surviving, but it's nurtured to get to adolescence, to adults, and to senior citizens. And through all this, we look to ensure that we're setting some clear targets that we're working towards, and achievable targets, and measuring it as we go along. We strongly believe that this is predicated on primary health care. This is taking high-quality healthcare as close to the people as possible. The key word there is quality. We want to be able to provide access by taking care to them, but we also want to ensure that there's quality behind that access. Quality indicators look at physical infrastructure, energy, looking at water and sanitation, a safe environment in which you want to come and receive service. We want to look at staffing and staffing complements that allows you to be able to provide that quality. We want to ensure that there's supply chain that makes sure that commodities are there in the present, they're available, they're accessible as we provide these services. And we want to ensure that you could measure these. Looking at a digital platform that allows you to know what's happening in every nook and corner of your country because you want to act on it. I want something that happens today for us to know about it so we could fix it by tomorrow. Not wait for the end of the year, not wait for annual reports. So the digital transformation is quite active and embedded in our approach to healthcare delivery in Sierra Leone.
Indeed, you really pull on so many important threads, and some of them we will get to in this fireside chat. But Dr. Mamta, I want to come to you. I mean, with the specific challenges and economic positioning of Western and Central Africa, what then does fit to prosper mean in practice, and why is it apt for this moment?
Thank you for the great question. May I humbly submit that India has the best food in the world, and I don't say this just because I come from the country. I've tried many cuisines, and I think I can objectively say that.
Okay, I could lead into
we
that.
have the best food. I also want to just add to the excellent points that have been made by my colleagues, Mohammed Pate and Austin Demby. Of course, health is an economic issue and is at the heart of economic growth. But I also want to say that in a world where there is a loss of trust in institutions, I think delivering on health is a part of reinstating, building trust in the state. And actually, I'm very struck by the opinion polls, especially in this part of the world, which are raising health to the #1 issue on which people would like to see the state deliver. So let's not forget that aspect, even as we completely need to emphasize the role of health in growth and productivity. I want to make a second point which is relevant to the region, which is that a local epidemic, a regional epidemic, or even a global pandemic can be a huge setback to economic growth, to productivity, the very things that we care about. I mean, Minister Demby can speak with more authenticity than me about the impact of Ebola on the economies of Sierra Leone, Liberia, and Guinea. We know what happened during COVID-19. So we know that you cannot talk about detecting responding, treating, containing the spread of disease, and this has implications beyond borders without a strong health system. Now let me come to the fit for purpose. The reason why we're calling this strategy fit for purpose is really twofold. One is that the health system needs to be fit for the purpose that it has to deliver on. So it needs stronger primary healthcare, healthcare workers who are empowered and digitally enabled. It needs sustainable financing, and it needs to be pandemic, epidemic ready and resilient. So in that sense, it's fit for purpose. It's delivering on the promise of support to the population to overcome health challenges. It's delivering on the promise of improving productivity, growth, and so on. That's one reason. The second reason we call it fit for purpose, it's like a pun. It's that people need to be fit for purpose. It's the human capital argument that Mohammed Pateh just made. So we think it conveys both messages. It's about the health system and it's about people, and both being ready for the challenges and that they may face and for the opportunities that they can seize.
Well, I mean, it's very interesting also as we, the ministers have also outlined the kind of reforms and the successes that they have seen in their different health ecosystem, but also we know and acknowledge the gaps there. I'm going to come back to you in terms of what the World Bank would like to see from government in terms of reforms so that the strategy actually works, and it's not just a short-term bandage on the symptoms, but actually works structurally. But now that, Dr. Mamta has outlined the key pillars of this fit-for-purpose strategy, Prof. Mohammed, I want to come to you in terms of then how Nigeria will be engaging with the World Bank engagement strategy and this fit-for-purpose strategy, and not just you as the health minister, but also with the finance ministry and the other organs of government that are involved and should be involved in this collaborative effort.
So I think in the context of Nigeria, we designed a health sector renewal investment initiative, which is a country-owned, country-led strategy for achieving the results that we felt were most needed for the Nigerian population. The World Bank was a thought partner in that process, but it is our program. And we brought in several other partners as well, private sector, philanthropists, bilateral partners, our civil society, our private sector, our citizens, and different levels of government, and had a compact. And the bank's role as a thought partner was key because it has global experiences in sector-wide approaches, in tools, and that was very valuable on the data, evidence, how we set targets, all of those. That is, I would say, the most significant contribution, not to underplay the financing that also the bank put on the table through the HOPE program, which focuses on health, on basic education as well, and governance. That provided a glue, an incentive system for even the subnational actors to achieve certain outcomes that we are looking to get. The ability to use those resources, I think, will help us catalyze innovations in certain areas, mobilize everybody to move in the same direction. But the structured mechanism we have, the accountability mechanism that we have with the World Bank, which is mutual, also applies to other partners who are working with us, because there are two lines, it's a bi-directional thing. So while we hold ourselves to high standards, we also want to hold our partners to high standards, just as they would like to hold us to high standards. Having structured mechanism for engagement on performance, cost corrections, I think is key. And finally, we've asked, and the bank is now with us in terms of the knowledge agenda, in terms of analysis, experiences, the UHC hub that was launched by the government of Japan and the World Bank and the World Health Organization were a part of it. And I believe several other African countries are also part of it, so that we continually learn and adapt as we move forward. But fundamentally, building around national systems, our national institutions, and with a path ultimately to exiting dependency over time. We are not here yet, But our aspiration is that the engagement on development assistance for health will evolve. The relationships will continue, but it's not, let's say, donor-recipient type, but it's much more constructed differently in a way that allows our domestic financing, including IDA, to play that role. And over time, in the environment that we are seeing bilateral funding decreasing, global aid initiatives struggling, that the core of the responsibility is on national governments at federal level, at states, local governments. But on other elements like the global public goods, the bank's work on health security comes to play with us. So that's the way we look at the World Bank's effort. Yeah.
We'll talk about that core responsibility from the government, of course. There is still this big gap in government health spending, and actually the World Bank report emphasizes that global experience and cross-country expenditure data tells us that there is no substitute for government health spending. Dr. Dembi, what are the critical elements that are shaping the conversations with your Treasury, and what can you take forward to Treasury from the World Bank strategy?
Well, the World Bank has been a really great partner, and I think we've moved into the space not only with the bank, with other partners to recognize country ownership and country sovereignty. And for us, that translates into having a clear vision for what we want to do in our respective countries. In Sierra Leone, we have a clear vision. For example, we want 0 preventable maternal deaths, 0 preventable child deaths, zero those children in our country. And we just launched a 300-day initiative to address that. But again, we have a clear vision of what we want to do in our whole healthcare system, again, following the 5 stages, the fundamentals of primary healthcare. We work on 4 fundamental principles that the World Bank and others have embraced. First, we have a clear vision of where we want to go. We call it the 4 A's. The 1A, the number 1A, is we want our partners to accompany us. We know where we're going. We know what the targets are. We want you to accompany us. The second A for us is we want you to be aligned with what we're doing so that you're not doing different things from what we're doing. You want us to complement and align with what we're doing. The third A is that, every day we debate and argue around these things, it's costing lives. So we want an accelerated pace of activity. And the fourth A for us is accountability, ensuring that you and I are equally accountable for the resources that we receive, and we're able to translate that into health outcomes. That is the predicate for the compact that we signed in December with the bank that we're really quite pleased with. And it's creating a framework for engagement, not only for the bank, but for other partners. So we're very, very pleased with what we've done with the bank. We're very pleased with GFF as well, that share common vision. And we haven't heard no from anybody, because this makes sense. Because what pertained before is everybody comes in with their own agenda, with their own program, with their own funding, with their own allocation, with their own targets, which is very incoherent and fragmented. Now you have a country plan. Now you have a clear direction. And I think being aligned and working with us on these 4 A's is the way forward.
All right. Dr. Mamta, I have 2 questions for you. Of course, the one that I spoke about reforms. But before that, I actually want to talk about, Dr. Dembi talks about partnerships and alignment, and that no one has said no up until this point because everyone believes in the vision. And the strategy talks about multi-sectoral opportunities that, of course, have been highlighted in that engagement strategy. How responsive and innovative are stakeholders outside of government to equitable investments?
So you've asked me a very difficult second question, so I'm going to go with your first question, and then I'll slide into the second question. So you asked me, what is it that we would like to see in order to have stronger health systems? Yeah. Let me boil it down to a few things. I'm not going to be able to say everything, but the first and foremost is government leadership. I think you cannot talk about a strong health system without government leadership. The second thing I would say is that health systems have to be sustainably financed. And a good part of that has to come out of domestic revenue mobilization. We see countries where there is scope, even in tight fiscal circumstances such as the ones that we are seeing now virtually all over the world, we see scope for countries to increase their spending, even within their tight budget envelopes. But of course, it's not just about increasing spending, it's about spending the money well. And there's a lot of scope for spending the money well. Actually, focusing on primary health care, the way these two ministers have described, is a good way of spending money well. I should also talk about budget execution. One of the things that we often confront when we talk to ministers of finance, they say to us, well, we made an allocation for health, but it wasn't fully spent. And so I think there's a budget execution and a public finance management aspect of spending well, which is very important. And there are very cost-effective interventions that could be spent on that would deliver more health outcomes for the same amount of money, and it's very important that those things be prioritized. The third thing I think we would want is a joined-up approach across government, and I think this goes towards your second question. Healthcare is a huge responsibility of the Ministry of Health, but it's also the responsibility of the remainder of the cabinet, where things have to be joined up, right? It's about the money from the Ministry of Finance, it's about electrification of facilities, it's about digital connectivity. So it's a range of things, and having that joined up approach is very important. And so many of the national health compacts, the ones that Minister Pate has developed, Minister Dembi has developed, they do have this joined up vision of all the things that need to come together from across government to deliver better health care. So I think that's very important. And the fourth and final thing I would say is policy and regulatory reform to actually encourage private investment in health supply, in health commodities, in health services. The private sector is not going to come in and produce things if it's not sure about the demand from government, if it isn't paid on time, if it doesn't see the market, right? So there's a very important role for government in all of these four areas. And then now let me come to your stakeholders question. I see a growing interest in the health economy, as one would call it. I see a huge interest in the part of health service providers. I see a huge interest in the part of local community organizations. I see a huge interest even in the part of drug manufacturers, pharmaceutical manufacturers. I see an interest in getting more engaged in this space. It's also a topic of conversation. One hears it more and more. So I do believe that there is a momentum behind these things, and it's time to seize the moment.
And there we go. Seize the moment, but also with government leadership really at the core. But then also acknowledging that the private sector does need to play a significant role in that. Prof. Mohammed, just coming from you, I guess a two-phase question, right? Is what can the private sector do to meet government at its point of need, to share this common goal, but also Dr. Mamta talks about policy reform as well. What the Nigerian government is focusing on to send the message to private capital that it can find a home in Nigeria's healthcare ecosystem and in other areas that contribute to that agenda.
Just like almost all countries, we have mixed health systems that have public and private sectors in financing, but also in the provision of services. And also the ecosystem has many private actors. The question is, how do you organize it in a way that each plays its own role? So in the context of Nigeria, we took the approach of looking at the entire value chain. And there are policy areas, there are regulatory areas that government has to do, that's the stewardship. And there is the financing, some of which is public, and of course the private sector. But the private sector itself has to organize itself, has to have business cases that are market tested, that are not just dependent on government, that are really grounded in sound economics and the needs of the population and their willingness to pay or for others to pay. So with that approach through PVAC, there were incentives, for instance, an executive order. I think we were the first country in the continent to have an executive order to stimulate domestic manufacturing, signed in June 2024 by President Bola Ahmed Tinubu, which provided concessions for bringing in raw materials and manufacturing equipment rather than finished products on the supply side, and on the demand side to allow us to aggregate demand through full procurement mechanisms, advanced purchase guarantees, which had not been part of our procurement laws. That allows us to harness the large market of 230 million people, the demand, to channel it towards local manufacturers. And we've seen that resulting in billions of naira of concessions to pharmaceutical manufacturers who are willing to produce, but also we're seeing increased revenue, and now we're working on them to ensure that the benefits are translated into affordable prices for the population. So on balance, the private interest is important, and the private capital is important. It should be based on sound economics, and the public interest also has to be looked at, and that's where the regulatory side is key, and NAFDAC is maturity level 3. We're working to improve it. Tomorrow, I believe, we'll demonstrate our commitment on the original side by depositing our instrument to join the Africa Medicines Agency Treaty, and Madam Ama is here to be with us, so that the economic space within which manufacturers in Nigeria produce is expanded, just as for other African manufacturers, the Nigerian space is also expanded, because we see ourselves interconnected. So these are roles that government has to do on the policy side, on the regulatory side. Access to capital is key. Yeah. The right type of capital, the patient capital, and so, and capital is willing to take more risk given the nature of our market, but the rewards are high. And we've been fortunate to be able to mobilize some of those through regional multilateral banks, through grant financiers, through our domestic institutions, and the type of capital, because it's not the multi-billion-dollar capital that is needed in wealthier countries. It's really small tickets that are needed, which may not be most efficient for large financiers to come in, but that is what is needed by the medium and small enterprises who exist even in our rural areas, not only on the production side, but also on the service delivery side. And finally, the organization of the market through a group purchasing organization that we created called Medipool is to harness government purchasing power to channel it to those manufacturers that meet certain quality standards. That is something that we think is an innovation, given what our procurement laws had been before. So that's the way we're approaching it, as an ecosystem, basically, that we're building that will harness the healthcare market to grow and contribute to our GDP, create jobs, but also create the commodities that our population will need.
Yeah, and on that note of obviously building this manufacturing capacity so that we are able to produce medicine and vaccines in Africa, so that we build our ecosystem for resilience. Dr. Dembi, because we've seen from crises such as Ebola and COVID how health shocks become economic shocks, but also that transformation can actually come from those crises. And just as we close off the conversation, just some learnings that you can give to us in terms of what other countries can build so that they are resilient to those shocks, and so that they can build further progress on what they have done so far.
Well, thank you very much. I think in Sierra Leone, together with Liberia and Guinea, we suffered one of the most devastating Ebola outbreaks in the world. In Sierra Leone, we had about 14,000 infections and 4,000 deaths. We were not prepared for the outbreak, and I don't think anybody was prepared for the outbreak. But there are solid lessons that we learned from that. The knowledge that outbreaks begin in the community, they end in the community. What we've done is to build a national public health system, a national public health agency that's built on the platform of primary health care. We have just bigger issues that have been discussed at the central level, but most importantly, you have field epidemiologists embedded in the system at the primary healthcare level, tracking routine cases, helping with malaria, TB, HIV, and all of the services, but having the trigger for an early warning system when something is unusual. We want to be able to have a rapid response, to be able to shut it down before it escalates. And that's working for us extremely well. We saw that on display with the Mpox, the recent Mpox outbreak, where we were able to contain it in less than a year with over 5,000 cases, but 99% survival. Yeah, I think we saw that all with that. Some of that preparation, if it's in place, it's able to protect us. We vow that this should never happen again on our watch.
All right. Well, we do have to wrap up the conversation there, but thank you so much for your time. We actually did well on time. Thank you so much for those wonderful insights. Just really some of the things that stood out for me is that we do need government leadership, and we need governments to not only spend more on healthcare, but to spend better, but also that governments do need to have a clear vision, which is also what this strategy is about. It's about setting a clear vision so that all partners can come to the table knowing what the shared goal is, and that there is alignment and accountability, but also most importantly that we build resilience through preparedness. So thank you so much to my panelists, Dr. Mamta Murty, World Bank Group Vice President of People, His Excellency Professor Mohammed Ali Pate, Honorable Coordinating Minister of Health and Social Welfare in Nigeria, and His Excellency Dr. Austin Dembi, Honorable Minister of Health and Sanitation in Sierra Leone. Thank you so much for giving us your ear, and thank you.
2-3. Thank you very much for that wonderful and vibrant conversation, my dear sister Zenati. Although I realize you didn't fight hard for Ghana that much, you know, when Professor Pate and Dr. Dembi were fighting about the jollof, but that is absolutely fine. We're here in Accra, so we'll take anything that comes to us with grace and honor. And with that same grace and honor, ladies and gentlemen, from the Fireside Chat, I would like you to give them a round of applause for setting the tone and whetting our appetites for the conversations that are just about to happen. We're going to move very swiftly into our first round table, or our first ministerial panel. Now, Frontlines First is built on one transformative principle. Quality primary health care must become the foundation of national systems. To explore how countries are strengthening primary health care and placing communities at the center of delivery, it is my honor to invite our Ministers of Health of Senegal, Central African Republic, and Dr. Dembi is back again as Sierra Leone. Please warmly welcome His Excellency Dr. Ibrahima Sai, Honorable Minister of Health and Public Hygiene from Senegal. His Excellency Dr. Pierre Somse, Honorable Minister of Health, Central African Republic. Last but definitely not the least, I come right back to you, Your Excellency Austin Dembi, Honorable Minister of Health and Sanitation, Sierra Leone. Thank you very much, Your Excellency. Merci beaucoup. Thank you. And now, ladies and gentlemen, our conversation for the next 30 minutes. Can I please have one of the translation sets for our minister, kindly? My wonderful, thank you so much. And as we set ourselves ready for this conversation, just a reminder that immediately after the next 30 minutes, we have our next panel as well, our next ministerial panel. We have 3 in 1 over the next hour and 45 minutes. But starting off with Your Excellency ministers here, with all 3 of you having the same question, what does your government believe, or why perhaps does your government believe it is important to invest in strengthening frontline primary health care? And at the same time, how would you say you are prioritizing this in your essential package of services? Perhaps we can start off with you, Dr. Dembi.
Well, thank you very much. Again, in Sierra Leone, we're looking at this slightly differently. We're looking at patient or client-centered care. And client-centered care is situated mostly in the primary healthcare context. So we want to be able to ensure that everybody that comes to a facility has the facility ready to receive them. Secondly, that there's a really strong interface between the facility and the service they render and the community that's been served. So we strongly believe in community healthcare workers that are embedded in there that could shepherd and navigate, identify a pregnant woman and ensure that this woman presents in the facility early. Ensure if there's a baby at home to ensure that this baby sleeps on the net, the baby has their vaccines on a regular basis. If there's an outbreak, that this person who is there, really close to the community, is able to trigger an active response by the facilities. So this interface between the facilities and the communities, with the community health workers as the navigators, the interlocutors between the two, for me is the strongest primary healthcare system that one could look for.
Thank you so much, Dr. Dembi. And can I have you, Dr. Ibrahima Sai, on why your government believes it is important to invest in strengthening frontline primary health care and how you are prioritizing this in essential package of services?
Merci beaucoup pour cette question extrêmement pertinente. Je commencerai d'abord par remercier les organisateurs, notamment le gouvernement du Ghana et aussi la Banque mondiale pour avoir donné l'opportunité d'échanger sur ces questions extrêmement importantes. Et il faut dire, au Sénégal, on considère que 65% à 75% des besoins de santé sont concentrés au niveau des soins de santé primaires. Donc, à notre arrivée, nous avons fait une évaluation, surtout une évaluation de la carte sanitaire, pour voir si celle-ci aujourd'hui correspond au paquet de besoins de santé, surtout soins de santé primaires, par rapport à la dynamique de la population. Et cette carte sanitaire a fait ressortir que nous avons besoin de renforcer tout ce qui est construction des centres de santé, construction des postes de santé, mais développer ce qu'on appelle une stratégie médicale avancée pour que les soins de santé primaires soient mieux accessibles aux populations. Et aujourd'hui, on a un projet de construire au moins 100 centres de santé et plus de 200 postes de santé pour assurer déjà les soins de proximité avec le premier contact. Et cela permettra d'accélérer la couverture sanitaire universelle avec un impact maximal au niveau du pays. Mais cela permettra aussi de réduire les inégalités territoriales et de rapprocher les services de santé aux populations qui ont réellement besoin. Mais aussi d'améliorer la qualité et l'efficience du système en réduisant un peu tout ce qui est référence. Parce que souvent, au niveau du Sénégal, il y a une utilisation à outrance des systèmes hospitaliers. Et aujourd'hui, on se rend compte que si on développe les soins de santé primaires, ça va réduire les références et on va se focaliser sur le niveau communautaire. On va aussi renforcer avec cela la résilience par rapport aux crises, parce qu'on a des crises climatiques, on a les crises environnementales, tous les chocs qui influencent les soins de santé primaires. Mais également, nous comptons avec l'investissement sur les soins de santé primaires, renforcer la protection financière des ménages, surtout que l'assurance puisse être accessible. Mais le plus important qui est aussi nouveau, c'est de voir comment on peut avoir une action sur les déterminants de santé. Le changement climatique est là. Si on ne renforce pas la résilience par rapport au choc climatique, toute la stratégie qui est bâtie autour des soins de santé primaires peut être remise en cause. On peut bien construire des centres de santé, construire des postes de santé, Mais si on n'a pas cette action sur les déterminants climatiques, ça va être difficile. Maintenant, terminer avec peut-être un autre point qui est important, c'est la stratégie de la santé dans toutes les politiques. Parce que l'approche des soins de santé primaire doit être aussi une approche multisectorielle. Il faut que les autres secteurs viennent contribuer à l'investissement, viennent contribuer à un certain nombre d'actions pour qu'on puisse avoir une bonne dynamique par rapport aux soins de santé primaire.
Merci beaucoup. Son Excellence Somsé. Bonjour. À vous, s'il vous plaît. Merci beaucoup.
Vous savez que la République centrafricaine est un pays donc, qui sort de crise. Et de ce fait-là, après près de 30 ans de conflits, d'instabilité politique et sécuritaire, le système de santé est complètement dévasté. Il y a un problème d'accès majeur aux soins. De façon générale, on peut dire que le système de santé du pays est encore resté au niveau où le pays a obtenu l'indépendance. Tandis que la population a augmenté, a été multipliée par 4 ou 5. Et que le réseau de formation sanitaire ne couvre que 50% de la population si on considère les normes de l'OMS qui veulent que la population soit située à moins de 5 km d'un centre de santé. Donc, vous avez plus de 50% qui sont en dehors de 5 km et qui peuvent faire les 2 heures de route, 2 heures qui sont à 2 heures de route du centre de santé. Et donc, il y a aussi le fait que dans ce contexte-là, le coût de la santé, on venait de le dire mon collègue, selon les normes de l'OMS, a atteint un coût catastrophique. La santé appauvrit la population. Dans ce contexte, où la santé, les services de santé ne sont pas rationnels, ne sont pas contrôlés, vous voyez, on est à 50% de ce que représente le taux de la dépense des ménages pour la santé, ce qui représente 50% des dépenses en général. L'OMS estime à 23%. On est sur la côte catastrophique. La santé est en train d'appauvrir, non, mais de plus que ça, parce qu'ils sont déjà pauvres. La santé est une source de misère de la population. Et le personnel de santé qualifié, dans l'autre contexte, on est à 4 à 5 personnes, au mieux à 5 personnels de santé qualifiés pour 10 000 habitants. L'OMS indique 23 au moins pour 10 000 habitants. Vous voyez l'écart. Donc les soins de santé primaire sont indispensables. Et de ce fait-là, c'est un domaine qui a reçu une attention particulière avec l'appui de tous les partenaires, la Banque mondiale, le Fonds mondial. Nous sommes passés en 3 ans, déjà nous sommes passés de quelques centaines d'agents de santé communautaire à 8 000 agents de santé communautaire. Nous visons 20 000 agents de santé communautaire dans le pays. Nous avons également commencé à engager les matrones, puisque la mortalité, dans ce contexte, la mortalité maternelle dans notre pays était de 882 décès pour 100 000 naissances. C'était l'un des taux des plus élevés au monde. Et donc, on est obligé de faire appel à tous ceux qui peuvent aider. Et les matrones, les accoucheuses traditionnelles font légion. Ce sont elles, les sages-femmes. On est obligé de leur faire appel et on a formé 5000 matrones pour faciliter l'accès aux services. Alors, l'important des soins de santé primaire est aussi basé sur l'approche basée sur les déterminants sociaux de la santé, qui met en avant les populations elles-mêmes. Les populations elles-mêmes, c'est-à-dire qui sont les premiers déterminants de leur santé, leur rôle, leur responsabilité. Et donc nous mettons énormément l'accent sur le rôle, sur la place de la population. Comme le disait un collègue, et pour moi, la population est la première épidémiologiste dans la lutte contre les épidémies. Parce que l'épidémie, elle est la première personne à vivre, à constater une épidémie et à le notifier, on appelle le notifier.
Absolument.
Si elle ne décide pas de le notifier, on ne le sait pas ou on le sait bien plus tard. Donc c'est le premier épidémiologiste et l'accent mis sur la population est important. C'est pour ça qu'aujourd'hui, l'un des investissements que nous faisons, c'est de construire un centre multimédia pour éduquer la population, informer la population.
Donc l'éducation, c'est très important.
Très important, parce que il faut que tous ces investissements que nous faisons, si la population n'est pas apte, si elle ne connaît rien, si elle n'a pas un minimum de compétences, ça ne sert à rien.
Merci beaucoup. Merci beaucoup, Son Excellence. Excellency Dembi, I mean, we've heard about the essence of almost the population taking its own control. We've heard about the essence of education from Excellency Somse. Now, Sierra Leone has been a leader in reducing maternal mortality. So you are an example. And currently you are leading an effort to further strengthen delivery of high-quality RMNCAH+N services. Now, Minister Dembi, how are you doing this? How are you achieving your goal?
Well, thank you very much. I think it's a combination of factors. In Sierra Leone, we have been able to reduce maternal mortality from 1,600 per 100,000 live births, nearly twice what my colleague Dr. Somse was saying. We've reduced it to less than 350 per 100,000.
I think that deserves a round of applause. Success. Yes, sir.
And the latest numbers we're waiting to come out, it's dropped below 200, and I think it's going southwards. So for us, it's a combination of factors. I just mentioned what we're doing in Sierra Leone now as we speak. We know what works. Yeah. We know all the levers that allows to ensure that every pregnant woman delivers safely. Yeah. We know what it takes for every child to survive. And so that's why on February 14th in Addis, my president stood up and said, we are going to declare 300 days of activism where every day counts. We will focus on 0 preventable maternal deaths, 0 preventable child deaths, and 0 those children. So what that means is we have, in the whole country, we've moved into action, ensuring that the nurses are ready, the midwives are ready, the community is ready, the chiefs are ready, the neighbors are ready, the labs are ready. Everybody is working, and we've underlaid a digital system that tracks everybody. We have a tool that we developed locally, an app that allows you to register every pregnancy with a complete profile of the pregnancy. And we track that all the way to liver delivery and beyond. So today is day 60 in that movement. And what we want is, if we have a death, we'll audit it immediately to find out if it was preventable. If it is today, next week, we'll make sure that that's addressed at the country level. Okay. And we have the digital infrastructure that's allowing us to do that. So it's really exciting for us in Sierra Leone.
It's exciting, but there's also a lot of intentionality, all hands on deck. Your Excellency, Dr. Sai, Dr. Dembi has described Sierra Leone's example, all hands on deck, but we cannot continue without acknowledging the fact that shortages of healthcare workers are a significant constraint to expanding access to quality, affordable care. So I want to find out from you from the Senegal perspective, and I'll also come to you, Your Excellency Somse, from the Central African Republic perspective. What steps are your governments taking to build and sustain a skilled, motivated health workforce, including community health workers and midwives? Excellency Sai.
Merci beaucoup. Il faut dire qu'au Sénégal, il y a une longue tradition de gestion des ressources humaines une bonne même gestion des ressources humaines au niveau du secteur de la santé. Parce que la stratégie globale, c'est de planifier, de former les ressources dont on a besoin, mais de les recruter, de les déployer dans les zones, avec aussi une approche pour les fidéliser et les motiver davantage. Et on met l'accent pour cela sur les agents de santé communautaire et les sages-femmes, parce que le docteur Demi vient de nous faire part des progrès qui ont été obtenus au niveau de la Sierra Leone. Et en partie, il faut le dire, si on réduit aujourd'hui la mortalité maternelle, néonatale et infantile, il faudrait aussi imputer cette bonne stratégie, cette avancée à tout ce qui est sages-femmes, gynécologues, mais également les agents de santé communautaires. Donc, la stratégie globalement, c'est planifier et gérer les effectifs. C'est de recruter et de stabiliser, c'est de renforcer un peu la formation initiale et continue. Et il faut dire qu'aujourd'hui, l'État du Sénégal, en plus des expériences passées, parce qu'on a eu ce qu'on appelle ISMEA, investir massivement dans la santé maternelle, néonatale et infantile, où la Banque mondiale avait autorisé que l'on puisse recruter plus de 890 agents qu'on a injectés pour résorber les gaps. On a eu un partenaire, Bifet, qui nous a aussi donné la possibilité de recruter 290 agents. On a le projet Suède. Donc la stratégie, c'est qu'une fois que ces agents terminent leur contrat avec les programmes, qu'on puisse les retenir au niveau de la fonction publique ou dans la contractualisation, parce que ce sont des expériences qui ont été réussies et qui nous ont permis d'accélérer nos indicateurs de performance. Mais aujourd'hui, la dynamique pour 2026, c'est de recruter au moins 2500 agents. Et parmi ces 2500, nous aurons plus de 1500 qui seront des médicaux. Il y a des paramédicaux et aussi des personnels de soutien. Un aspect qui est aussi important, c'est voir comment professionnaliser les acteurs de santé communautaire. Parce qu'aujourd'hui, ils sont quand même dans la chaîne de délivrance de services et il est important qu'ils puissent être sécurisés, qu'ils puissent être professionnalisés pour que les actes qu'ils posent répondent aux critères de sécurité, mais également de qualité, et puissent aussi donner l'assurance à ceux qui reçoivent ces soins-là. Il y a la motivation, il y a tout ce qui est fidélisation dans les zones éloignées. Donc globalement, l'objectif est très clair, c'est de disposer d'équipes complètes et compétentes au niveau primaire avec des sages-femmes et des acteurs communautaires. Et ça me permet de faire un plaidoyer aujourd'hui. C'est qu'on ne peut pas développer durablement nos systèmes de santé si on n'investit pas dans des ressources humaines de qualité. Et souvent, je pense qu'il va falloir aller vers ce qu'on appelle le plan Marshall des ressources humaines en santé pour que nos populations puissent avoir à chaque poste, chaque centre de santé, les praticiens, les professionnels de santé dont ils ont besoin pour se soigner correctement sans avoir besoin d'aller au niveau des hôpitaux qui sont souvent très engorgés.
Merci beaucoup. I come to you, Your Excellency Somse. Let's talk about the Central African Republic's examples of, building and sustaining skilled, motivated labor.
Merci beaucoup, Madame. Comme je l'ai dit, l'un des maillons, le maillon le plus faible de notre système de santé centrafricain porte sur les ressources humaines. Et de ce fait-là, donc notre gouvernement a accordé l'une de ses plus hautes priorités au développement des ressources humaines. On a une stratégie nationale de ressources humaines qui a été développée, qui va être bientôt examinée par le gouvernement, mais entre-temps, nous avons, du fait que le président de la République a déclaré la mortalité maternelle une urgence nationale, donc pris des mesures d'urgence pour tout en engageant des actions à long terme. L'urgence, c'est ce que je venais de dire, c'est déployer des agents de santé communautaire de l'étendue du pays. On a un objectif de 20 000, on a déjà 8 000 agents de santé communautaire déployés. Et on mobilise aussi les matrones qui sont déjà dans les communautés. Il s'agit de rationaliser leurs pratiques et de les rendre, de les mettre aux normes. Et on a des matrones qui sont de plus en plus jeunes. Ce ne sont plus des vieilles mamans comme avant. Nous avons également, grâce à l'appui des... Tout ça, c'est grâce à l'appui des partenaires, le Fonds mondial, la Banque mondiale, la Fondation Buffett et Gavi contribuent. Nous avons également le recrutement du personnel qualifié. Donc, les personnels qualifiés, là, c'est vraiment un point important. Les partenaires ont accepté, comme vient de dire mon collègue du Sénégal, de recruter, d'aider le gouvernement à recruter du personnel qualifié, quitte à ce que le gouvernement les intègre dans la fonction publique. Et ça, on a presque 1200 personnels qui ont été recrutés et dont certains sont déjà intégrés dans la fonction publique. Et alors, pour le long terme, il y a le renforcement des structures de formation. Le pays, contrairement aux autres pays, n'a qu'une seule université, d'abord, et une seule école de formation d'infirmières et de sages-femmes. Donc la production est extrêmement faible, affaiblie, aggravée par la crise. Donc le gouvernement a pris la décision, avec l'appui des partenaires, la Fondation Buffett particulièrement et la Banque mondiale, de créer des écoles régionales. Parce que l'un des problèmes qu'on a aussi dans la formation du personnel, quand les gens sont formés dans la capitale, ils ne veulent plus aller en province. Les sages-femmes ne vont pas en province. Donc, c'est de former des gens dans leur région pour qu'ils travaillent dans leur population. Donc, on a 5 écoles régionales qui sont créées et qui ont ouvert leurs portes déjà en octobre, qui ont déjà commencé à former pour que d'ici 4 ans, nous puissions avoir au moins 500 personnels de sages-femmes ou assistantes accoucheuses formés. Nous envoyons du personnel formé dans des écoles, donc bien sûr au Sénégal, au Cameroun. Et l'un des domaines où on souffre et qui affecte la santé de la mère et de l'enfant, c'est l'anesthésie et réanimation. Beaucoup de femmes meurent pour la mauvaise anesthésie, mauvaise réanimation. Donc on envoie des infirmiers être formés en anesthésie et réanimation dans les pays environnants. Mais je crois, avec mon collègue du Sénégal et de Burkina Faso, nous avons commencé une discussion et qui pourrait, dans le cadre de ce compact avec la Banque mondiale, trouver un écho important. C'est que lorsqu'on considère la masse des ressources humaines de façon générale à l'échelon continental, on peut trouver des solutions à ces problèmes. En attendant que nous, en République centrafricaine, on ait du personnel qualifié, il y a du personnel qui chôme au Sénégal. Il y a des médecins, il y a des infirmiers qui chôment au Sénégal. Et nous avons un plan, justement, de transition qu'on a élaboré avec l'appui de la Banque mondiale pour recruter du personnel étranger qui pourrait venir combler ce vide en attendant que nos écoles mettent à disposition les compétences nécessaires.
Merci beaucoup, merci beaucoup. Now, I bring it to you, Excellency Dembi, Excellency Sai. Excellency Dembi, you touched on digitization, and it's a crucial part of your strategy. We all know that quality real-time data is key to better service delivery, hands down, and of course, looking at target areas and their greatest need. What steps, if you can share with us, are your governments taking to invest in digitization of the health sector and, of course, eventually improve data use for major decision making?
I think it's very, very important because for me, that's one of the areas where we've been working blind for quite some time. We hope and we pray, and expert knowledge tells us that this is where you should invest. But I think putting money into digitization allows you to be able to really understand the circumstances of your country, the status of health in your country, and allows you to intervene in a timely manner. So for us, we're working not only in Sierra Leone, but I think we're working with other countries, with Senegal, with Ethiopia, with Rwanda and Nigeria, we have a new initiative that we're looking at that's saying, how could we have useful data sovereignty that will allow us to understand our situation and make the changes necessary? So for us, it's multi-layered. We've invested in central hubs at the national level. We're investing in district level hubs. We're investing at the individual level to be able to amass that data, analyze the data, and act on the data. The backdrop to this is we used to have the DHS survey, which is a 5-year retrospective that is completely useless by the time it lands on your desk. What we're looking at now is ensuring that this week, I know the health situations in every district in my country. I want to know who delivered safely, who died. The next question is, why did they die? When I understand that, I will fix it not only for that district, but we've created a national network that allows this to be a teachable moment, a learning moment, so that the people in different districts will learn from what's happening in a particular district and do corrective actions. Again, we're not going to rely on opinions. We're relying on data.
Yeah.
The data could whisper to you, but the data could also scream at you. What we had in the past is collection of data without the necessary analytics associated with it. At times, the data is screaming at you, and you don't
Tells
even
you the truth,
realize it.
yes.
So in Sierra Leone, when we found out what the maternal mortality was like, we had Ebola, where 2,000 people died a year. For 2 years, 4,000. Well, if you have 2,000 women dying a year, that is a national emergency.
Yeah.
So we used the posture of an emergency response in our primary healthcare system, in our managing maternal health. And I think that's why you're seeing such rapid changes that are taking. We're tracking every case. The digital option, quite frankly, it's not an option.
Yeah.
It's an
It's a
imperative
necessity.
for where we want to go.
Absolutely. Dr. Sai, Your Excellency Sai, if I can ask you the same question about digitalization and sharing a few steps your government is taking to invest in that space in order to fast-track solutions.
Merci beaucoup. Vous savez, au Sénégal, nous faisons de la donnée un outil de pilotage du développement sanitaire, parce que c'est important. Quand on n'a pas la donnée, on ne peut pas planifier. Et nous sommes aujourd'hui en train de travailler sur une nouvelle initiative avec aussi la Sierra Leone, Centrafrique, le Burkina Faso, initiative de Centre national d'intelligence sanitaire qui va regrouper le dossier patient unique, informatisé, la télémédecine, mais également l'intelligence artificielle. Et cela va pour nous renforcer ce qu'on appelle la gouvernance de la santé digitale et de permettre d'accélérer au Sénégal. Parce que nous l'avons commencé avec le projet PAINS. Le projet PAINS est financé aussi par la Banque mondiale. C'est un projet d'appui à l'économie numérique au niveau du Sénégal, qui a une grande composante dossier patient informatisé que nous avons commencé à déployer dans un certain nombre de structures de santé, parce qu'on sait que cela réduit le risque de déperdition des données et l'État y accorde une importance particulière. Et le projet est actuellement très bien en marche au niveau du Sénégal. Notre priorité est vraiment d'investir dans des systèmes intégrés, des systèmes de données intégrés, sécurisés, interopérables, parce qu'il faut que les bases de données dialoguent, il faut que les systèmes dialoguent. Si on parle de dossier patient, c'est qu'un patient consulté à Dakar qu'on puisse utiliser son dossier dans une autre région, à Matam ou à Thiès, afin que chaque individu du poste de santé au niveau central puisse prendre des décisions qui sont fondées sur des preuves scientifiques, des preuves matérielles, et que la planification qui est réalisée puisse être basé sur des indicateurs que nous pourrons suivre, que nous pourrons évaluer et que dont nous pourrons voir réellement l'impact en termes de redevabilité au niveau de notre politique de santé.
Merci beaucoup. Now, ministers, I'd like us to bring this conversation to a close. We only have 5 minutes to go. I want to start off with Excellency Somse. I know digitization is important to you. I know education is important to you. I know human resources is important to you. When you think about all the crucial elements, what do you think are the greater opportunities for collaboration with the World Bank and, of course, the GFF, the Global Financing Facility, to accelerate progress on a defined RMNAC H+N package deliverable at primary health care level nationwide, sir?
Merci. Bon, d'abord, avant de parler d'opportunités, il faut d'abord reconnaître et exprimer notre gratitude à la banque pour le travail qui se fait déjà. Pour un pays comme le mien, le rôle de la banque a été très déterminant pour sortir le pays du gouffre dont je vous ai parlé, de l'abîme. La banque a appuyé le pays pendant toute la crise. Aujourd'hui, je dois vous dire que le taux de mortalité connaît un déclin en puissance africaine. On est passé de 892. Aujourd'hui, en 2023, il est à 692. Déjà, grâce à tous les investissements qui ont été faits en la période. Et aujourd'hui, donc les bases, la banque a joué un rôle catalytique avec le Fonds mondial, avec d'autres, pour vraiment maintenir la lampe allumée pendant qu'on était dans l'obscurité. Il faut déjà reconnaître ça. Et tout ce dont on parle aujourd'hui est déjà en place. Disons, les bases sont déjà posées. Donc il s'agit pour la banque aujourd'hui, avec cette initiative que j'applaudis, d'aller à l'échelle. D'aller à l'échelle. Il y a une opportunité pour la banque d'être un catalyseur d'impact à grande échelle. Il faut qu'on sorte de la culture des petits projets ici, localisés là et tout ça. Il faut qu'on sorte de ça. On ne pourra jamais aider les pays à se développer, à aller dans la croissance avec des petits projets. Il faut du courage, il faut de l'audace, il faut la foi. C'est ce qu'on attend de la banque. Tout est là. La banque a toujours de très bonnes idées. Merci. Et par rapport à ce projet, il y a l'opportunité que la banque joue un rôle au-delà de l'argent. C'est d'être un avocat, un défenseur des pays pour plus d'alignement, pour plus de cohérence, pour l'impact, comme on l'a dit ici. Et qu'on passe du discours à l'acte. Et que, effectivement, le capital humain soit au cœur de la croissance. Et je dois le dire, j'en ai beaucoup discuté avec mes collègues de la banque. C'est depuis longtemps qu'on sait que la santé, c'est un investissement. Mais pour le traduire dans les faits, à travers les investissements que la banque a fait dans le pays, à travers les transactions qu'elle a faites dans le pays, c'est difficile, ça ne se voit pas. Il faut que la banque soit claire avec nos gouvernements. Et que tous les mécanismes financiers, la FMI et tout, qu'ils cessent seulement de parler de l'économie, des recettes, des revenus. Ils ne parlent pas des humains.
Merci.
Donc, c'est ça qu'il faut pousser. Ce projet, je ne peux pas aller dans les détails, ce projet est excellent.
Excellent. Merci, c'est excellent.
Et moi, j'ai déjà demandé que hier, depuis hier, que la banque aille à Bangui et qu'on puisse penser à la mise en œuvre.
Merci beaucoup, Son Excellence. I have literally a minute left. Your Excellency Dembe, we'll start off with you. Your last words when you think about collaboration, World Bank Group, the GFF, what would be your last words, Your Excellency?
I also serve not only as Minister of Health for Sierra Leone, but I'm also the chair for the Interministerial for GFF. It's a forum for us to share experiences and expertise. So again, you want to look at the network of African nations in solidarity. The problems I am dealing with might have solutions in Senegal. They might have solutions in Central African Republic. By us working together, we'll be able to lean on each other. We're working for the same African people. And so a space where we could support each other is critical. And I think the bank has been a true partner with us. The GFF has been a true partner with us. We'll just say, let's double down on these successes.
Thank you so much. Your Excellency Sai, you have 30 seconds to give us your last words, sir.
Merci beaucoup. Comme c'est 3 secondes, je vais conclure par remercier la Banque mondiale aussi, qui est un bon partenaire du Sénégal, mais remercier aussi GFF et les autres partenaires qui travaillent en complémentarité. Il faut qu'on travaille en complémentarité. Les pays sont en train d'élaborer des compacts. Il faut que ces compacts adressent la question des gaps. Ces gaps, ça peut être des infrastructures, ça peut être des équipements, mais ça peut être aussi des ressources humaines pour qu'on aille vers plus d'efficacité et plus de performance. Merci.
Merci beaucoup. Ladies and gentlemen, I've had His Excellency Dr. Ibrahim Sai, Honorable Minister of Health and Public Hygiene from Senegal. A round of applause. I've also had Honorable Minister of Health, Central African Republic, His Excellency Dr. Pierre Somse, and Dr. Austin Demby, Your Excellency, Minister of Health and Sanitation, Sierra Leone. Thank you very much for taking us through our first conversation, which was Front Lines First. Thank you very much, Your Excellencies. And as my wonderful media professional takes photos, I move into our second conversation, our second ministerial series. It is called Fixing Finance. If Frontlines First defines what must be delivered, then Fixing Finance determines whether those services can be truly sustained at scale. Please allow me to bring to the stage our 3 representatives, or our 3 conversationalists. Honorable Minister of Finance from Liberia, Your Excellency Augustine Pehe Ngafuan. You're waiting for me? Okay, no problem. In 3, 2, 1, thank you very much, sir. And then may I kindly have the Chief Executive Officer of the National Health Insurance Authority, my big brother, Dr. Victor Bampo, if you're here. And finally, definitely not the least, our big sister, Professor Awa Marie Kolsek, President of Galian Africa. Please, a warm African and Ghanaian and Accra welcome to our participants of this session we like to call Fixing Finance. Please. You can sit anywhere you feel most comfortable. Maybe you can sit right under your name, if you like. I've changed it. Yes, sir. Yes, madam. Yes, madam. Your Excellency, Dr. Bampo, you are welcome. Ladies and gentlemen, are we still alive and kicking? Proof of life, a round of applause. You are there. Thank you so much. Excellencies, thank you so much for joining us for this conversation on fixing finance. Dr. Bampo, I took your microphone away from you. Your Excellency, may I ask you to kindly pass this down to him, please? Allow me to start off with you, Excellency Ngafuan from Liberia, and of course, you as well, Professor Kolsek. Let's talk about health as an investment in future growth. Now, today, we're looking at the challenges with macro-fiscal context, why, we're losing ground a little bit. But let's bring it to the light at the end of the tunnel. Why and how, I would start off with Liberia, is your government working on expanding fiscal space for health?
Thank you very much. Let me, before I launch into your question, thank our colleagues from the World Bank for this invitation. I'm here because we take this sector very seriously. Health, as is often said, is wealth. Liberia has had multiple challenges over time, war. The world got to know about the COVID crisis, but before then, we, meaning Liberia, Guinea, and Sierra Leone, we experienced a major shock, the Ebola crisis. Our population, we lost more than 5,000 persons, a little bit above Sierra Leone. So we were the most affected. So when it comes to health, we've been taking some actions. There's a new government that was inaugurated in Liberia, headed by President Joseph Newman Barker in 2024, and health spending has been increasing. In 2024, we budgeted about 80.3 million to health. In 2025, we increased it to 91.3 million. Now, for 2026, we have increased it by 21%. It is now about 110 million to health. What we are doing is that the economy as a whole, we are increasing fiscal space by increasing domestic revenue generation. Our budget has increased since 2024, when the budget was around 738 million. We're not talking about 1.3 billion. So the higher the fiscal space, the higher to have in aggregate, in absolute terms. We are also mobilizing other partners, non-traditional partners to health. Traditionally, it's been World Bank, USAID, and others. I know we don't have too much time, but we experienced a major shock last year when USAID had to shut down, but we stepped up through other means. When we have time, we'll give you some more information. We also, in terms of fiscal space, as we talk, we are contemplating on a Liberia Health Equity Fund. And we are looking, besides the normal budget support, we are contemplating on different other sources that will include even from the mobile telecom sector, that will include some charge, VAT charge, that will include concession, money from concessions, that will include from environmental pollution. So we are just about finalizing it and to send it to the legislature for approval in order to improve or to assure universal health coverage. Yeah.
Thank you so much, Your Excellency Ngafwan. Your Excellency Kolsek, I know that you are former health minister of Senegal, so you are very well versed when it comes to needing to make more money available for the healthcare sector. But of course, in your capacity now as president of Galien Africa, let's look at why you believe that governments need to make more money available for healthcare.
Thank you for the question. I will speak in French. Je voulais dire que, effectivement, il y a eu beaucoup de progrès qui ont été faits, on peut dire, en Afrique d'une manière générale et dans cette sous-région. Mais on doit utiliser encore mieux les moyens que nous avons. Même s'ils ne sont pas suffisants, on doit pouvoir mieux les utiliser. Mais on doit aussi faire plus. Monsieur le ministre des Finances l'a dit, il y a eu une augmentation dans son pays de ce qui va vers la santé, parce que c'est insuffisant. Et je voudrais vous dire que j'ai eu, lors de mes mandats, plusieurs exemples où même les partis d'opposition étaient pour la santé. Ils supportent la santé et ils sont toujours là. Il y en a même un qui a dit « Je ne vais pas voter le budget de Madame le ministre, pas parce que ce qui se fait n'est pas bon, mais c'est parce que c'est insuffisant. » Donc, il y a les deux points. Il faut mieux utiliser l'argent qui existe, mais il faut également augmenter cet argent-là à travers des mécanismes innovants. On les connaît. On connaît l'augmentation domestique à travers des taxes sur certains produits qui sont notamment nocifs pour la santé, mais également on sait que l'on peut avoir des financements innovants autres, et cela, certains pays sont en train de les utiliser. Donc pour moi, en résumé, mieux et plus.
Merci beaucoup. Dr. Bampo, I think Her Excellency Kolsek has said something crucial. There is not a lot, but we need to maximize the little we have, so to speak, and we need to find a way to allocate it a lot better. Now, when we come to your perspective, Adequate financing for primary health care, clearly, it has been said all morning, is a top priority for this region. Now we're speaking specifically about the West and Central African region. Ghana recently announced a free primary health care initiative. Can you share the vision for this program and how is it taking shape?
Thank you very much, Anita, and it's always a pleasure to see you.
Thank you, sir.
So it's an exciting time in Ghana, and it's an exciting time because I won't call it new, not so new government of President Mahama did something novel, and that is they uncapped the National Health Insurance Fund. As you know, we get our funding at the National Health Insurance Scheme from the 2.5% of the levy that is placed in the VAT. But the previous government had put a cap on it, so about 30 to 40% was not coming to the fund. Now, what the president did was to do the uncapping of that fund, which has brought us about $300 million more of funding. So we are able to do so much more with this funding. And that is why we are engaging in the free primary health care as one of the pillars. So I need to explain that in our quest to move on to universal health coverage, we're doing 2 or 3 things. Number one, we are making primary health care free, which would serve as an entry point for people to come into the healthcare sphere. Then we have the normal National Health Insurance Scheme, and then there's also the Ghana Medical Trust Fund, which is then looking at non-communicable diseases. Now, this is informed by our epidemiological transition. As you know, right now, up to 42% of all-cause mortality in Ghana is caused by non-communicable diseases. So we are pivoting towards putting our money where our mouths are and where the challenges are. So essentially, we have end-to-end health care coverage, from free primary health care to the normal National Health Insurance Scheme to the Ghana Medical Trust Fund. Now, the other thing is that, just to go a little bit into the free primary health care, it has something that we call, my minister likes to call the game changer. And we're moving from sick care, where we sit in the clinics and hospitals and expect the patients to come in, to health care. So the preventive promotive is going to have the health workers going out on outreach, trying to take these messages and to actually catch people before they develop diseases that will be more expensive to treat when they become, like you have a cancer, if it's caught early, you can treat it better. So that is the way we are. The last thing I'll say is that we are using some kind of innovative mechanism. So imagine, if you will, a lady sitting in a market selling tomatoes or something. The will to go to hospital is probably minimal because, she doesn't have the time, probably the disposable income. You make primary health care free, so you reduce the financial barrier, right? And then we have kiosks in some of these marketplaces and high volume areas, so you also make access much easier. We're trying to cure 4 things with this free primary health care. The first one is to reduce the financial barrier. The second one is also about awareness of some of the diseases. So low awareness, if you screen early, you catch early. That would then reduce the problem with late detection. Now, as we do all this, we are forced to retool our health facilities. So those system gaps and those gaps with equipment and health personnel, we are forced to deal with it as well. So that is where we're going with this free primary health care.
Thank you so much, Dr. Bampo. But let's address the elephant in the room. I have a Minister of Finance here, so maybe the statement I'm about to make may not be extremely palatable, but I think there's some data that proves that I'm right. Finance ministries often voice concerns that the health sector does not pay enough attention to efficiency. Your Excellency, am I right or wrong? I hate to put you on the spot, but you can tell the world whether I'm right or wrong.
I would not join that chorus, especially given the fact that
you are outnumbered today.
Besides being outnumbered, my colleague, the Minister of Health of Liberia, is here, Dr. Poto, and she's been taking a lot of steps with her team to improve efficiency.
Okay.
So that reality, yes, there are some areas that we need to improve, but given where we started from and where we are, I think I want to celebrate the improvement mode and the challenges.
Okay, so I'll come to Dr. Bampo, but can I please get a microphone to our health minister here? Because I want us to be an example of what works between health and finance. And I'm not putting you on the spot either, madam. I'm just going to ask you to confirm how your relationship works. Can we have a microphone, please? Minister of Health, I'm going to give you 30 seconds to show us the example of a marriage, a perfect marriage between Ministry of Health and Ministry of Finance. How does your relationship work?
On a moderator, maybe before she comes in, let me give you some data.
To help her answer?
No, she'll answer. But let me give you this.
Okay.
One of the problems we face, finance minister countries, it's one thing to budget for health. It's another thing to spend what you budget for health.
Good.
So, you know, the data shows that in our region, 6%, you know, of the budget is allocated to health. Liberia, we are above that. This year, we are about 9%. Part of it is that we have a bigger base. Last year, we were about above 10%. But let me give you this data. In 2023, 70% of what was budgeted for health was spent on health.
Okay.
In 2024, that percentage increased to 88%. Last year, 2025, the health sector, we spent 97.7% of what we budgeted for health.
Stop right there. Madam.
So I think the answer is financial accountability.
Financial accountability. And how does it work? Because this is a practical session. How does it work? How does your relationship work?
You, the finance ministry, you always have to be knocking at the doors and ensuring that you let them know that health is wealth, and that if you have a healthy population, you will have increase in the economy.
Thank you so much. Okay, so we have a practical example. Unfortunately, we don't have the Ghanaian example that I could have put on the spot, but we have you, Dr. Bampo. We've seen Liberia's example. Let's talk about Ghana's NHIA. How does your organization work to mitigate and respond to this kind of example, such concerns that ministries of finance say, well, we give you the money, you don't use it adequately? How does it work?
So I cannot allow Liberia to take all the credit, given that
at first it was Ghana versus Nigeria, now it's Ghana versus Liberia. Let's go, all for a good cause.
No, we do have a fantastic example. I already talked about His Excellency uncapping the funding, and I was listening to Madam Vice President of the World Bank talking about cabinet and the tensions. But actually here in Ghana, what has also happened is that there has been three kinds of shifts. And we have a fantastic health minister, fantastic minister of finance who understand each other and under the leadership of His Excellency the President. The mindset shift means that when you go to cabinet, and I've been privileged to sit in sometimes just to listen, you find that the Minister of Finance is sometimes actually the person who's advocating for health. So he doesn't think that health is a cost driver, but it's an investment center. And the Minister of Health thinks the same. We have a reality shift because we know that we had the stop work order from the US and we had to actually fund some of these things. So we started to put money into areas of priority for health. And then we have the focus shift, focusing on some of the things that actually do matter. And the best example I can give you actually is, first of all, the money is coming in, but the free primary health care, for example, because what it's going to do is that, as I said earlier, if we do it properly, it's going to turn off the tap where we're going to reduce the cost on the more expensive side. So here, and then the final thing I'll say, in my business, there are three figures that actually matter most. The first one is how much money that the Ministry of Finance will calculate will come to us from the 2.5% tax. The second is how much is appropriated, how much is actually put in your budget. And the third is how much you actually get. For the first time ever in 2025, those three figures merged. I think we deserve a round of applause. Yes.
Round of applause.
So they were the same figure, because usually the three differ. They tell you you'll get 10 billion, they put 7 billion in the budget, and you actually get 6.5. Last year, it was 10 billion, 10 billion, 10 billion.
Unbelievable. Your Excellency Kosek, you must be excited at watching, the salsa dance and hearing about the numbers and the figures that match. Let's come back to the gap between what is budgeted and what is spent. From your experience, from where you sit as Gallian, what steps do you believe governments, organizations should take to improve budget execution and unlock more domestic resources for health, ensuring that primary healthcare systems actually are able to function when the unpredictable happens?
Tout d'abord, je voudrais juste commenter rapidement sur les relations entre les ministres de la Santé et les ministres des Finances. Et je crois que si nous en sommes arrivés là, c'est parce qu'il y a eu un changement dans la manière de faire le plaidoyer et dans la manière même d'apporter les arguments. Un ministre des Finances se retrouve avec l'eau, l'électricité, l'éducation, tout est prioritaire. Et la santé, avant, venait et disait, voilà, les personnes vont mourir, il faut faire quelque chose. Et voilà. Le ministre des Finances dit, oui, je veux bien, mais je n'ai pas assez d'argent. Donc, si vous apportez maintenant des arguments qui sont des arguments économiques, des arguments qui montrent que la santé contribue à la croissance économique, c'est beaucoup plus... Le ministre des Finances comprend mieux. Donc je crois que les ministres de la Santé ont changé un peu de style et les ministres des Finances comprennent beaucoup mieux maintenant que la santé, c'est un investissement et ce n'est pas simplement un coût. Maintenant, considérant les autres aspects de gap, comment il faut faire, je pense qu'il y a aussi un élément important au niveau de tous les ministères des Finances ou de la Santé. J'en parle parce qu'en tant que présidente de Galien Afrique, j'ai une plateforme, on organise une plateforme multisectorielle avec tous les acteurs de la santé. Et donc, on parle aux ministres, on parle aux parlementaires, aux communautaires, on parle un peu à tout le monde. Ce qui fait qu'on se rend compte qu'il y a des défis. Le premier défi, on en a peut-être parlé, mais je voudrais insister dessus, c'est que les pays maintenant ont aussi décidé d'avoir leur compact ou leur investment case. Ce qui fait qu'on peut aujourd'hui dire à un partenaire, voilà mon plan, soutenez-nous, mais suivez ce plan-là. Donc, ce qu'on appelle l'alignement. Donc, l'alignement permet de régler aussi certains problèmes dans le cadre donc, de l'effectivité des finances. Mais également, ça évite les programmes verticaux et donc, ça permet de pouvoir être moins fragmenté. Et donc, il y a aussi des économies qui peuvent se faire. Donc, considérant donc le gap qui existe, c'est parce qu'il n'y avait pas la structure et les plans peut-être en commun pour pouvoir travailler ensemble. Donc, je pense que ça a apporté beaucoup de choses et ça diminue peut-être le gap qu'il y a et qu'on observe entre les budgets eux-mêmes et l'utilité et ce qui se passe sur le terrain. Ensuite, nous avons tous parlé de soins de santé primaires. Et on l'a dit que les soins hospitaliers sont beaucoup plus coûteux que les soins de santé primaire, qui sont plus efficaces, qui permettent de faire et de la prévention et du traitement. Et cela, à mon avis, va diminuer aussi le gap, parce qu'on aura moins de moyens à mettre dans les structures hospitalières, parce que les malades viendront moins, parce que le problème sera réglé au niveau des soins de santé primaire. Donc, tout cela ensemble permettra de faire des économies, mais aussi de mieux utiliser, ça j'insiste beaucoup dessus.
Merci beaucoup. Your Excellency, Ngavo, I would love to now have you highlight how you have reduced that gap between what is budgeted and what is spent. Take us through some of your practical, I know you shared the data so proudly. Take us through some of the examples. How have you done it?
Well, besides the health sector, you know, you have monies in budget, but things need to be procured. Procurement is a challenge. Like last year, we introduced an e-procurement platform to increase the integrity of procurement and the efficiency. But because it was a new system, there were challenges. The learning curve was a little bit difficult for some line ministries and agencies, including the Ministry of Health. When we saw the data, by May of 2025, our health spending was minuscule. So what we did, we introduced something called a deep dive that I, as Minister of Finance, and my team, we went to the Ministry of Health. She brought all her experts, and we decided to go through the problems, whole day. And we identified all the bottlenecks and challenges, and we came up with something like a compact. What we would do at Finance and what they need to do. And we linked all our experts, on their side, the budget folks, the comptroller, the accounting general, and I think that if we look at scoring in terms of disbursements to have 97.7, that was one of the key things we did. Yeah. But we did other things, but that was key for turning things around. We noticed a problem, and we challenged the problem head on.
Wonderful. Thank you so much for explaining that example. Now, to all three of you, my esteemed panelists, now let's bring it home to this collaboration between our region and the World Bank Group. From where you sit, where do you see the opportunity for greater collaboration, for a collaboration that is a partnership and not necessarily just support, just leaning on someone or leaning on an organization, but what this collaboration looks like for better health systems in our individual countries, or perhaps from the perspective of even Galien Afrique. Let me start off with you, Your Excellency.
Let me say something. You talk about fiscal space. One thing I want to bring out here is debt service and what it is doing in constricting fiscal space. Liberia had a huge debt overhang when former President Ellen Johnson Sirleaf took over in 2006. We had to go through the HIPC process. We had almost $5 billion canceled. So we started, in terms of external debt, at a clean slate, but it's been going up. Last year's budget, or this year's budget, the amount that is in our budget for debt service is almost equivalent to the amount that we have for both health and education. That's how huge debt service is. And next year, debt service is going to rocket up. So it is crowding, whereas our budget is increasing, but debt service is also galloping. So what we're doing is, that's why I told you about some of the innovative things we're doing, trying to get alternative sources, getting non-traditional donors, but we have a challenge I need to put here. The World Bank has been helping us, but by the time we were concluding our country partnership framework, USAID was still one of the biggest partners in health. Unfortunately, USAID closed shop in February. The health sector now, was not included in the partnership. But what we are doing, working with the World Bank, is to do some reallocation, propose some of our ideas that can leverage financing from the global financing facility. That's one approach we're trying to take in conjunction with other approaches. But let me also say, we are investing in some of the complementary things that have a beneficial impact on health. Electricity and roads. Yes, it may not be credited as health expenditure, but the health sector benefits hugely from it. So like in Liberia, one of the second largest health facility, Jackson F. Doe, is in a rural area. It's being, because of bad rural condition, the number of persons that will utilize it, traditionally hasn't been high. but we've improved that road now. So services have increased. Electricity supply is increasing because we're investing in that. We're investing in water and sanitation. Better water and sanitation impact health in a positive manner. So we're doing all. We're bringing in non-traditional donors. I will conclude. One of them, I think, is Badea. They are funding one of the rural sectors in our rural area. And we've told them that on this track, there are health facilities. Originally, they were not thinking health, but they put in the package now funding for those health facilities on the rural corridor they are funding. So we're taking all these measures to ramp up support to health because, as we usually say, and I said from the beginning, health is wealth, health is jobs. Healthy population will think better, and we can achieve many of our development outcomes through that.
Thank you so much, Your Excellency Ignavoy. What about you, Your Excellency Kolsek, on your where you see opportunities for stronger, bigger collaborations between the region and the World Bank Group when it comes to better health systems in our countries? So when it comes to the better healthcare systems, primary healthcare, what you see to be the opportunities between our countries for collaboration between us and the World Bank Group?
I think that the World Bank has been for a long time a very close partner to countries.
Yeah.
No doubt.
Yes.
But with the new strategy, what I have seen is some issues like primary healthcare focus, but also the creation of jobs. All these things are very important now to them to support it at country level. Because often before it was, don't increase too much the people you are employed, particularly in the public sector, this type of thing. But I think that we are showing that the public sector is able to create jobs, and this will be something very important for me. I would like also to say that the World Bank cannot be only a donor, but because of its capacity, being very in close contact with the government, it can play really a role of advocacy for some of the issues we would like to see. My last point is I am expecting to see also the World Bank supporting, because it is the World Bank Group supporting local production of drugs, local production of vaccine. I know that something is ongoing, but it is difficult, and people at country level have a lot of difficulties to raise all this money. So I think that the bank can play a very important role there, because what we have said since the beginning is in fact that we want all to see Africa sovereignty.
Yes.
And for Africa sovereignty, if you don't have the capacity to do some of these things, at the end of the day, you will never reach things we want. Now, it is why, for me, they can really play. Government are listening to them. They are a good partner, and maybe they can do more with this new strategy.
Thank you so much. And you speak of advocacy. I know I've got my dear Monique Vleder here from the GFF. I know that the GFF is doing quite a lot in terms of advocating for maternal health, for babies and adolescents. So congratulations to GFF on that. And of course, at the, Mamta Murthy also mentioned talking about manufacturing pharmaceuticals, which was just launched during the spring meeting. So a lot of work being done, a lot more to go. I bring the floor to you, Your Excellency, Dr. Bampo.
No, thank you very much. I wouldn't want to add, I think my distinguished co-panelists have said it all. I identify with what they've said. I just want to say that currently, the World Bank is a good product champion, and the product is health. So, for example, in Ghana, the excellent example of them being advocates, and sometimes even within government, when we need to push our agenda, they've been there. And together with the IMF, for example, they pushed on the health spending floor, and that is part of the reason why we are having this kind of resources in health. So fantastic collaboration. I think the rest has been said. There's a lot that we can do in the future, and thanks the World Bank.
Your Excellency, Dr. Bampo, who is the Chief Executive Officer of National Health Insurance Authority, we thank you. We've also had Her Excellency Professor Awa Marie Kolsek, President of Ghanaian Africa and former Minister of Health of Senegal. And we have also had the Honorable Minister of Finance from Liberia, Excellency Augustine Pehe Ngafwan. Thank you so much. Esteemed panelists, it has been an honor to have you join us. May I have our official photographer? Thank you so much. Ladies and gentlemen, proof of life, a round of applause. Are we well and able? Fantastic. And now we're moving into our last ministerial panel, and I promise you, you've waited this long, just wait a little longer. I promise you will enjoy this one as well. Thank you so much. So we have had frontlines first, we have had fixing finance, and now we move to Future Fit. Now, Future Fit turns our attention to preparedness and to whether our health systems are truly equipped to respond to tomorrow's risks, shocks, and growing demands. Now, this final session will invite us to examine how our governments, our partners, and institutions can strengthen preparedness, protect essential services, and build systems capable of responding to the realities of an increasingly complex and difficult world. I bring you Future Fit. Allow me to bring to the stage Honorable Minister of Public Health and Prevention from Chad, His Excellency Dr. Mahamat. Excellency Dr. Mahamat, please join us on stage. I would like to also have the Honorable Minister of Health from the Gambia, His Excellency Lamine Samate. Excellency Lamine Samate, please join us on stage. You're very welcome, sir. Bienvenue. Yes, you can sit anywhere, sir. And we also have, lastly on this panel, Commissioner Economic and Monetary Community of Central Africa, also known as CEMAC. Please warmly welcome Excellency Fulgence Likasi Bokama. Je vous en prie. Excellencies, you are very welcome. Please, a round of applause for Excellency Likasi Bokama. We start off our conversation with you, Dr. Mahamat from Chad, and also Dr. Lamine Samate from the Gambia. Now the question is, what concrete investments or reforms are you making to ensure that primary health care in your respective countries is truly emergency ready? We can start off with you, Dr. Mahamat from Chad.
Merci beaucoup, Madame. Je voudrais, avant de répondre à votre question, permettez-moi de saluer cette initiative de la Banque mondiale qui consiste à croiser les expériences entre l'Afrique de l'Ouest et l'Afrique centrale. Ça, c'est quelque chose d'extrêmement important parce que nous sommes dans un monde en perpétuel mouvement, donc les échanges entre les deux zones est extrêmement important. Et vous m'avez posé la question, quels sont maintenant les investissements et les réformes opérées. Je dois dire que nous avons, le Tchad a opté pour une stratégie intégrée. On ne peut pas dissocier la préparation et les urgences. C'est deux choses qui évoluent de façon concomitante. Qu'est-ce que nous avons fait? Nous avons en premier lieu beaucoup plus investi sur le développement des districts sanitaires et des centres de santé. Parce que le premier contact des patients au niveau de formation sanitaire, d'abord, c'est les centres de santé. Donc, il faut absolument développer le soin de santé de base, c'est-à-dire le soin de santé primaire, à savoir le paquet minimum d'activité. De l'autre côté, les paquets complémentaires d'activité. Et on doit faire en sorte que le personnel de la santé doivent, même en cas de crise, ne pas laisser les activités de routine. C'est-à-dire la consultation, la vaccination, la détection des malnutritions doivent continuer de façon continue. pour ne pas déserter les centres de santé et se focaliser sur les crises des urgences. Ça, c'est quelque chose d'extrêmement important. Le deuxième élément, c'est que le Tchad a opté pour une stratégie intersectorielle. Nous avons un plan intersectoriel dicté par les plus hautes autorités et partagé avec les différents ministères. Et la santé devient une priorité. Le président de la République estime qu'il faut moderniser le système de santé. Et dans ces cas, il faut instaurer un dialogue continu et permanent entre les différents secteurs. Parce qu'on ne peut pas aujourd'hui dire que le secteur de la santé seul peut faire face à toutes les éventualités. Alors, nous avons une rencontre périodique entre les différents ministères, mais de l'autre côté aussi, le cadre intersectoriel qui est piloté par le Premier ministre, c'est-à-dire la stratégie One Health. C'est quelque chose d'extrêmement important et nous changeons constamment les données pour être en cohérence avec notre politique, mais également pour être beaucoup plus efficace dans la cogestion des problèmes de santé, mais en nous reposant sur les communautés, parce que le cœur du système, c'est la communauté. Le ministre de la Santé de la Centrafrique l'a déjà dit, et je pense qu'il a parfaitement raison. Les vrais épidémiologistes sont des communautés. Merci beaucoup.
Thank you very much, and thank you for giving us the opportunity to participate in this panel. Certainly, it's very important for us to appreciate the fact that for universal health coverage in many of our countries, including Gambia, we certainly need to deal with the primary healthcare services. But I think it's very important for us to take cognizance of the fact that we all had histories. Where we are today, why are we in this position today? We heard of the statistics my sister presented. With all the improvements, maternal mortality is still high in our region. Child mortality is very high. Why is West Africa and Central Africa in this position today? So we cannot forget that fact if we want to know where we want to get. Of course, we've all heard of fair shares of conflicts, poor governance. In the Gambia, we had brutal dictatorship, where social services certainly are affected. And those are the days that we couldn't even say the country was hard. That could land someone into jail just for saying that. So health services suffered. I remember I was a consultant surgeon in the teaching hospital. We didn't have sutures, we didn't have catheters and so on. So I think it's very important for us to know where we are. But of course, in Gambia and in West Africa and Central Africa, we certainly cannot continue to cry over spilled milk. We have to make a difference. And I'm happy that we've started making those differences. We inherited dilapidated health infrastructure, so access was a problem. Paucity of equipment, life-saving equipment, monitors were not available. We were doing operations without functional monitors. Paucity of skills. We didn't have specialists in many areas. So when I became health minister about a little over 7 years ago, I went round and I went to the president. I said to him, Your Excellency, I think what we need to do is to forget about all the sectors and focus on the health sector. Of course, that's a wise thing to do, isn't it? But he looked at me, you know leaders, how they think. He smiled. He said, Honorable Minister, but when we build your hospitals and buy you equipment, your equipment need electricity to function. They need water. Your ambulances need to run on roads. Then I looked at him again, I said, yes, you are talking like a president. I'm talking like a health minister, of course. But this is where we've been, but we've made a lot of difference. At some point, I hope I get the opportunity to say what the partnership with the bank has been like. But focusing on primary health care, the Gambia, we have a robust primary health care service that is covering half of the population. So half of the villages in the Gambia are primary healthcare villages. So we are doing what we call revitalization of primary healthcare services to ensure that the entire population is covered 100%, and we want to also institute what we call urban primary healthcare. Our primary healthcare structure, we have primary healthcare circuits. So you have about 10 villages constituting a circuit, and in each of those villages, we have a village health worker and a community birth companion. The 10 villages, the oversight is carried out by a community health nurse. And these community health nurses are given motorbikes and they supervise these villages. So how are we strengthening this as a country? When we realized that we didn't have enough community health nurses, about 4 years ago, we talked to partners and they expanded our schools that train the community health nurses. So we have doubled the number of community health nurses. Now we have enough community health nurses to be distributed among those circuits, and we are ready. In fact, as I speak to you, now we are working on getting each of them motorbikes to be able to do that supervision. And I thank the World Bank again. Our new World Bank tax team leader, Valerie Pogo, when she came, I said to her, very efficient, I said to her, at the end of your tenure, for me to gauge the success of your posting, we must make sure together we make community health services functional, primary health care. So we've gone a long way, we are doing this, but I think one aspect that we are all missing, and I'm happy, not missing per se, but we need to focus on, is the fact that these village health workers, these community health workers, the community birth companions, they do it voluntarily. Now, I keep on saying, when I, as minister, the permanent secretaries, the partners, World Bank, UNICEF, Gavi, and all, we go to visit these people in the communities. We go with big 4x4s, air-conditioned, and these people do not get a salary. They don't get an allowance, and we expect them to perform. After telling them what to do, we enter our cars and go back. So we need to look at it. As a country, we brought that case forward, and then the Global Fund has helped us to pay allowances for some of them. And these are some of the things we want to bring on board. Yes, can governments employ them? Because it's going to increase our wage burden by thousands and thousands, so it is not feasible for now, but these are areas where we want the partners to support us in strengthening.
Yeah.
Well, I can go on. I see you looking at me. I don't know, but
respectfully, because I know you have a long story. I want to hear all parts of the story, but I want to segue into another aspect, which is also crucial. I think Excellency Mahamat has touched on it, and you've touched on it as well. That is the collaboration of the Ministry of Health with other ministries. I'll bring it to you, Your Excellency Mahamat. We saw that the COVID-19 pandemic, through that, we saw we were unprepared. Our systems were not resilient. Now that we know better, give us some insight into how your Ministry, of Health is engaging with other ministries to implement a whole government approach to workforce development, to healthcare, health service provision, and maybe generally health security.
Merci beaucoup, Madame. Vous avez touché un point extrêmement important. Je pense que la COVID-19 nous a donné une très bonne leçon apprise. Et la COVID-19 a montré que tous les systèmes de santé du monde sont fragiles. Qu'est-ce que nous avons fait? Avec l'avènement de la COVID-19, nous avons pensé avant tout, c'est faire une politique intersectorielle. Et cette politique intersectorielle repose sur la plateforme One Health. Comme je l'ai dit tout à l'heure, les réunions se font autour du Premier ministre chef de gouvernement. Donc tous les ministres concernés. Je prends l'exemple du ministère de l'eau, avec qui nous travaillons sur le déterminant de la santé. Le ministère de la Défense, pour nous aider à faciliter l'accessibilité des personnels de santé dans les zones d'accès difficiles. Le ministère de l'Énergie, qui nous alimente avec les panneaux solaires pour que les centres de santé puissent disposer de l'électricité et garantir la chaîne de froid. Donc, avec le ministère de l'Élevage, parce que l'OMS a prouvé qu'il y a une très forte complicité entre les maladies d'origine zoonotique et les maladies d'origine humaine. Donc en croisant ces expériences, chaque ministre a le devoir et la responsabilité de produire continuellement les données, et sur les humains, sur l'environnement et sur l'élevage. Et ensemble, nous agissons dans une dynamique d'ensemble, de façon harmonisée et coordonnée pour faire face à différents défis. Deuxième élément, c'est le pacte que nous avons signé la semaine dernière, qui regroupe 13 ministères, plus les partenaires techniques et financiers, sur lesquels nous avons des engagements. Si je ne me trompe pas, il y a 28 engagements. Et chaque ministre est tenu de jouer son rôle. En d'autres termes, nous avons un cadre de redevabilité obligatoire. Et cette conjugaison des efforts plaide en faveur d'une santé avec une approche holistique de façon suffisamment coordonnée afin de faciliter d'abord l'accessibilité, la disponibilité, la qualité de l'offre de soins. Une spécificité, le Tchad a une population un peu spécifique, la population nomade, c'est-à-dire les éleveurs transhumants. Ils sont toujours à la recherche des zones de pâturage, ce qui fait que la santé de leurs animaux les préoccupe plus que leur propre santé. Pour le faire, on est obligé de collaborer avec le ministère de l'élevage et agir de façon harmonisée. Soigner les humains, mais également les cheptels animaux. Parce qu'ils sont collés à leurs fibres tribales identitaires. Pour eux, ils s'affirment à partir de leurs déplacements saisonniers. Mais en rentrant dans les pays limitrophes, ils importent les maladies. Et je coordonne avec mon collègue, le ministre centrafricain, parce que les éleveurs rentrent de l'autre côté, celui du Cameroun et du Nigeria. Donc on est obligé d'assurer une surveillance transfrontalière de façon continue et synchronisée. Et c'est vers ça que nous allons plaider à faire un plan d'action commun avec mes collègues, les ministres de la Santé, de la Centrafrique qui est ici, avec qui nous avons gardé une très bonne collaboration pour éliminer même certaines maladies tropicales négligées, telles que la trypanosomiase. Nous l'avons éliminé il y a 2 ans. Et maintenant, quelques pathologies qui sont sur les pipelines, notamment la drunkenkulose, la maladie des vers de Guinée. Donc voilà, de façon schématique, ce que nous faisons ensemble avec l'autre. Donc le pacte, pour moi, c'est un outil extrêmement important de gouvernance, mais de redevabilité en même temps. Et je pense que nous agissons dans cette dynamique commune d'ensemble pour faire face à tous les gens. Merci beaucoup.
Excellency Samate, that relationship between Ministry of Health and other ministries in order to get the Gambia pandemic ready, what does it look like?
Yeah, thank you very much. I think we learned a lot from the COVID-19 pandemic. The need for collaboration became very, very explicit during the pandemic. In the Gambia, we had a special COVID-19 committee that was headed, chaired by His Excellency, the President himself, coordinating activities. Of course, COVID is gone now, and that committee is no longer functional. However, a similar committee is what we intend to set up in collaboration with partners to deal with maternal mortality. Very soon that will be launched. Yes, interministerial coordination happens at various levels, at the technical levels. At the ministerial level, not too frequently. However, when it comes to wash issues, water and sanitation issues, we collaborate a lot with the Ministry of Water Resources and Fisheries. Now, of course, one of our best partners is the Ministry of Finance. We collaborate with them sometimes we quarrel with them, sometimes, but all in a good spirit. But I think the collaboration has yielded a lot of dividends in the sense that we had started to look inwards. The domestic resource mobilization people have been talking about, which is very critical. But of course, we should not be mistaken to think that we can do it all alone, because I keep on saying, why we do not have all our roads in Africa paved, all the villages with water and electricity, is because of the limited fiscal space. So yes, domestic resource mobilization is good, but with the support of the Ministry of Finance, we have built some new health facilities to improve access, 100% mobilized domestically. So that has been very, very good. But I think one of the biggest collaboration partners should be our heads of state. You see, when we carry them along, They are not ministers of health. They would know something, but most of what they know comes from us. What has worked for me as minister? I've taken our head of state through the processes. I briefed him on what we are doing, the vision, the policy directions, and so on, and the improvements, and regular updates. So when he talks about the health sector, he speaks even sometimes better than me, because he understands. Now, when I report the Minister of Finance to him, it's very easy for him to be on my side. When they are not releasing funds and so
Your
on and so
Excellency,
forth.
all your secrets are coming out on this
So
stage.
my brother is here, but because the president understands, and then because he's also passionate about the health sector, because he's come to the understanding that really for any meaningful development, the people need to be healthy. And the population cares about the health. We've seen the research, the outcome. So when we deal with the health sector, we would have dealt with the problems of the people, we would have dealt with the economy, and also it's politically sound.
Absolutely.
Thank you very much.
Thank you so much. And thanks for giving us that practical example, which now then brings me to CEMAC. Mr. Lekasi Bokama, I think we've heard about the essence of our heads of state, the essence of other ministries all being on board. How would you describe CEMAC and how CEMAC helps ensure that health is and remains a priority for heads of state and political leaders across the sub-region, especially when we look at cross-country collaboration? We are looking at workforce development, we're looking at health service provision, and ultimately even looking at health security.
Merci, Madame. Je voudrais d'abord remercier la Banque mondiale de nous avoir associés à cet événement si important, parce que nous sommes quand même une région qui est confrontée à des défis de santé publique et de sécurité sanitaire très énormes, et ces défis sont communs à l'ensemble de nos pays. Le Cameroun, le Centrafrique, le Congo, le Gabon, la Guinée équatoriale et le Tchad. Ce sont des défis qui sont communs à tous ces pays, et les ministres qui sont ici ont évoqué certains de ces défis. Et je voudrais dire qu'en plus de cela, il y a des questions en rapport avec la coordination interétatique et multisectorielle des interventions de santé. Et cela ne suffit pas. Nous avons un contexte sous-régional caractérisé par un certain nombre de facteurs. Je vais juste les rappeler rapidement. Avec une croissance démographique caractérisée par un taux de natalité très élevé, surtout dans les tranches d'âge de 15 à 19 ans. Une transition épidémiologique marquée par la coexistence des maladies infectieuses et aussi la montée significative et progressive des maladies non transmissibles. Associés à cela, les défis nutritionnels dans un contexte de forte dépendance aux importations alimentaires. Et c'est vrai, nous avons une politique pharmaceutique qui date déjà de beaucoup d'années, mais nous restons avec une industrialisation pharmaceutique très insuffisante pour assurer l'autonomie sanitaire régionale. Et enfin, j'évoquerai des contraintes économiques marquées par une forte dépendance au financement extérieur et une capacité réduite des ménages à faire face aux dépenses de santé. Alors, face à ce tableau, et pour répondre directement à la question des initiatives et des actions louables ont été engagées par les chefs d'État de la CEMAC. Je voudrais évoquer sous deux ordres. Il y a sur le plan structurel et puis sur le plan opérationnel. Dans le cadre, sur le plan structurel, je peux évoquer déjà le renforcement de l'OCEAC, l'Organisation de coordination pour la lutte contre les endémies en Afrique centrale, qui est notre institution de santé, notre structure technique sous-régionale de santé publique. Il y a l'érection du Centre inter-État d'enseignement supérieur en santé publique d'Afrique centrale, qui œuvre pour le renforcement des ressources humaines en santé publique. Il y a l'existence, naturellement, d'un département au niveau de la SEMAC qui s'occupe des questions de développement social. Et récemment, en septembre 2025, il y a eu l'institutionnalisation par la conférence des chefs d'État de la SEMAC de la réunion annuelle des ministres de la Santé en zone SEMAC en vue des grandes orientations en matière de santé. Alors, sur le plan opérationnel, tirant les leçons de la gestion de la dernière pandémie, je parle notamment de Covid-19 que nous avons cité le long de la journée, et consciente des défis contemporains de sécurité sanitaire, la SEMAC a élaboré un plan de sécurité sanitaire, un plan sous-régional de sécurité sanitaire suivant l'approche One Health, associant l'ensemble des institutions spécialisées de la SEMAC qui traitent des questions de sécurité sanitaire, les institutions en rapport avec la santé animale, environnementale, végétale et la santé humaine. Et ce plan a été adopté, c'était un plan donc suivant l'approche One Health, qui a été adopté par les ministres de la Santé et puis le Conseil des ministres de la SEMAC. Et grâce à ce plan, nous avons pu bénéficier de l'accompagnement de la Banque mondiale. Et je salue cette heureuse initiative aujourd'hui d'un montant de 10 millions d'euros pour le niveau régional. Bien sûr que les États, avec le montant qui est accordé aux États, nous sommes à 280 millions d'euros. Et je citerai également la signature récente d'une collaboration, d'un cadre de collaboration avec l'initiative Présode pour faciliter la recherche multisectorielle selon l'approche Une seule santé. Si vous permettez, juste pour 2 minutes, je vais évoquer la question liée au projet de sécurité sanitaire que j'ai évoqué, qui est l'accompagnement de la Banque mondiale dans le cadre de la mise en œuvre du plan de sécurité sanitaire. Ce projet, c'est une activité qui vient pour renforcer la collaboration transfrontalière entre les États de l'espace SEMAC, à savoir le recrutement des ressources humaines qualifiées pour faciliter le partage d'informations de santé en temps réel dans la perspective de mise en place d'un système régional d'alerte précoce en matière de sécurité sanitaire. Et dans ce cadre-là, il y a quand même, dans le cadre du renforcement de ces capacités, je pourrais dire qu'il y a un financement complémentaire aussi de la Banque mondiale, plutôt de la Banque allemande de développement, qui finance dans le cadre de maladies tropicales négligées, mais toujours suivant l'approche One Health. Et il y a des projets d'intervention et puis des formations doctorants. Et nous avons aussi, dans ce cadre-là, dans le cadre le projet de sécurité sanitaire financé par la Banque mondiale, le renforcement de la lutte contre la résistance aux antimicrobiens. Et avec aussi l'appui au centre des opérations d'urgence des pays pour la riposte aux épidémies et l'organisation des cohortes de formation régionale d'épidémiologistes de terrain avec des exercices de simulation régionale en vue de constituer une base de données pour une équipe régionale d'intervention. Donc, il y a un ensemble de dispositions que les chefs d'État ont eu à prendre et qui sont censés pouvoir accompagner ce processus de façon durable.
Merci beaucoup. Merci beaucoup, Monsieur Likasi Bokama. I would like to now, Excellency Samate, you said, you had a one line in there that said you would like to talk about the collaboration, the opportunities that you may see when you think of the pandemic fund, you think of the World Bank Group, you think of how we can be future fit. Where do you see greater opportunities? Your Excellency Samate.
Thank you very much once again. First of all, before I move on to future collaboration, I think at this juncture it's important for us to acknowledge what transpired, what had happened. And at this juncture, we thank the World Bank for all the good work they've done. We've been very fortunate. I keep on saying I've been very fortunate. I came into this position and the bank was there to support, because most of what we did without the bank, it could have been something else. And then we had very brilliant health tax team leaders, Dr. Sam Mills, Dr. Valerie Pogo now, and very, very supportive. And that's very critical. And I think it's important that we say it here. The collaboration, the enthusiasm of the tax team leaders is very important in guiding the ministries. I'm going to emphasize, because quite a lot of things we certainly do not know. Can the bank do this? Can the bank not do this? Is it possible? Does it fit into the project? Without having a strong task team leader, we will not know. And they should also be engaging the policy heads, because sometimes in between things happen too, the ministers don't know. But what we've been able to do, together in our partnership, you see, too often than not, African countries, including the Gambia, were supported in the past. Millions of dollars or millions of dollars. 5, 10 years down the line, we don't see the impact. We hear of projects, where's the impact? So in Gambia, we said we don't want that. So we want to invest in infrastructure that will be there for 50 years, 100 years. Yeah. And that is working for us. So together with the bank, we've been able to establish an emergency treatment center, which was earmarked for COVID-19, a 104-bed facility, 20-bed ICU. We only had an 8-bed ICU. That was not even a proper ICU. Now we're having that. Now we also have a biomedical engineering unit, because the bank has supported us in buying equipment. Who takes care of those equipment? So we have a functional, well, it's about to be functional now, but a fully equipped biomedical engineering unit. And the responsiveness we had an outbreak, very sad outbreak of acute kidney injury, where we lost a lot of our children due to contaminated syrups. Very devastating for the entire country, the families and all of us. But we were very fortunate that the bank came on board, and we now have constructed a brand new food and drug laboratory for the Gambia to avert issues like that. And we've been able to also put up infrastructure to deal with clinical waste in the country. But importantly, capacity building. Now, the bank has supported us. They got us about 20 high-level professors from Ghana and Nigeria. They came to Gambia, and we started a postgraduate training program. Now we have up to 120 resident doctors who are doing their fellowship. The first 3 have graduated 2 weeks ago. Now, I myself went to Nigeria to study, and by the way, I came to Ghana to do my residency training program in Kolebu here. So now these people are doing it in Gambia with the support of this collaboration. Now, we also realize that one of the causes of maternal mortality, especially during the perioperative period, is poor anesthetic care. So now we are training anesthetic nurses in Gambia, and then midwives and so on and so forth. So a lot is happening. So now we have seen the trajectory. So further collaboration is actually aimed at following these routes to ensure, to enhance this, to improve on primary health care facilities, and we encourage all the partners to come on board. One way of streamlining partner support is making sure that all of us sit around the same table to reduce duplication or to make sure that we don't have duplication. So these are the strategies we are looking at, but already we have the trajectory. We want more infrastructure, we want more capacity building, more equipment, and so on and so forth. And of course, strengthening primary healthcare services. Thank you very much.
Unbelievably wonderful. I bring it to you, Your Excellency Mahamat. Let's talk about greater opportunity for collaboration with the World Bank Group and the Pandemic Fund when you are thinking of building future-fit health systems. What would you say? What are the opportunities we should take advantage of?
Merci beaucoup, Madame. Moi, je crois que la collaboration avec la Banque mondiale, je dirais même c'est impératif. Parce que nous avons géré des situations, je dirais qu'il y a 2 ans, il y avait le projet de renforcement de surveillance de l'Afrique centrale des maladies à potentiel épidémique. Avec l'appui de la Banque mondiale, nous avons pu circonscrire beaucoup de pathologies qui sont venues, je ne le dis pas, mais juste à côté, la variole du singe, en Centrafrique et au Cameroun. Donc, nous avons besoin beaucoup plus des investissements pour renforcer notre dispositif de surveillance. Et là, la collaboration, pas seulement avec la Banque mondiale, mais avec Pandemic Fund aussi. Mais faire en sorte qu'il n'y ait pas une duplicité ou une multiplicité dans un même endroit. J'estime également que la Banque mondiale doit nous aider à produire localement les produits, les vaccins, les médicaments et autres. Moi, j'estime que ça, c'est quelque chose d'extrêmement important parce qu'avec l'avènement de Covid-19, tous les systèmes de santé étaient fragiles. Et je voudrais faire un plaidoyer parce que le Tchad, c'est un îlot de stabilité entouré de beaucoup d'États fragiles, tels que la crise du Darfour impacte très négativement le système de santé du Tchad. Et nous sommes tenus d'assurer la prise en charge de façon continue des réfugiés, des déplacés, mais également des autochtones. Donc l'impact est fortement ressenti, mais l'appui des partenaires n'est pas à la hauteur des attentes. Ça, je crois que c'est une opportunité que nous devons vraiment explorer. Autre opportunité, c'est de nous aider dans le développement de notre plan national de santé communautaire, qui va de 2026 à 2030. Donc nous estimons que la santé communautaire est le moyen le plus important du système de santé. Si nous avons pu maintenir jusqu'à maintenant des indicateurs assez bons dans quelques centres de santé du district, c'est parce que nous avons mis la communauté au cœur de notre intervention. Ils sont impliqués dans la cogestion, dans la planification et dans la mise en œuvre sur toute la chaîne pyramidale sanitaire. Troisième élément, et pas de moindre, c'est que le système de santé a besoin toujours de l'intersectorialité. Et nous avons pensé cette collaboration pas seulement avec les services publics, mais il faut s'étendre également vers les privés, les ONG, les services privés. Donc cette collaboration doit se consolider en faveur de la population pour intégrer le système de santé. Et pour moi, le pacte, c'est quelque chose d'extrêmement important. Pas seulement c'est un outil de planification, c'est un outil d'alignement, c'est un outil d'harmonisation, mais un outil d'intégration. Et avec le nouveau projet de la Banque mondiale, HEPS, moi je pense que c'est un très bon outil. C'est une possibilité de collaboration pour l'intégration africaine. Ça, c'est quelque chose d'extrêmement important. Le croisement des expériences entre les deux Afriques et les échanges des expériences, moi je pense que c'est très bien vu. Et parce que tous les États n'ont pas les mêmes réalités. Le Tchad est un grand pays qui, à l'image en matière de ressources humaines, ne sont pas trop développés par rapport aux autres. Mais on essaie de s'adapter avec le changement climatique. Donc on est obligé de travailler. Donc moi je pense que c'est une très bonne opportunité ce projet. Merci beaucoup.
So I finish off with you, Mr. Lekasi Bokama, a wonderful 45 seconds to take us to the end of the conversation with your words of advice when it comes to the collaboration between the World Bank Group, the countries, to make sure that we are pandemic ready, to make sure that we are future fit. Words from CMAC.
Merci, Madame. Alors, j'évoquais dans mon premier propos l'existence actuellement au niveau de la CEMAC d'un plan de sécurité sanitaire qui a été adopté par les ministres de la Santé et qui aujourd'hui bénéficie d'un financement de la Banque mondiale de 10 millions de dollars. Mais ce plan est à 77 millions. Le premier conseil que je donnerais, ce serait de demander à la Banque mondiale d'accompagner la mise en œuvre de ce plan. C'est vrai qu'il y a au niveau de la sous-région des initiatives qui tendent à pouvoir mobiliser des financements domestiques. Mais ces financements ne seront pas je crois que ce ne sera pas immédiatement mobilisable. Et il est important donc que la Banque mondiale, qui a commencé, soutienne cet effort, d'autant plus qu'il y a, parce que ce plan contient un volet transfrontalier très important. Et il y a déjà un partenaire, la Banque mondiale, plutôt la Banque allemande de développement, qui soutient dans, ce volet transfrontalier dans le cadre des maladies tropicales négligées. Et si la Banque mondiale, qui constitue un partenaire très important pour nous dans ce domaine-là, si la Banque mondiale soutient ce plan, je crois que nous arriverons à une possibilité de résilience effective des États. Je vous remercie.
Merci beaucoup. Ladies and gentlemen, I've had the Honorable Minister of Public Health and Prevention from Chad, His Excellency Dr. Mahamat. A round of applause. I've had the Honorable Minister of Health from the Gambia, His Excellency Dr. Amadou Samate. And of course, I've had the Commissioner, Economic and Monetary Community of Central Africa, CEMAC, His Excellency Dr. or Mr. Fugance Likasi Bukama. Thank you so much, gentlemen. Ladies and gentlemen, after our very well-deserved lunch break, we have what we like to call a revolving round table. I'm having to multitask here. Now, the revolving round table discussion will have 2 sessions, featuring panelists for each of these sessions, and it'll be focusing on the private sector and, of course, our partners. But for now, if you're ready for some delicious Ghanaian lunch, it is now time for a lunch break, which will be a wonderful 45 minutes. I hope that you come back on time. Otherwise, I'll come and find you myself. VIPs, my dear sister Abby. VIPs, you will be escorted. Thank you, Abby. Any more announcements? I am sorry, I didn't have my notes in front of me. Pardon me, Abby. Wonderful. Okay. Our VIPs kindly follow our ushers. They will escort you to your lunch. And the rest of us who are also important, but not necessarily VIP, we will be going over to the restaurant. Thank you very much. Ladies and gentlemen, in 45 minutes, we reconvene for our revolver round table and our Youth Ignite session. Thank you very much. I do humbly ask that we remain as engaged as possible. I know that some of our delegates and our colleagues have gone and had bilateral meetings. Hopefully they'll be joining us. We have quite an agenda ahead of us, and I'll jump straight into it. So, Your Excellencies, colleagues, you're very welcome back. And here we have a slight difference when it comes to the format of delivering the conversations in this next couple of hours. Now, this is the first roundtable session, and it's going to be focusing on the role of the private sector in advancing stronger, more resilient health systems across Western and Central Africa. Now, this session aims to explore how private sector participation from healthcare delivery to pharmaceutical manufacturing and supply chain management can help expand access to quality care, strengthen health security, reduce dependency on external supply chains, and finally support economic growth that we've been talking about all morning, probably for a number of years now, across the region. Please allow me to bring to the stage my panelists for this session, His Excellency Professor Mohammed Ali Pate, Honorable Coordinating Minister of Health and Social Welfare from Nigeria. Please welcome the Honorable Inaugural Director General of the African Medicines Agency, who is also the Chief Executive Officer of the Ghana Standards Board. Please welcome her. Her name is Dr. Delise Mimi Daku. We're also joined by Ms. Sarah Ockerman, Advisor Upstream Manager, Manufacturing, Agribusiness and Services from IFC. You're very welcome, Ms. Ockman. Lastly, we've got the COO of Pharmanova Group, Atlantic Life Sciences, Mr. David Kluche. Mr. David Kluche, please take your seat and we start our conversation. Three, two, one. Thank you. Ladies and gentlemen, you're very welcome. You have the toughest job to keep the room up and ready to go after the very delicious lunch. And so, you know, with no bias at Nigeria has succumbed to the, we have set the pace here in Accra.
But the Nigerian one is better.
Thank you very much.
I think
over to you, sir.
The truth is that health systems are very integrated. They are mixed. You have public and private sector coexisting in almost every healthcare system. The question is, what's the optimal role of the public sector versus the private sector in such a mixed healthcare system? On financing, in many of our countries, public financing is less than the private financing, the out-of-pocket private household spending. So in financing, you already have that. In delivery, in the case of Nigeria, almost 50% is delivered by the private sector. The question is, what aspect should be delivered publicly financed and publicly provided, and what aspect is best left for the private sector? And how could the public sector leaders, the stewards, organize and steward the system such that the public interest is maintained while leveraging on skills and capital and innovation of the private sector? So in the case of Nigeria, on the provision side, first of all, in the governance side, it is inclusive. We have a mindset that takes the view that there are different levels of government that have to be involved. Civil society, including the private sector, are participants within that inclusive way of governing the sector. In the provision, public finance for the most basic healthcare service, primary healthcare, expanding, that's been the focus of our intervention. High-level services, you'll find that there's more at the hospital level that is in the hands of the private sector than the public sector.
teaching hospitals, service, research, that is the domain of the federal government, and that's a public good in that sense. Research institutions. The purchase of services, health insurance, allows public revenue, public finance to buy services, whether from public or private, and their facilities empaneled for obstetric care, for immunization. Government provides vaccines, private sector delivers them. There are those interlinkages. But the value chain, which is the third pillar, requires us to look at the whole ecosystem. So there are things that the government has done, the incentives, ensuring strong regulation, the pipeline of talent, and helping organize capital. But the private sector cannot ride on the back of government or to put profit before health, before the people. So there's that balance that has to be created, that the public interest is there, even while we leverage the private capital. And the resilience part also requires all to coexist, because if there's an outbreak, a pandemic, whatever it is, the fear factor affects the private sector as much. It's not just limited to the public sector. So the private sector has an interest inherently in preparing, but also when it comes to responding. So that's the way we're thinking about it, because you cannot separate this into two, but you have to focus on the public mission, the public interest, and guaranteeing for the poorest and most vulnerable, while those who are able to pay, who are able to go on medical tourism, can patronize the private sector providers domestically. The $2 billion of outbound medical tourism can as well remain in Nigeria and serve and be served by Nigerian private sector, because if they go to UK, Middle East, they don't go to public facilities in those places. They go to private providers. So they might as well provide, get those services at home.
Thank you so much, Minister Pate. Now, Dr. Daku, I cannot proceed without highlighting in your tenure as the first female CEO of the Ghana Food and Drugs Authority how you propagated homemade. Let us make our homemade pharmaceuticals. And then, of course, COVID came and taught us that everything that you had been pushing and advocating for was indeed true and was indeed right. But moving from that, now as you wear this extraordinary hat of being the Director General of the African Medicines Agency, what do you see as good examples or key good examples or forms of partnerships with governments or development partners that enabled the private sector to invest more confidently in health systems strengthening?
Thank you very much. I will probably take over from where the Honorable left off. And for me, I would say partners that involve in strengthening regulatory systems are the sort of partners that will move investments forward. We always say that investments, there are lots of partners or lots of investors who want to come to countries, but what prevents them is the predictability of making that investment. If you went to 3 different countries, even in West Africa, the requirements are different. The requirements for an investor is different. The strength of the regulator is different. And so eventually what happens to an investor is that they actually get fatigued and they leave. So for me, any partner or private sector that would invest in strong regulatory systems is a sure win for an investment. The investor knows that it will take me this long. This is the documentation that I need. It is based on science. It's not based on what my thoughts are. That I know is a good partner to have. Then the next one would be partnerships that support the capacity of the regulators. Now, if you send an application to 4 different countries, one would take 60 days, the other would take 180 days, one would take 5 years. It is not for want of staff, it is because of capacity. If a regulator knows, and I'm coming from a regulatory background, if I do not have the capacity, I will sit on an application for years, and I will not send it back to you. So any partner that supports regulatory system strengthening, building capacity in regulators, is a partner worth having. And then the last thing is fragmentation. One of it's almost what I said before. If you want to make an investment on the continent, you do not want to go to 55 different countries and have 55 different requirements. So any partner that will co-develop the harmonization of standards the harmonization of decision making. So you can have in critical times like in COVID, where Europe had one decision for all its 28 or so member states, and Africa had to do it one by one. Now, if we have harmonized systems, if we have systems that can work together, we have common databases, we will be able to ensure that we can get the products that we need at the right time and within the right time. So that is what I'd say for the time.
Thank you so much, Dr. Darko. I bring it to you, Mr. Cloutier. Dr. Darko has highlighted something very crucial. Let me just pick from, regulation for a minute. What are the primary regulatory or market entry barriers currently preventing more robust investment in regional manufacturing of medical countermeasures and other perhaps health products in West and Central Africa?
So thank you very much. And I think I'll also continue from where Dr. Denise has left, Dr. Darko has left off. One of the key things we suffer as private sector manufacturers is the fragmented regulatory systems that we have. So, for instance, we are based in Ghana and we have to operate across most of the ECOWAS countries. So we have to do a lot of registration in each of the countries. Now, the impact of that is that it costs about a delay of about 2 years into the whole financing model.
Yep.
We also have a challenge where we are now trying to register some of the products at the WAHO, regional registration process, harmonized registration. That is also has also some delays.
Yes.
As Mrs. Darko has alluded to, that if they don't have the capacity, then it leads to delays. So for us as manufacturers, our key challenge with regulation is that it's a huge barrier to expanding into pharmaceuticals, because you look at it, and that's why a lot of our manufacturers are all home-based.
Yes.
Right? Because they don't have the capacity to be able to deal with multiple regulators on the continent. So the impact of this is that it causes about 2 to 4 years delay. And it could be the difference between a project which is bankable and a project which is not, right? And that is very, very important because every delay has impact on cost. Then the second thing that causes delay is unpredictable market demand, or what I would call the hidden demand. So the challenge we have is, for instance, if you take the antiretroviral space in Ghana, it was all being supported by USAID. All of a sudden, USAID has left. Somebody has to fill that capacity. Local manufacturers are trying to do that. But for a long time, because there were donor support, right, and all these commodities were coming into the country, that part of the market was hidden or was on our blind side. And the same thing happened with vaccines, right? Ghana has enjoyed vaccines for all these years. All of a sudden, by 2030, Ghana is going to exit. We're in the accelerated transition period. We are going to exit. So all of a sudden, vaccine production has become a major key for the government. And now companies are now stepping up because we have to buy our own vaccines. We have to finance our own vaccines. So that has now brought in the demand. So I think the market demand is very, very important. There's weak visibility on long-term offtake commitments. Our framework agreements are good in Ghana, but they're only for 1 year. We don't invest or we don't make capital decisions based on 1 year. We make capital decisions based on long-term projections. But for some reason, the ministry is able to make government offtake agreements for 1 year. We don't have advanced purchase commitments, which commits that we are going to commit to buying this product for the next 10 years, but we'll give you yearly commitments. So those are some of the pricing constraints. We have limited access to long-term finance. You try to invest in a project in Ghana to supply or to meet the aim objective. There's a challenge. At one point, about 2 years ago, we were borrowing money at about 30% interest. That is surely not a sustainable way of investing in a long-term capex. So we have those sort of structural challenges in the economy, which makes it very difficult for private sector to just to scale up and to be able to support our brothers in the sub-region. So those are some of the challenges. I'll stop here for now.
Thank you so much, Mr. Cloutier, for outlining some of the challenges, which is probably the perfect time to bring you in, Ms. Ockman, because I would like you to now take us into maybe perhaps some good, key good examples or forms of partnerships with governments or development partners that enable the private sector to invest more confidently in health system strengthening.
Okay, thank you. And I agree with all the points that everyone's been making about fragmentation, about the lack of financing instruments, the ecosystem and how important that is. So the example I'd like to talk about is Madiba in Senegal. And what this started as was an upstream investment. We did project development. It took about 4 years to develop this project that we then invested in. In parallel, the government of Senegal, Minister of Finance, Minister of Health, and the local CDC, or FDA for Senegal, worked together to make sure that Senegal had increased their maturity levels, according to WHO, from maturity level 2 to maturity level 3. So, okay, that sounds easy, right? It took about 4 years for us to develop the project. And this was in partnerships with USAID, which you mentioned, and with African Development Bank. And then after that, we were able to make an investment in December 2024, a $45 million investment package, together with our partners. So that took a lot of partnership. It took the whole ecosystem working together. And I think what, for me, it takes away is, yes, vaccines are important, but how can we also translate these lessons learned into other parts of health? For example, primary health care that we were talking about before lunch, pharmaceutical manufacturing for simple medicines. There's lots of, I think, lessons we can draw from here. And David, you were talking about the need for local financing. And I think that, for me, is a huge piece that we need to develop further.
All right. And, you know, Sarah beautifully talked about what we need to develop further. Perhaps I bring it back to you, Your Excellency, Patty. If you had a magic wand, I know that there were so many things that you could do. How would you release that bottleneck? We're thinking about the target of reaching 200 million people in Western and Central Africa by 2030. However, we have system bottlenecks. What would be that magic wand? What would be that thing that you would do to release the system bottlenecks?
I think it's, I will say, to bring the private sector more actively in health, which is a risky sector for investing. I would use public financing, development financing to risk for the private sector the investment that are needed. Part of the de-risking also includes improving regulatory capacity so that it is more predictable. They know they will not be undercut by a low-quality manufacturer. I will pool the public financing to prime the pump for private sector capital to drive growth by the industry, to remove the bottlenecks, so that, and also enable competition across all actors, so that we get the optimal sort of production of whatever it is the private sector can produce.
Yes. Thank you so much, sir. Dr. Dako, a major challenge for private sector participation is data fragmentation. We talked about regulatory, now we talk about data fragmentation. Can you kindly share with us some ideas or thoughts or what steps are being taken to integrate private provider data into national health information systems, ultimately to ensure one single accurate view of population health?
Thank you very much. That is the challenge that we are trying to address at the Africa Medicines Agency. So you'd notice that even for regulators, most of the information sits with the private sector. The private sector puts a product onto the market. Reports for data capture tend to go out before they come in. Right. So if there's a problem with the product that we have put on the market as a continent or as a country, you'd realize that the information on its safety or its quality goes out and then trickles in. So at the Africa Medicines Agency, what we've realized is that we need to be able to connect data for all the countries, or all the member states. And we need to get it into one interoperable data center. Data capture, building data systems is very expensive. And so we don't intend to build another one, but we intend to get one that can connect all of them. For regulators, what is most important, and you would manufacture a product, you would procure a product, but at the end of the day, it is the safety and quality of the product that is important to the regulator. We need to ensure that what we've put on the market is safe and it continues to remain safe. So we are building what we call a continental quality and safety database as our first project. I don't call it a project, as our first handout to the continent, whereby anything that is manufactured, any product that is distributed, and any product that is used can report into one interoperable database. That way, it builds confidence and trust in the locally manufactured products that we are putting on the market. We know that there are products coming from everywhere in the world. There will always be, and it happened with vaccines in South Africa, when vaccines were manufactured for COVID and were never bought. To be able to build trust, we need to be able to say that, yes, we've seen the product, yes, we've monitored the quality, yes, the quality is good. And as we continue to build up that database, data collection is all over the place, but it is fragmented.
Yes.
If you want data now from the private sector, you may not find it in the national system. So we want to put together a database, and we have started, that will pull all the quality and all the safety information from the products that are manufactured on the continent into one database, and countries can access that database. The private sector can access it, national governments can access it. We will build the trust that we need for that. It's not a matter of collecting more data, it's a matter of collecting it in a central data point and being able to use it. So that's one of the first things that we are doing.
If I may humbly ask you, perhaps put you on the spot here for a minute, how can the private sector help you to achieve this agenda?
So legally, for most countries, the private sector is not mandated to report on to the countries that they are in. So for example, in Ghana before, if you had a product on the market, you didn't have to report the quality or the safety into the national database. We made it into a law, and therefore they had to. Okay. So private sector, we will come back to them with the necessary legal requirements that say that you must report into a database. I mean, as for support from private sector, we can always do it, but would ask that before you report out, please report in, because the products are used in, the adverse events or the side effects are experienced differently, and to report in. So just by supporting us to ensure that whatever goes out comes in first, and then we can all push it out.
Okay, so I hope the private sector is listening in on this. Dr. Klutse, Mr. Klutse, you know, the private sector, I've heard it many times in many rooms, the prosperity of an economy sits on the shoulders of the private sector. Let us talk about the health workforce shortages. We've heard about it here. Some of our ministers also talked about working with partners such as the World Bank Group to develop opportunities, you know, for training and education and expansion, etc. But what would be the role of the private sector in addressing health workforce shortages and perhaps helping create more than 2 million potential jobs in the health economy?
Yeah, thank you very much. I think the workforce planning is extremely important. We can't do all the vaccines and all the high quality molecules if we don't have the right skilled force. So for we at Atlantic, what we've done is we've engaged with the DFIs who are helping us on this to develop the curriculum, at the universities, and both the TVET type of courses. These are very, very important. What we are missing is a lot of technicians who can fix a machine. We need a lot of people who can come and fix calibrate the air handling systems. All these are essential, because if we are not able to do this thing, the national regulator is not able to allow us to produce. And these are some of the qualifications or the personnel that are not in the place. So as a company, we've approached it from two angles. First, we are engaging with DFIs to help us to train people locally. At the same time, the factory also has to run. We're having to bring in experts from abroad to come in, work on the equipment, to calibrate them, and at the same time, train local people at the factory to be able to do that. So we are going with two approach. One is a long term, where we want to train people, and we've opened our factory up also to become a training center, right, where we partner with government institutions to come to the factory and do the training. Without the training, we will not go far, and it's extremely important. So as a company, we are happy to collaborate with all the stakeholders to do the workforce planning, workforce training, both from the technician level and even the laboratory levels, at the lab levels. We have signed MOUs with most of the universities in Ghana to allow their students to come to our factory and come and learn on the job, right? And this is very important. Most of them come for 8 weeks. Some master students come for a year as part of their coursework. They come for a year. And all of this is in a way to help thing. And it's not just only the pharmaceuticals that we are doing this thing, but we're also doing it for the engineering that supports pharmaceuticals. Because without the engineering, the pharmaceuticals cannot also stand on its own. So we have broadened this whole thing to the whole value chain ecosystem, both engineering and the pharmaceuticals that help produce the products. We are helping, partnering with various organizations to bring people in, and we also receive, through our technical partners, bring people from abroad, consultants from abroad who come and train us and also train other people with us as well. Thank you.
Thank you very much. I'm known to go off script, but in a very legal way. Dr. Linda Decker is here, Franklin Medical, private sector. Question to you, and I know you'll kill me after this. Let's talk about health workforce shortages and how do you meet the demand as a medical facility in the private sector. Can we give her a microphone, please? Anybody else here that operates in the private sector? Please boldly put your hand up. Don't make me come to you. Don't make me mention your name. And how you are bridging, and I'm going to give you each 30 seconds because after lunch, if I don't engage you, you'll fall asleep. And we all know that. Can I have a roving microphone to our delegates, please? Let's get moving. Let's get this conversation moving. Dr. Linda Decker, you're going to start. You have enough time to have thought about the answer. Healthcare professionals in the private sector, how do you fill that health workforce gap?
Health workforce, I think there are a couple of ways we can look at it. One is to look at resources from within, what is already existing. So within a certain context, you can have one human resource moving around 2 or 3 centers, what we call locum services, which my center uses a lot. But I think one of the things we need to be open-minded about is training and relevant training. So training, you have a dialysis center, train around that, build capacity, and be able to export to other centers. So that's the way Africa can look at human resources.
Okay. Thank you so much, Dr. Decker. Yes, madam, right in front of her. Mention your name. Dr. Decker is my doctor. That's why I put her on the spot. But mention your name and tell us what facility you run. You've got a beautiful 45 seconds.
Okay, my name is Igbo Sifu.
Please put the microphone closer.
Hello, can you hear me?
Beautiful voice.
My name is Dr. Sifu Daudi. What I want to talk about is something about AI. We actually run a series in AI in healthcare. AI can help improve quality, efficiency, and scale across healthcare workers. And we have actually had a university in Ethiopia who we're working with to actually probably develop one of the first diplomas in AI in healthcare on the continent. And I really think AI is something that we should be thinking about and getting the next set of healthcare workers across the world, from doctors to community workers, using AI both for training and post-service to maintain quality, efficiency, and scale.
Then we're closing the gap. The lady right there, you had your hand up as well.
Yes, I did. My name is Njide Ndeli. I'm the president of the Healthcare Federation of Nigeria. And in addition to what they mentioned is how do we use technology to leverage our diaspora doctors? There's so many of them leaving, and we use telemedicine and other ways to, leverage that capacity, which is leaving the continent. Thank you.
All right, do we have one more? I have enough time. Yes, can we have the microphone to the gentleman right at the corner? My floor helpers, run as fast as you can. Thank you, Gabriel. All right, yes, sir.
Good afternoon. My name is Dhananjay Tripathi. I'm the CEO of Atlantic Life Sciences. One of the gaps which I have observed in the last 3 decades in pharmaceutical industry, in the college, in the pharmacy practice, our syllabus is not meant for the industrial training. We are very much focused in the pharmacy, then we see that forensic areas. I understand if we can increase our syllabus in our pharmacy practice, it can be very helpful. Our company, we have realized that because we started many of the such formulation which we started for the first time, starting from the small volume parenteral to infusions to eye drop. We realized that there is a very big gap. We have been bringing people from outside, expatriates to train. So I can say that some of the areas we have trained local people, but that gap is already there. So we have put up a training center, about 115 students. We work with the academia also, with the universities. So these are the areas we have found
These
the
are the
gap, and we want
opportunities.
a better collaboration with academia institutions.
Beautiful
Thank you.
ideas and
Thank you.
submissions. Sarah, you have a big opportunity in front of you. As you look to expand private sector involvement, and we've heard some of these ideas from the floor, specifically when it comes to service delivery, what specific regulatory or purchasing hurdles have been the most difficult to overcome within your existing legal frameworks?
Okay, thank you, Anita. And I think you're right. We have opportunities. So I wanted to focus on that. I think one of the, and actually it'd be interesting to hear if others agree, but when I meet with small healthcare providers, especially on the smaller side, they are very constrained financially, right? And they need financing to grow. And of course, I work for IFC. Financing is our middle name. So of course, my dream, my magic wand is going to involve a financing instrument. So for me, it's about usually when a healthcare SME wants to grow, they're very dependent on insurance payments, right? And that's an essential part of universal healthcare is the insurance payments that they receive. Those are unpredictable, to your point. So we can take for granted that they're going to be delayed. Are there financial instruments that we can introduce to the sector, which to my knowledge have not been, like factoring, for example, has not really been introduced to the healthcare sector in Africa, at least at scale. So for me, that would be my magic wand. Like my dream would be for that to be applied there. And what that would mean is they could deal with the unpredictability. They could deal with the instability, these smaller players, and they could grow. They could grow, they could serve more patients, they wouldn't have to turn away the poor patients, right, and just accept the rich ones who can pay immediately. They could also accept the poor patients. And for me, that also means that they could build their bankability, start buying equipment, start investing in CapEx and infrastructure for their SMEs. So for me, that's again, and if we could de-risk this at the government level, that would be a truly beautiful magic wand.
Fantastic. Your Excellency, Pate, I come to you for our last round. Your words of advice to private sector, because private sector says government doesn't listen to us. Government says private sector doesn't listen to us. So what would be your words of advice to private sector, particularly when we look at the collaboration between both private sector, government, and of course our partners in order for us to reach the primary healthcare status that we all want, that Africa needs?
So I think both sides have their work cut out for them. From the public sector side, it's the policies in place, the regulatory framework with a focus on protecting the integrity of whatever it is they produce, whether it's products or services. Also public financing for those on the margins. But for the private sector, when you look at our own market in Nigeria, which is hyper-fragmented, a lot of small actors, so themselves organizing better, making sure that the business cases that they have are based on sound economics, the demand is there, the willingness to pay, those kinds of basic things, not one that is dependent on government patronage, for instance, which is very unpredictable in terms of how it unfolds, that is really based on rigorous analysis of the market. And also the financial models that they will be coming up with. They're not really looking for handouts from government, but they go out with explicit statements of the risks and the rewards and be able to convince players to be able to bring in their capital to do that. Yeah. Thinking innovatively are not necessarily the easiest things, because I think the health private sector should operate perhaps a little bit differently than, let's say, a private sector in the mining industry.
There you go.
There's a social dimension to it, so that that also gets factored in. Yes, you need profit, you need the return on capital, but this is now ideological on my side. I will say that you'll do well if you put health first, profit follow. Profit is important, but not the other way around, that you are capitalizing on the opportunities to actually make a killing out of the problems that the systems has. So I think the private sector needs to lean in, because they also have a vested interest in having sound, resilient health systems, having human capital built in the economy, creating jobs. There's that social dimension to it. I think the private sector will need to reflect on that and go into it with a sense of the risk, but also their own organization and on the basis of sound economy. I see lots of private actors every day coming in, but in many instances, they have important value propositions.
Yes.
They're really looking to make a difference. And we look at how we can support them to go. But in a few instances, they're just looking for opportunities to make a killing, basically, out of,
Thank you so much, Excellency Patti. Dr. Dako, I would ask you the same thing in your capacity as the Director General of the African Medicines Agency, AMA, and also as a tried and tested professional, in the regulatory space. Your advice to private sector would be what?
What I would say to the private sector is the public sector, if you look at regulators on the continent are building capacity. Regulators on the continent, it's not like it was in the past. So we have the African Medicines Agency now. We have 9 maturity level 3, WHO maturity level 3 agencies. What I'd say to the private sector is a patient in Africa is no different from a patient anywhere else in the world. Regulators are responsible for the public health and safety of the populations in which that they are in. And therefore, if we are putting in the necessary systems, we have systems that have been put in for early engagement. If you want to put a product on the market, you have the ability to engage us as regulators before you even do that. Please do that. Don't let it get to the point where you have made certain inroads and the regulator says there is a problem. So for example, in the African Medicines Agency, we are just about to establish our SME and Innovation Office that allows manufacturers to come in and tell us about what they are manufacturing. We give them the guidance that they need before they go and make an investment. If we do that, we then expect that if you put a product on another market and you're bringing it onto the African market, please bring the same documentation. It is no different. We would be monitoring the safety of the same product, and therefore African regulators and African patients deserve the same as you would put anywhere else. Once we can do that for you, I think that most investments will be de-risked because we put in the early engagement system for you. We're ensuring that our regulators have the right capacity to be able to monitor the quality and safety of your products on the market. And we're ensuring that after your products have been procured, right, we will be part of that process. We'll ensure that the integrity remains. We'll ensure that there's trust in African products. So I'd ask the private sector that in Africa, whatever you would send to other parts of the world, Africa does not deserve anything less. Our regulators are now efficient. They now have the capacity, and they have decided to work together. Unlike before, you now see the regional economic community, SADC, ECOWAS, EAC working together, all coming into the African Medicines Agency. So give us the right information, give us the right whatever we need to ensure that we can monitor the products that you bring. We can ensure that our populations are kept safe. Report into one database on the continent where we can all put out that information for the rest of the world, for our patients, for our industry, and for our governments. Thank you very much.
Well, thank you very much. So, Mr. David Kluche, never in the history of anything does the private sector get the last word. But every time I host a WBG event, I make sure the private sector gets the last word so that you don't say government spoke, regulator spoke, and private sector didn't speak. So now you have the last word. You've heard what they have said. Your contribution to this conversation to wrap it up will be what?
Yeah, thank you very much. From a private sector point, I'll say it's not a lack of opportunity. The problem is not a lack of opportunity. The opportunities exist, and they exist abundantly. The West African, Central and West African have been an import-dependent economy, and therefore we want to transition away from that by having a local pharmaceutical manufacturing hub. But that will only happen if 3 things happen. If the government from a policy perspective, the private sector and the DFIs, the banks, come together, align around the same policy, then we can have, private sector can have a clear path as to which direction we are going. And for that to happen, we need to have clear certainty in demand, predictability in demand. Without that, nobody would invest. We must have the de-risking of the project through a DFI and long-term finance at affordable rates. Should also be available to us to be able to invest. Once we do all of this, then we believe that as private sector, we can take on the responsibility to invest and make the commodities available, products that are quality, efficacious, that will meet all the quality standards that the AMA and all the regional, the 9 regulators who are coming together would approve so that we can sell across the continent. There is a huge opportunity for us to move our products across, but the lack of fragmentation, the lack of demand, visibility, all of these things and the cost of finance is making it not possible.
Yeah.
So we are glad that there is this AIM 2030 project that we want to tap into to be able to do local production here on the country. And if you permit me, I'll just give one quick example.
30 seconds.
3 years ago, Africa CDC said there was a problem with antimicrobial resistance on the continent. Ghana adopted it, and as private sector, we tried to get into this. Getting the finance to be able to do those advanced molecules on the continent has been a big challenge. So this is a real-life example of where there's a policy, clear there's a need, there's a policy has been implemented from WHO all the way to Africa CDC to African governments. However, what is lacking now is the capital to move this thing to implementation.
Right.
So we all need to understand that we all have our responsibility in this. Private sector is ready at any time, but if the right funding source is not available, we are not able to move. So
Thank you so much. Mr. David Kluche, COO of Pharmanova Group, Atlantic Life Sciences. A round of applause, please. We've also had Ms. Sarah Ockman, Advisory Upstream Manager, Manufacturing, Agribusiness and Services, IFC. Thank you so much. We've also had Dr. Delise Mimi Darko, Inaugural Director General, the African Medicine Agency, AMA, and also my best friend, His Excellency, Professor Ali Pate, Honorable Coordinating Minister of Health and Social Welfare, Nigeria. Thank you so much. Panelists, esteemed panelists, it's been wonderful. Thank you very much. A quick photo, thank you. Thank you. Thank you. Ladies and gentlemen, how do you feel after lunch? Are you awake? 30 seconds, please stand up. 30 seconds, please stand up. The food was so good, I do not want to lose your attention. Mr. DJ, a little bit of music. In 30 seconds, move to one person you haven't met and you haven't introduced yourself to. Only 30 seconds. One person you haven't met and you haven't introduced yourself to. Say hello to only one person. Just move for me. Move for me. 20 seconds to go. Move to one person. Dis bonjour à quelqu'un. Dis bonjour. Je m'appelle XYZ. Don't come to me. Go to somewhere else. Say hello to somebody. 15 seconds to go. Let's move. Let's move. It's after lunch. And usually after lunch, I know what happens. So we are moving. In 10 seconds, you have to go to your seat. The Honorable Minister of Health, you know all these people. You have to go to the back of the room. Okay, let's go back to our seats in 10 seconds. Monsieur Bassam, vous n'avez pas bougé. All right, let's go back to our seats. Last person to go to your seat will have to come on stage to dance. You don't want to be that person. So let's come back to our seats. We're now fresh and ready to go. In 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. A round of applause for yourselves for trying and staying up. Thank you, thank you, thank you, thank you. Bringing us to our last session, you may now take your seats. Please sit down. Thank you for stretching and moving. After lunch is always a dangerous block, but we're here to defy all those odds, Dr. Darko. And now for the second part of our roundtable discussion, please allow me to bring to the stage Minister of Health, Liberia, Her Excellency Dr. Louise Maple Poto. Thank you. We also have Global Director for Health, Nutrition, and Population at the World Bank Group, Dr. Monique Vleder. A round of applause. We have His Excellency Hiroshi Yoshimoto, Japan Ambassador to Ghana and Liberia. Please take a seat. Last, definitely not the least, please warmly welcome Dr. Ajogenu, who is a co-founder and CEO, co-chair of the Afro Champions Initiative. Please, a round of applause. You're welcome, you're welcome, you're welcome. Ladies and gentlemen, our second roundtable focuses on the future of development assistance for health and how global partnerships can better align with national priorities, regional resilience, and long-term sustainability. Dr. Vleder, I put you on the spot. You are my very first contributor. I was going to call you a victim, but no, this is too exciting. No victimization here. Dr. Vleder, as we heard this morning, the World Bank Group has set a very bold goal to reach 1.5 billion people with affordable, quality health services by 2030, literally only 3.5 years away from today. What do you see as the role of development partners in this effort?
Well, first of all, thank you very much, and good to see you again, Anita. Maybe I can start by saying that I am from the Netherlands, and I can say with a lot of conviction that the Ghanaian lunch was much better than the Dutch food. So let me start with that. So thank you very much for that. But now more, maybe I can give you a little bit of background on the 1.5 billion. When the new president of the World Bank came in 2 years ago, this was one of the first things he announced. And he was asked, why is this so important for the World Bank? And he said, for 3 reasons. One is because health and better health outcomes means well-being and dignity. But it also allows people to fully participate in the workforce and to be productive citizens and make their own money. And thirdly, the healthcare sector is at the core of job creation. And we have 5 sectors at the World Bank where we focus, but healthcare is the #1 in terms of the total numbers of new jobs that we are expecting to be created in terms of the value chain for health. And we do that by focusing on 3 things: primary healthcare, digitally enabled primary healthcare platforms, the long-term sustainable financing, and the manufacturing and local manufacturing agenda. And then how is that rolled out? Through country compacts. Really at the core is the country leadership setting priorities. And then working across, and we heard that in the previous panel, policy, regulation, and private capital. And then I'll come to the answer to your question, right? Because then it's really up to all partners to support those country priorities. And I'm very happy to be joined here also by Dr. Adam, representing the Accra Reset. We are fully in support of the goals of the Accra Reset, and alongside the policy priorities of governments, we as development partners, including with our financing from the World Bank, need to fully align behind those priorities and defragment the system and come together to support the implementation of those priorities.
And these priorities are clearly very urgent, and as we set 2030, as I said before, only 3.5 years away from now, clearly all hands have to be on deck. So I bring it to you, Liberia. Your Excellency, Maplepoto, given the accelerated transition phase for many countries in the region where donor support for vaccines is tapering, what specific public financial management reforms are you implementing to ensure domestic funds are ready to fill this gap?
Thank you, Anita. But it would be remiss of me if I don't weigh in on the jollof discussion. I'd just like to inform you that Liberia has the tastiest jollof rice.
Your Excellency, we were great friends until this very moment, but that's fine. The floor is yours.
Yeah, and you mentioned the accelerated transition phase. That's the phase some West and Central African countries are in. As it relates to Liberia, we are in the self-financing phase. But we are expected as Liberians to have a health financing cliff because the World Bank been financing our traditional vaccines, and that's going to end 2026, as well as the Gavi co-financing increase in the Gavi 6.0 framework. But what the government of Liberia has done is to formally commit to ring fencing vaccine financing. Last year, 2025, the government of Liberia gave $531,000 as co-financing, timely co-financing to Gavi. So that's what we are doing. And we're also using the IFMIS system. They are expanding, the Ministry of Finance expanding the IFMIS system for enhancing vaccine budget execution, as well as the central bank. They have now introduced electronic financing system for execution of vaccine financing.
Thank you so much, Your Excellency. I also bring it to you, Excellency Yoshimoto. Can you please share with us what collaborative steps are needed between governments and the partners to ensure that regional manufacturing of medical goods is not just a crisis response, but a sustainable profit-making industry by 2030?
I'm sorry. So because the howling, I cannot hear clearly what you think. Please.
I'll say it a bit slower. These times I should really learn how to speak Japanese eventually. But Your Excellency, what collaborative steps are needed between governments and the partners to ensure that regional manufacturing of medical goods is not a crisis response, but a sustainable profit-making industry by 2030?
I see. Thank you very much for Anita for giving this opportunity.
Thank you, Your Excellency.
Japan had a long-standing, history of providing some development assistance, especially focused on the health system. So we value the universal health coverage. So we've been, so as a presidency of Ambassador of Ghana, concurrently Ambassador of Liberia. So last week we met Honorable Minister of Health in Liberia, participating in the maternal and child health care, restoration program. So as you mentioned, so maybe the relationship with Japan, the partner company, is very important. Not only providing, goods and services, but also, as other previous speakers mentioned, stressed, the capacity building important one. So we value the sustainability of a project. After the finishing the provision of financial resources, the government as well as the private sector need to continue their good practice, so that we value we prioritize the capacity building system. So maybe for our development assistance need to be accompanied by the provision of skills. And also, we like to encourage the ownership, as well as self-reliance, so that they can continue to good practice for good in the best interest of local people, especially people in need and vulnerable. Thank you.
Your Excellency, thank you so much. You say something that is so crucial, the importance of ownership. And in my courtesy of World Bank, I had the privilege of visiting Tokyo, Japan for the UHC launch, and it was also mentioned. The power of the prosperity is in the ownership, and thank you so much for bringing that up again. Which brings me to you, sir, Mr. Dr. Ajogenu. Did I pronounce it correctly? No, Dr. Ajogenu, aka Adam. All right. Well, Adam, His Excellency has said something, and I highlight the ownership because it also connects to when pandemics happen. We are thrown off because we are unprepared, which is why what he's saying is so crucial. I bring you the same question when you're talking about the collaborative steps needed between governments and partners. What are those steps to ensure regional manufacturing of medical goods is not just something that we do today to solve today's problem, but it's sustainable and it can also make us money ultimately by 2030?
Great. So I'm glad you talked about pandemics because in those same pandemics.
Closer to you, please. Please bring the microphone closer. It's on. Yeah.
So during those pandemics, we also hear a lot of commitments about manufacturing capabilities that exist, whether it's for COVID, whether it's for Mpox, whether it's for Ebola. We see regional efforts bringing manufacturers together to come up with all kinds of facilities to be able to get local production for these kinds of products that we need during pandemics. But what happens immediately after the pandemics is that those efforts disintegrate and everybody goes back doing what they do prior to the pandemics. And the question is why? Because we have to look at the design that goes into this regional, or if you like, scalable manufacturing capabilities. And a lot of it was said in the previous panel. It boils down to three things, really. One is demand, demand aggregation. If there's no pool procurement mechanism that enables us to bring collective efforts around procurement and scale, there's just not going to be an investment that enables people to plan for just small demand. So demand aggregation is extremely important. Two is patient capital, which has been said a lot in the previous panel, having the kind of capital that will go into the kind of investment with clear predictability linked to what I talked about earlier, which is the demand. And then lastly, is, of course, was also said in the previous panel, the trusted regulatory systems that ensures that you're able to, and you certainly don't want to be dealing with fragmentation going to 54 countries. So that, for me, is the underlying mechanism around which we can get a guaranteed investment into the kind of, but the pool procurement aspect was not said in the previous panel, but I think it's also extremely very important.
Sorry, say that again for me, sir.
Pool procurement.
Pool procurement aspect. Okay, no problem. Thank you so much. Dr. Vleda, let me come back to you. The director of the Global Financing Facility, we've heard about it many times today. We know about it. We're celebrating your 800 million investment round. Bringing that amount in the investment round, it means a lot for the communities that you serve. But you are one of the World Bank Group's partners in delivering on the regional strategy, and as we've said already, the 1.5 billion goal. How can countries and development partners benefit from working with the GFF?
Well, thank you very much. And the GFF is a partnership hosted by the World Bank and was originally designed in 2014. The design phase was led by 4 African ministers of health. And at the core of it, it has country leadership, a meticulous focus on women and children and adolescents results, and in a much smarter way using grant funding to leverage other financing. And so there is grant financing linked to World Bank IDA financing, or grant financing to de-risk investments from the private sector. It takes innovations, like for example, an innovation that was introduced by the government of Tanzania that reduced neonatal death by 40% and maternal death by 75%. It takes those kind of good examples and scales it up across all the 40 partner countries. And so we're very fortunate. The government of Japan is one of the partners, with the generosity of the partners and their commitment to the solidarity of women, children, and adolescents. And therefore, we are well financed and ready to work with any Minister of Health that wants to make impact on maternal and child health.
Thank you so much, Dr. Vleder. Your Excellency Yoshimoto, the World Bank Group's national lending operations and the GFF, as Dr. Vleder has just described, these offer the opportunity for a common vehicle. Obviously, that common vehicle aligns with external donor funding behind a single country-led plan and also on budget to drive impact at scale. As a partner, speaking on behalf of your wonderful country, Japan, what would you encourage, or what would encourage you to align to support in a similar way?
Thank you very much indeed. Major takeaway from the COVID outbreak, as well as some other, infectious diseases, that the world is, interconnected. So even the, developed countries they cannot, survive without, sustainability of the developing countries' health system. So that's why we value the universal health coverage ideas. So as you mentioned, so we have been a consistent and committed champion of universal health coverage and human security for decades. So we are proud to be one of the world's largest providers of health-related development assistance through JICA and through World Bank and some other, institute, facilities like Global Fund and Gavi, Vaccine Alliance. Having said that, building on this commitment, last December in Japan was honored to co-host, together with World Bank and WHO, bringing a high-level meeting on health, universal health coverage, bringing together health and financial minister. It was one of the, maybe game changer. And development partners and civil society to reinforce political momentum ahead of critical global milestones. So that meeting reaffirmed our fundamental message. Universal health coverage is achievable, but only if political commitment is matched by evidence-based reform, adequate financing, and genuine country ownership. And having said that, one of the clearest lessons from that meeting and from Japan's own 6-decade journey since achieving universal health insurance in 1961 is that knowledge and evidence are indispensable. And difficult choices on prioritizations and resource allocation and scaling of solutions must be guided by data, by rigorous analysis, and by the lived experience of peers who have navigated similar challenges. That is precisely why Japan places the Universal Health Knowledge Hub at the heart of our global health agenda. The hub is not a passive repository. It is rather a practical action-oriented space for sharing lessons and strengthening analytic capacity and connecting reformers across countries with the technical partners and tools they need. I am genuinely proud that Ghana is part of the inaugural cohort of the Knowledge Hub. Ghana's experience, including the evolution of the National Health Insurance Scheme and the ongoing scale-up of primary health care delivery. Also, we can get some lessons from Liberia and other, West African countries. Thank you very much indeed.
Thank you so much, Your Excellency, for highlighting Ghana's example and also Liberia's example, in the essence of the Knowledge Hub. Now, I bring it to you, Your Excellency Kpoto. Excellency Yoshimoto has highlighted how Japan has basically found alignment in the support of helping us, if I may put it that way, accelerate primary health care through universal health coverage. Dr. Vleda has highlighted the role of GFF. Perhaps I'm going to change the gears a little bit for you to talk about institutional mechanisms that you are creating to ensure that other areas, energy, water, and digital sectors prioritize health facility readiness in their own national infrastructure pipelines.
Thank you, Anita. I'd like to extend thanks and appreciation to World Bank and the Japanese government for the support to the Liberian health sector. Liberia, we are cognizant that a resilient health sector depends on energy supply, water and sanitation, as well as digitalization. So partner with the World Bank and under the World Bank finance Liberia electricity sector strengthening and access phase 1. Approximately 90 health facilities have benefited from solarization. We also partner with the German government through GIZ, and we have close to 400 health facilities that have been solarized. We are also partnering with other developmental partners that I may not name here, but they are also helping with solarization. As it relates to water and sanitation, we have our Pitfall, but in our arrest agenda, we have targeted that 90% of the health facilities, specifically in the rural areas, will have water and sanitation, the basic water and sanitation by 2029. As it relates to digitalization, we have, in February of this year, we launched our National Health Intelligence Center, where we hope as we cascade our EMR across the country, we have real-time data as it relates specifically to maternal and neonatal health. We are currently using a DHIS2 at the Ministry of Health, where we end up looking at our data, as well as we have different data systems for the pharmacies and the warehouses that we also take care of.
Thank you so much, Your Excellency. I think my one question would be to all of you. Today is a very important day for West and Central Africa as we launch this very important strategy. What do you hope to see from today onwards? We've got AIM 2030 around the corner. We've got Agenda 2063 further down the line. We've got SDG 2030. We've got so many deadlines, if I may put it that way. So Dr. Edem, let us start off with you. With this launch of the strategy as we've had it, what would you hope to see from today?
I'd like to see country leadership in driving a vision and agenda that builds the kind of capabilities we need within the country. I want to see more shared experiences and lessons across countries. Opportunities being created, as we talked about. I mean, we were talking about manufacturing earlier. There can be manufacturing sustainability without, private sector being able to have the predictability and the ability to be able to invest and have scale. So I want to see that as well. But we also want to see collaboration with international partners who play a role that is complementary to what governments are leading, particularly when it comes to some of the gaps that we see and the bottlenecks, as you called it earlier. So whether it's in financing, which is why I applaud the work that GFF and IDA are doing. They talk about a lot of shortage in capital, but that's in grant capital. There's a lot of money still out there in private capital and also DFIs that could, go in either through debt instruments and others, be able to support and partner, and sometimes also take more investment equity in some of these things as opposed to just expecting grants or loans. So that would help seal a lot of those bottlenecks. We talk about regulatory as well. But for international partners, again, I want to see a lot more collaboration in areas that are providing, the gaps that we see in which we think governments cannot do and the private sector cannot do on their own. Be able to take some of those risks or help to de-risk some of those things. And finally, in the logic of Accra Reset that is being championed by our president and our honorable minister who is here, their vision is to see a continent that wins itself out of dependence. So what I want to see is a continent that leads the discussion, but also builds the prototype towards the new global health architecture. But a global architecture meaning that a new architecture that wins us. Any architecture that keeps us dependent on aid and dependency is not a new architecture. And so that's what I want to see post-2030, the post-2030 dependence. Thank you.
All right. Dr. Monique Vleda, what would you hope to see now that this strategy has been launched?
So I'm going to build on what Dr. Adam was saying and saying that I hope that these policy priorities from governments can be implemented through this new regional program that we are going to support at the World Bank for Africa West, with hopefully a lot of countries participating in it to further develop their primary healthcare systems, but also as a vehicle to support that policy and regulatory space for more local production of medical supplies, pharmaceuticals, and in some cases vaccines. So that regional program with the country financing through IDA and grant funding from GFF and some cases pandemic fund as well as bilateral partners, and hopefully Gavi and Global Fund co-financing is really that big platform that creates that opportunity to finance policy priorities of governments and to come together in a non-fragmented way around supporting those policy and financing and implementing them.
Thank you so much, Dr. Vleda. Your Excellency, Poto.
I would like to see access to care improve. If we have services brought closer to the community, you have improved health sector. So I also like to see strengthening of the primary health care.
Yeah.
I believe if we support the community care workers, we have decreased maternal mortality and improvement in the indicators of nutrition.
Thank you so much. Your Excellency, Yoshimoto, you have the last word. We are launching the strategy today. We have launched the strategy. Governments, partners excited about it. What would you like to see? What would be your words you would like to share with us as we wrap up this conversation?
With regard to the universal health coverage, we remain committed to providing support in collaboration with major partners and World Bank and each health sector authorities. Having said that, this theme of this meeting will be includes, I think, nutrition. Nutrition is a very key issue for us, especially for baby and early child, so that they can develop their health as well as develop their minds and brains. So maybe nutrition is a very crucial issue for us to think about it. So maybe let me explain one of the examples. The private Japanese company are proactive in this country. So they provide, the company is a Japanese leading food company, producing some food and nutrition, supplementary nutrition. I see. Here in Ghana, we have traditional, baby food called cocoa. We put, some, supplement, nutrients, include iron and amide acid, some other, very nutritious nutrients, so that children can, get such kind of adequate nutrients for their, development and health, body and brains. And there, history of that, activity, operation of that private company, Cocoa Plus Foundation, has a long history for about the last, I think, 10 years. They have a very close relationship with the Ministry of Health, as well as the Ghana Health Service. They go all the way to the rural areas and have some, educational opportunity for the midwives and in the health sector centers, so that they attract, mothers and expecting mothers to learn about the right nutrition issues. Okay. They focus on the, so far, maybe up to age 3 years old. But now, they are planning to expand to up to 10 years. In collaboration, further collaboration with Ghanaian Education Service, as well as the Ministry of Education. Thank you very much.
Thank you so much, Your Excellency, and for giving us practical examples of how we move forward together. It's absolutely priceless. Ladies and gentlemen, I've had His Excellency Hiroshi Yoshimoto, Japan Ambassador to Ghana and Liberia. Thank you very much, Your Excellency. I've had Her Excellency Dr. Louise Maple Poto, Minister of Health, Liberia. Your Excellency, thank you. I've had my dear friend, Dr. Monique Vleder, Global Director for Health, Nutrition and Population from the World Bank Group. Thank you very much, Dr. Vleder. Last, definitely not the least, Dr. Edem Ajogenu. I know I got that right. The co-founder and CEO of co-chair of Afro Champions Initiative. Thank you so much, my esteemed panelists. Ladies and gentlemen, a round of applause. And we'll grab a photo. Thank you. I appreciate it. Ladies and gentlemen, another round of applause for our panelists doing our conversation justice. Microphone. Thank you so much. Ladies and gentlemen, another round of applause. I just want to make sure that you are up, you are well, you're healthy. We have just about an hour more to go. It's not a lot. But we are moving into what I humbly like to say, one of our most crucial conversations. Coming up onto the stage to direct Youth Ignite Talks is Dr. Fatoumata Barry. She is a Niger national. She is an art scientist, an award-winning writer, a medical doctor, and a public health specialist. She is currently a young professional for health at the World Bank Group. Previously, Dr. Barry was with the Pandemic Fund, where she managed the Mpox 6-month response portfolio. Now, she has conducted research, carried out humanitarian work in the Sahel, and worked with multiple research institutions, including Johns Hopkins, as well as international organizations. Ladies and gentlemen, it is the honor of my job here as a Master of Ceremonies to bring to the stage the voice of tomorrow, leading Youth Ignite Talks. Please warmly welcome Dr. Fatoumata Barry.
Thank you, Anita. Excellencies, distinguished partners, we are standing today around the consequences of decisions made decades ago. Policies signed, budget passed, priorities chosen for children we once were. This is not a session to entertain a high-level audience. This is a moment of a generational reckoning. May I ask, if you're less than 40 years old, could you please put your hand up? Thank you. I see you, I see you, and I see you. You have the pen to be the co-creator of new decisions. What we decide today will ripple forward to children we will never meet, future adults that will navigate through systems that they will inherit. Kadiatu Idani, would you please stand up? May I please ask you a round of applause for this young lady? Thank you. She once said, and she lives by this quote, "What you prepare for me without me is not for me." As we launch the strategy today, we, the youth, we are here because Africa West and Central, a region very young, in Africa West and Central, a roadmap without youth is a future without consent. Today, I am going to bring you to the stage the faces and the voices of young and phenomenal women who stepped into system they inherited, yet they refuse to let them not unchanged. They're fixing them, they're reimagining them with great sense of urgency, but also agency, care, and shared accountability. Ladies and gentlemen, excellencies and partners, please welcome from Côte d'Ivoire, Dr. Emmanuel Cartier, Head of Gynecology Service at Sikensi Hospital and founder of an AI tool for access to adolescent health information.
Maya, c'est le nom qu'on donne à une solution contre la mort, contre la honte. Au cours de mes années de formation pour devenir gynécologue obstétricienne, j'ai reçu une jeune fille de 13 ans qui est venue lors d'une de mes gardes pour accoucher. 13 ans, en seconde, donc intelligente. Je lui ai alors posé la question, comment se fait-il qu'à 13 ans, tu es enceinte? Elle me répond, docteur, je ne savais pas que je pouvais tomber enceinte la première fois. Toujours au cours de mes années de formation, j'ai reçu une jeune fille de 17 ans qu'on a pris en charge pour des complications post-avortement. À 17 ans, chez elle, on a dû réaliser une ablation de l'utérus. À 17 ans, elle se retrouve stérile. Elle ne pourra jamais faire d'enfant. Je lui ai aussi posé la question. Elle m'a dit qu'elle ne savait pas qu'elle pouvait prendre la pilule du lendemain. J'étais estomaquée. J'ai continué ma pratique. Et au cours de mes consultations, je recevais des jeunes filles qui venaient pour des pathologies qu'on aurait pu régler en 48 heures, mais qui venaient pour des cas graves. Alors je leur ai posé la question, pourquoi vous ne venez pas à l'hôpital? Il faut savoir que j'aime bavarder. Et à chaque fois, elle me disait, docteur, je ne savais pas. Je n'ai pas voulu venir parce que la sage-femme, c'est l'amie de ma mère. La sage-femme et moi, on est dans la même communauté religieuse. Et ça m'a ramené à mes souvenirs à moi. Moi aussi, quand j'avais 18 ans, je suis allée voir un médecin gynécologue. Et j'ai eu honte quand je sortais de là. Honte pas parce que j'étais malade, mais honte à cause de la réponse qu'on m'a donnée. Honte parce que j'avais l'impression que je posais une question qui était interdite. Alors, la seconde fois que je suis allée voir un médecin, j'avais 35 ans et c'était parce que j'étais enceinte. Imaginez, 18 ans sans être allée chez le médecin. Je me suis dit alors qu'il y a quelque chose à faire. Et je suis allée sur les réseaux sociaux, sur Instagram. J'ai commencé à faire des posts pour pouvoir sensibiliser sur la santé sexuelle et reproductive. Les jeunes venaient à moi, ils me posaient des questions. Alors je me suis dit, je veux aller vers eux. Je suis allée dans les internats, j'ai organisé des soirées pyjama pour des cadres un peu plus intimistes, pour pouvoir parler aux jeunes filles. J'ai organisé des garden parties pour pouvoir leur parler des IST, les sensibiliser dans un endroit joyeux. Et à chaque fois, quelque chose se produisait. Elles attendaient que le groupe parte pour venir me poser des questions un peu plus intimes. Alors, j'ai créé ce qu'on appelle Maya, qui est une messagerie disponible 24 heures sur 24, 7 jours sur 7, anonyme, gratuite et sans jugement cette fois. Et disiez-vous qu'en 5 mois, nous avons eu près de 2000 utilisateurs, plus de 15 000 questions posées et plus de 30 000 réponses qui ont été données. Avec Maya, on s'est rendu compte que les jeunes avaient soif de savoir, mais de savoir dans une safe place, dans un endroit où personne n'allait les juger. Et nous avons continué. Et en temps, je vous avais dit que j'étais enceinte, j'ai eu un garçon. Et pour ça, j'ai créé la zone XY, qui est une partie de Maya qui s'adresse aux jeunes garçons. Parce qu'éduquer seulement des filles, c'est pourquoi Maya a été créée, ça serait permettre de pouvoir continuer à augmenter le taux de grossesse en milieu scolaire, à augmenter les IST qui se répandent. Donc cette fois-ci, je dis que non seulement les garçons, mais aussi les filles. Et aujourd'hui, à vous, je veux vous dire que Maya, ce n'est pas seulement un chatbot, c'est une présence d'un gynécologue obstétricien qui parle à des jeunes, mais aussi d'un comité scientifique qui répond à des questions dans un regard de jeunes. Alors, à vous, nos dirigeants, ce que je demande, c'est de ne pas seulement nous consulter quand vous avez besoin qu'on soit là, de nous permettre d'être des architectes, des solutions pour les jeunes, d'être les pionniers, d'être ceux qui posent les premières briques, parce que nous sommes des jeunes, nous travaillons avec des jeunes et nous connaissons nos réalités. Je suis Dr Cathy Ebou-Emmanuel, je suis gynécologue obstétricienne, je suis une mère et je me bats pour que la science vienne à nous. Merci.
Merci Emmanuel. Elle a apporté les solutions là où il faut, avec la manière qu'il faut et la manière qui parle aux jeunes de sa communauté. Please allow me to welcome from Ghana, Ms. Gifty Apea, a GFF Young Leader, Program Advocate for Youth Advocates Ghana. May I have a round of applause for Ms. Gifty? Ms. Apea, what changed when youth and young people are no longer the outcome of decisions, but the co-authors, seated where resources, power, and priorities are shaped before they are sealed.
Thank you very much, and good day, everyone. So this afternoon, I would like to answer the question, I would like to tell a story. So my story is simple. There is this young lady, 15 years of age. She serves as a youth champion in the northern part of Ghana, and she's very passionate, very strong, and very resilient. She works with us, and she works with the community health workers at the northern part of Ghana on issues around sexual and reproductive health. She has been trained, and like I mentioned, very passionate, very committed. So, one day, she went to school. She's in the senior high school. She went to school, and she noticed that there were male condoms at vantage points in the school. So she asked one of her teachers, "Why do we have this here?" The response she had was that, "Don't you know what's happening? There is an increase in teenage pregnancy in your community, in fact, in the entire district. And again, we have realized that that's also leading to unsafe abortions, and then we are having infant mortality issues as well. Don't you know what's happening?" So now she had to ask herself, why are we now having solutions to problems designed for young people without them? So now this is the turning point. She decided not to confront the health workers directly. She now decided that I would draft a letter. In this letter, I would rally the support of all my fellow young people in the district to come together and then sign on that same letter and then deliver it in person to the district director of health in the district. So this was done. And one very interesting thing she did in the letter was to show or indicate where the young people wanted to meet this director. She did not leave that option open. She did not say, "Oh, I want to meet you in your office or in the community center." She chose a vantage place together with the young people. Now, during this meeting, she made her request known, and like I mentioned, it was just a simple question the young people at the time asked. Why are we designing solutions for young people without them being on the decision-making table? So now this is the situation in most of our communities. And even at the national, regional, districts, and community levels, this is the challenge. Now, we have situations where, personally, I would also tell a story of myself where I have been on decision-making tables, and it looks as if the decision has already been made without consulting young people. Now, as Fatoumata mentioned earlier, by 2050, Western and Central Africa, in Western and Central Africa, we are going to have 1 in 5 young people in the region. If we do not take bold steps to ensure that young people are actively involved in the decision-making process, then we are not making meaningful strides in making the society or the region a place where young people can live and actually be happy and realize their full potential. Now, the question is not whether to invest in health, but then the question is on how. As Youth Advocates Ghana, we, under the Youth for Global Financing Facility project, we have successfully trained over 40 youth-led organizations to effectively monitor and track expenditure, government expenditure or budgetary allocation around maternal, reproductive, child health, and then newborn health, as well as NCDs. Now we have these YLOs doing amazing work in their own spaces, and together with some support from government. Now they are asking the most relevant questions around where is the money going? This is the most important question. Where is the money going? We have budgetary allocation, but the question is, are these funding being channeled into the right places at the right time and in the right context? Now, the difference here is not about resources. It's all about inclusion. Now, I would like to end with a message to our stakeholders here in the room, development partners, young people like myself, and then also our government stakeholders. We need to move beyond token engagement and one-off consultations that we have with young people. And it's also important that we fund youth-led initiatives, embed young people in decision-making, and then again, most importantly, we need to strengthen accountability systems that will make it easier for our young people to effectively track and then monitor government expenditure around essential or critical health areas. Evidence suggests that when we invest in health, every $1 that is invested in health will end up yielding $15 more that can be channeled into economic ventures for young people to benefit from. To conclude, I would like to leave this with all of us on our minds. The future is not something we prepare young people for. It's something that we need to build with them. But I would ask a question. Are our systems ready to support young people in this course? Thank you.
Thank you so much, Gifty. Excellencies, distinguished partner, did you see what I was talking about? She mentioned institutionalizing young people engagement. As we look to 2050, our region will be home for 1 in 5 young people on this planet. Tomorrow, you will all go back to business. I want you to remember, please, Dr. Emmanuel of your countries, Khadija too of your communities, the Gifty of your neighboring countries. I need you to think about your children, your grandchildren when you're making the decisions and the policies. When you shape the policies, when you design the solutions, please invite young people as stakeholders. And do you know why? Because what we call a historic demographic turning point, it's a lifetime opportunity on delivering our promises to the communities, a dividend and a healthy and thriving life. Excellences, distingués partenaires, as we leave this room, may I please ask you to remember, history will not ask us what we intended, it will ask us what we left behind for the children born today. And respectfully, think about where you will be in 2050. Are you? 2050 belongs to the babies born today. Accountability belongs to us now. I thank you.
Ladies and gentlemen, another round of applause for Fatoumata. I feel like it's not loud enough. That's the next generation. And you and I are going to be going to the Dr. Fatoumatas for help sooner than we think, so they deserve all our attention. Who are all of those under the age of 40? Please put your hand up. The real 40. I saw some of you putting your hands up, and I know you personally. And I know clearly you were 45 years ago. All right, ladies and gentlemen, before we go to the last part, which is our closing ceremony, a very crucial part of our gathering, I would like to release you to go for a quick coffee break of 15 minutes. But it's crucial that this time you come back on time. I will mention names of people who don't come back to their seat on time, because we do need all your attention and that last bit of energy for our official closing ceremony. So our coffee break starts now. We'll be back in 15 minutes. My ushers, my team from World Bank Group, please let's count down the clock so we're back in 15 minutes. Thank you so much. Energy, your last bit of energy. And before we wrap up, I want to take the pulse of our audience. I need three wonderful representatives who can put their hand up and explain what they are taking away from here today. 3 individuals. I'm not very picky, whoever you are. Anybody, yes, madam, please stand up for me. How the day has been for you, the hope it has put into you, and what you hope we'll achieve with our strategy. Our first person, second person is where? I need 3. It would be fantastic to hear. Yes, sir, please stand up for me. And the third person, stand up. The third person. Whose hand was going up? Oh, over here. Thank you so much, Mr. Titus. All right, so our first lady, please mention your name, your organization. You've been with us the whole day. What have you heard that gives you hope for the strategy that we've launched today?
From the onset of this conversation, hello, my name is Rosetta Fadolo, and I'm from Liberia. I represent the Federation of Liberian Youth, the umbrella youth organization for youth activities in Liberia.
Good.
So during all of the conversation, one thing that stood up right for me was the fact that young into this primary decision making that affect them directly. From the presentation, related to ensure that we have young people at the center of this decision making, that they make informed decision about their sexuality, even forgetting of the fact that not every one of them have access to primary health care,
yes,
but they must be able to have access to their reproductive rights and services.
Thank you.
Thank you.
Thank you so much. Thank you for your contribution. Yes, sir, your name and your thoughts on this strategy that has been launched.
Thank you very much. My name is Ampuma Isaac, and I work with the Concerned Health Education Project, a civil society actor in Ghana. I heard about free primary health care, and that this whole engagement is that there is going to be an investment in this sector. And already, as a citizen of Ghana, I've already heard about free primary health care
Good.
by my government. So I'm very happy that it is in alignment with where the World Bank investment is going to be. And so I see that my government is doing well, and so there will be enough money from the World Bank to support it. But what I didn't hear is, where will civil society play? What are the roles of civil society?
Thank you.
And I see that as a critical gap.
Okay.
But I know my minister is here.
Yes.
So he will definitely invite me, as he has been doing, and we'll take it from there.
Will he
and
be
move
inviting
forward.
you to his
Thank
office,
you.
or he's inviting you where? Thank you very much for selling yourself. Yes, gentlemen, we have only 1 more minute to go. Yes, sir?
All right, thank you very much. My name is Titus Owusu-Darko. I'm the National NUCS Secretary for Innovation and Entrepreneurship. One of the speakers mentioned that today's youth are not involved in decision making, and so it retards the development of the youth when it comes to these developmental projects. And so we as youth should also be active, find our voices, amplify our voices in decision making, so that whatever decision that would be made today would not affect the next generation. Thank you.
Thank you so much. I saw a hand going up. 30 seconds, ma sœur. Allez-y.
Allô, ok. Alors, bonjour à tous et à toutes. Je suis Touré Sira Sojourné, coordinatrice programme au sein de l'Association d'aide et d'appui aux familles et enfants vulnérables, et je viens du Mali. Alors, ce que nous avons retenu au cours de cette journée, c'est surtout de voir et de comprendre un peu cet aspect d'intersectionnalité et de prise en compte de tous les besoins et également de toutes les attentes des populations vulnérables. Nous avons ici parlé d'innovation, des efforts qui sont entrepris par nos gouvernements, mais également de comment cette stratégie va soutenir tous ces efforts-là et comment les axes prioritaires les 5 axes prioritaires qui ont été identifiés, comment ces 5 axes prioritaires vont supporter cette dynamique collective de croissance afin de nous permettre d'ici l'horizon 2030 d'atteindre cette santé pour tous et pour toutes.
Merci beaucoup, ma sœur. And now, ladies and gentlemen, I came to the floor. I'm coming back to the stage. It's been a dynamic, extraordinary day. The strategy has been launched, and we have a lot of work ahead of us. But now we would like to hear from the statements and what the statement says. This has been chaired by the Honorable Kobina Minta Akando, Minister of Health of the Republic of Ghana. Your Excellency, Honorable, please take the stage and share the statement with us.
Thank you very much. Excellencies, distinguished guests, and partners, we have convened here in Accra today to discuss quite literally the health of Western and Central Africa. It is a matter of utmost importance to the region's future. We wish to extend our deepest gratitude to His Excellency John Dramani Mahama and the government and people of Ghana for their warm hospitality and for co-hosting this important event. This gathering brought together honorable ministers of health and finance and representatives from countries across Western and Central Africa, alongside experts from the private sector, civil society, development partners, regional institutions, and youth leaders. It reflects a shared commitment to the health and well-being of over 500 million people living in this region today and the 200 million children who will be born in these same countries between 2025 and 2050. We have taken the opportunity to help launch the World Bank Group Health, Nutrition and Population Strategy for Western and Central Africa. We are said that by investing in health today, we can ensure that the next generation is not only fit to survive, but also fit to prosper. We recognize and commend the strong momentum created by health sovereignty and domestic resource mobilization initiatives that have already charted a path forward, most notably by the Accra Reset, which in turn built upon the foundation of the Lusaka Agenda. The Fit to Prosper Health, Nutrition, and Population Strategy is intentionally aligned with these efforts, offering a technical and strategic framework to help advance the same goals. By optimizing the use of existing resources to spend better whilst mobilizing additional domestic resources for health, we can achieve and sustain long-term development gains. There is also a growing recognition that investing in health is both development and economic imperative. Healthy populations are more productive, more resilient to shocks, and better equipped to drive job creation and economic growth. Strengthening health nutrition system is therefore essential to boosting productivity, enabling inclusive growth, and advancing universal health coverage. The Fit to Prosper strategy is built on three strategic priorities. Front lines, first, strengthening service delivery with a focus on primary health care. Fixing finance, ensuring sustainable investment, and future fits, building health system resilience. Applying these priorities to our daily work going forward through close partnerships between national development and the World Bank. A regional goal is ambitious but attainable: to reach 200 million people in Western and Central Africa with quality, affordable care by 2030, contributing to the World Bank Group's global target of 1.5 billion people. At the center of this effort is a universal, high-quality package covering reproductive, maternal, neonatal, child, and adolescent health, plus nutrition services designed to break the cycle of high maternal and child mortality and stunting that hold back our economic potential. To translate these aspirations into national impact, we advocate for the realization of National Health Compact in every country. These compacts, which are high-level agreements to outline national commitment to expand affordable, quality health care, help to galvanize political leadership, clarify policy reform priorities, and bring together the Ministry of Health, the Ministry of Finance, and all development partners to align around a single country-led plan, one budget, and one reporting system. We also welcome the collaboration with the Universal Health Coverage Knowledge Hub, a capacity-building platform designed to help us share evidence, practical tools, and opportunity for peer learning. As we look ahead to 2030, reliable access to medicines, vaccines, and supplies through stronger supply chains and local manufacturing is critical. The AIM 2030 initiative has the potential to transform local medical manufacturing, enabling Africa to produce life-saving medicines on the continent. At the same time, we recognize that the public sector cannot achieve these goals alone. The private sector is an essential partner in innovation, service delivery, and the development of local value chains for medical countermeasures. From pharmaceutical manufacturing to digital health solutions, private sector engagement is essential to expanding access and creating more than 2 million potential health-related jobs in Western and Central Africa. The forthcoming World Bank Regional Health Investment Platform, the Health and Jobs Multi-Phase Approach, will contribute to prioritizing investment in health as a foundation pillar of the economy by expanding the number of skilled doctors, nurses, technicians, and midwives. We are simultaneously improving health outcomes and creating secure, productive employment, particularly for women who make up most of the health workforce. An emphasis on digitally enabled primary health care is both strategic and timely. Primary health care that extends beyond facilities through telemedicine, community health workers, pharmacies, and schools can bring services closer to the population and accelerate progress towards universal health coverage. Furthermore, by investing in community health workers, we can bridge the gap in service coverage and build the trust necessary for effective service delivery, disease surveillance, and outbreak response. A strong primary healthcare system is our first line of defense against pandemics, climate change, and food insecurity. Discussions also emphasized the importance of engaging youth as active stakeholders rather than passive beneficiaries, noting that by 2050, Western and Central Africa will be home to 1 in 5 young people globally, and that outcomes will depend on choices made with them. In closing, we thank all the delegates and technical experts for their dedication in shaping the strategy. We are now inviting all countries, all 22 countries of Western and Central Africa, to join this unified effort. We call on all partners, including private sector, to come together to support governments. We also invite communities to own the strategy and contribute to its realization. The cost of inaction, measured in lost lives and unrealized economic growth, is simply too high. Together, Through the implementation of the Fit to Prosper strategy, we can ensure that every child born in this region has the opportunity to thrive in a healthy, resilient, and prosperous future. Thank you.
Thank you so much, Honorable Minister. And now, ladies and gentlemen, it gives me great pleasure to bring to the podium to share the closing remarks the World Bank Group's Regional Practice Director for People, Ms. Trina Hack.
Honorable Minister Minta Akando, Honorable Ministers of Health, Finance, Budget and Planning from across the region, distinguished guests, colleagues and friends, good afternoon or maybe good evening. It's been a long day. We have had a full day of productive discussions. The richness of the dialogue tells me something important about what this agenda means to the people in this room. Before anything else, I want to say a warm thank you to all of you. I would also like to express my deepest gratitude to His Excellency President John Dramani Mahama for his patronage of this launch and for his keynote address delivered by his Chief of Staff this morning. Thank you to the Minister of Health and to the Government of Ghana for everything. The welcome, the partnership, the years of work that made Ghana the right place to launch this strategy. You did not just host us, you helped shape what we presented. Thank you to Mamta Murthy for her remarks this morning and for joining us here in Accra, for the sustained leadership that she has provided together with Usman Diagana, our World Bank Regional Vice President, that made this strategy possible. Thank you to my management team for leading this effort and to our country task teams across the region. Today is the visible part, but we acknowledge all the hard work that preceded this day. Thank you to Anita Erskine, Miss Anita, for keeping a packed schedule moving with energy and grace and even ahead of schedule, perhaps. To CNBC Africa for the live broadcast and for bringing this conversation to a wider audience going beyond this room. And to all of you, panelists, ministers, private sector leaders, development partners, and to the young people who spoke in the Youth Ignite talks. Thank you. You reminded all of us who this strategy is ultimately for. The statement that the minister just read captures the formal summary, so I'm not going to summarize again. But what struck me most about today was the quality of the conversation in every session and the honesty in the room. Ministers spoke plainly about where the system falls short. Significant service delivery gaps remain. There is also room to improve efficiency and execution in government spending on health. And there is need to prioritize health further in government budgets. Finally, 70% to 90% of essential medicines and vaccines and medical products are still imported from outside the African continent. At the same time, this room made the economic case for change with equal force. We heard that the benefit to cost ratio of investing in health exceeds 15-1. That is a great investment. And addressing health worker shortages alone could generate over 2 million skilled jobs across the region. That combination, honest diagnosis and compelling opportunity, is exactly the right foundation for a strategy. What also came through clearly in every session is that no single actor closes this gap alone. We look to governments to lead with domestic financing and to build health systems that are resilient by design, not just in normal times, but functional during outbreaks, climate shocks, and economic crises. We seek the private sector being a genuine partner in local manufacturing and service delivery, not as an afterthought. As development partners, we will align behind country-led plans and compacts. And as the young people who spoke today reminded us, the people this strategy is meant to serve must have a real seat at the table. By 2040, 1 in 5 young people in the world will live in Western and Central Africa. Whether that becomes a dividend or a deficit depends on the decisions we make starting today. As World Bank Regional Practice Director, I want to be clear what the World Bank Group is committing to. The strategy sets a target: 200 million people in Western and Central Africa reached with quality, affordable health services by 2030. In case anyone is counting, that is only 4 years from today. It is ambitious, but for a region that bears a heavy disease burden, we must not only meet, but also exceed this ambition. Our commitment as the World Bank Group is real. However, we cannot meet the target by acting alone. The path forward runs through the partnerships in this room, through governments that prioritize health in their budgets because their citizens demand it, through a private sector that sees health systems not just as a market, but as an opportunity to invest in regional economic development, through development partners who align behind country leadership and priorities. The path forward also runs through young people who will hold all of us accountable. The event statement you just heard by the Minister conveys this commitment. To close, Western and Central Africa is the youngest region on Earth. The children who will define this continent's future, economically, politically, and socially, are being born right now. Whether they arrive healthy, whether they grow up healthy, whether they enter adulthood with their full potential intact, whether they learn and then earn, all of that depends on decisions being made today in ministries of finance, in primary health centers, in communities, in households, in the policy choices that this strategy is designed to support. Today was one of those decisions. You showed your commitment, you shared your views, you offered your insights. Now comes the harder part, and the more important one. On behalf of the World Bank Group, thank you very much, and let's get to work. Merci beaucoup.
Ladies and gentlemen, we started this morning at 9:56. It is now 5:39. Those of you joining us around the world, it's been an absolute honor having you joining us right here from the beautiful city of Accra, from the wonderful nation of Ghana. Excellency ministers, excellencies from all over the continent, our allies, our partners, our governments, we want to say a very big thank you. Your presence here, both in person and online, is an endorsement that you do indeed believe in this strategy. The World Bank Group Regional Health, Nutrition, and Population Strategy for West and Central Africa, ladies and gentlemen, is live and with a theme so befitting: Fit to Prosper, investing in health for jobs and development in Western and Central Africa. And now, as my wonderful sister, Ms. Hack, said, the work begins. My name is Anita Erskine. It's been an absolute honor to serve you as a mistress of ceremonies. From here on, I would like to say it's time to celebrate Africa. Thank you so much and have a wonderful evening. And please do go home with a little bit of Ghana jollof. God bless you all. Our stage is free for photos. Please take your selfies. Please take your photos. Tell the world what has happened here in Accra, Ghana. Thank you so much, ladies and gentlemen. Travel safe and travel well.
The sun is up, spirits high, people everywhere. Yeah. The food is good, the wine is fine, people getting high. Yeah. Mama here, Papa there, the whole gang too. Yeah. Everybody's dancing, celebrating all night long. Celebration, jubilation, come together, all together. Celebration, jubilation, all together, all together. Folks are jumping, screaming, and shouting, party everywhere. Yeah. Call on friends, let's join hands and make the sun shine bright. Yeah. Why don't you come right in and have a good time too? Yeah. Everybody's dancing, celebrating all night long. Celebration, jubilation, come together, all together. Celebration, jubilation. All together, blow your horn. When you're all alone, nowhere to go. Yeah. The sun is out, spirits high, people everywhere. Yeah. Mama here, Papa there, and the whole gang Everybody's dancing, celebrating all night long. Celebration, jubilation, come together, all together. Celebration, jubilation, all together, all together, all together, all together. Folks are jumping, screaming, and shouting, party everywhere. Yeah. All our friends, let's join hands and make the sunshine bright. Yeah. Why don't you come right in and have a good time too? Yeah. Everybody's dancing, celebrating all night long. Celebration, jubilation, come together, all together. Celebration, jubilation, all together, all together, all together. Blow your horn.
Hello? Planning committee, please come up. Retreat planning committee, we need you upstairs on the stage for a group picture. Rocio, Abby, Netzanet, Owen.
Everybody's dancing, celebrating